Recording in progress.
For sure. And I just said, he said we must keep time. Not that I don't want to keep time, but sometimes I don't always keep. But so we're oh, is that the monitor they use it?
Yeah. No, we don't have to now.
No, I realized, but I looked back to see if there was anything there. Hi, Mr. Ramon. Yes. Yeah, because we're going to have a question and answer period. You got that? No, I'm just asking we need a microphone over there. Yeah.
You remind me, you're gonna do it first, and then I think it's done
Yeah. I'm doing Jonathan. Good morning, everyone. I'm going to say it again. Good morning, everyone. Welcome.
Good morning. Welcome to the second Congress on Adolescent and Youth Health. Building Back Better, Advancing and Safeguarding the Health and Well-Being of Adolescents and Youth in the Caribbean. Are you all excited? I want to feel the excitement in the room because this is a very exciting opportunity. This is the second Congress. We had the first one in 2019. And of course, welcome to Jamaica. Welcome to all persons joining virtually and those at our satellite sites in Belize and Trinidad and Tobago. My name is Therese Lord. I am the former CARICOM Youth Ambassador of Trinidad and Tobago, and I am a member of the PAHO Youth for Health group. I will be your co-moderator.
My name is Sheila Campbell Forrester, probably one of the longest serving adolescent health professionals in the Caribbean and a former chief medical officer. I just want to say it is so good to see all of you here today and all the old friends from the first Congress. Okay, give yourselves a round of applause.
The flow of this morning's session is as follows. We will have presenters that will speak for about 15 minutes each, and then we welcome questions from the floor. So while we retrieve the bios, I just want to promise you that we have a lineup of extremely dynamic speakers, experts weighing in and providing their insights, as well as their professional vantage point where adolescent health and well-being is concerned.
Our first speaker will be Dr. Jonathan D. Klein. He's an Associate Vice Chancellor for Research and the Savitri and Samuel Raj Endowed Professor of Pediatrics and Executive Vice Head of the Department of Pediatrics at the University of Illinois at Chicago College of Medicine. A specialist in adolescent medicine, John is a health services researcher known for his leadership in adolescent preventive services, youth development, and tobacco control. He joined the faculty of UIC in 2017, having spent from 1992 to 2009 at the University of Rochester School of Medicine. And he was also Associate Executive Director at the American Academy of Pediatrics, where he had oversight for research, global health, publishing, and tobacco control. He currently serves as president of the International Association for Adolescent Health on the Accountability Work Group of the PMNCH, that's Perinatal, Maternal, Neonatal, and Child Health Partnership for Women's, Children's, and Adolescents' Health, and as treasurer and a member of the Executive Committee of the International Pediatric Association. He's also a member of the Society for Adolescent Medicine. Let us welcome Dr. Jonathan Klein to present.
Good morning and thank you. I'm really sorry that I can't be there in person. because it would be lovely to be in the room with you. And if I'd known you were going to read the whole bio, I would have made it shorter. But let's move on to the presentation. I actually thought that Anshu was going first in this session from the agenda, but we'll manage to make that work anyway. Let me go ahead and see if I can get the slides up. What I'm going to talk about this morning is, can you see the slides and hear me still?
Yes, we can see.
Great, thank you. So I'm going to talk very briefly about adolescent health and what's happened with the COVID pandemic, and touch on the call to action for adolescent health and wellness. This audience knows, you know, the biopsychosocial approach to adolescence, recognizing that we as health professionals think about the changes, the biological changes of puberty, the psychological, cognitive maturation that goes on, and the social issues that go on in the transition from dependent children to interdependent adults. And we think a lot about the healthy and risky behavior that young people engage in. Whereas our patients and the adolescents that we serve think about their family and their school and their friends, and don't really think about what's happening in the background there. But I'm making the case that George Patton and others have made, that investing in adolescent health not only affects adolescents' present health and well-being, but also affects their future adult health, especially when it comes to chronic illness, and affects the health of their children. If we want to achieve the maternal and child health goals globally, we have to look at better investment in what's needed for our young people. So I ground this in the Sustainable Development Goals, which, as you know, number 3 is the good health and well-being goal, but many of the goals really address health-related issues, whether it's the elimination of poverty, zero hunger, quality education, gender equality, and on and on. And recognizing that, unlike the Millennium Goals, the Sustainable Goals call on all countries to address these outcomes for their whole population and to eliminate the disparities within countries when it comes to achieving the goals. I also want to mention the World Health Organization's Global Action Plan for the Prevention and Treatment of Non-Communicable Diseases, because the 5 diseases that are identified, cardiovascular disease, cancer, pulmonary diseases, diabetes, and mental health, and the 5 risk factors, tobacco, diet, alcohol, physical inactivity, and environment, are all related to behaviors and choices that start during childhood and adolescence. So when we think about prevention of the non-communicable diseases, it really is the opportunity to address the health of the young people that we're caring for as adolescent clinicians. Non-communicable diseases are responsible for 41 million deaths a year in the world. 70% of these are in low and middle income countries. And again, the major conditions account for the vast majority of these. But it's important to remember that the NCDs affect children too, that more than 40% of the world's population is under age 25, that there are 1.2 million deaths from non-communicable diseases or injury in people under age 20 each year, and that this is about 13% of all of the non-communicable disease mortality. Again, the risk factors start in childhood and youth, and children also still die of treatable non-communicable diseases, including rheumatic heart disease, leukemia, asthma, and diabetes. Your survival chance if you have acute lymphoblastic leukemia in highly industrialized, high-income countries is well over 95% these days. And in many of the low-income countries in the world, it's still well below 50%, a combination of access to medicines and access to treatment systems. Again, the NCD agenda is closely related to the child survival agenda. Nutrition, both malnutrition and obesity, the impact of tobacco and secondhand smoke and alcohol and drugs, injury, the mental health impact of toxic stress and its effect on early brain development, affecting children's well-being, and again, the environmental impact. And access to care makes a huge difference for some of these factors. Now, this is the adolescent well-being framework that WHO and the other UN agencies have come to consensus around, with a long process that through consultation with many, many different groups and professionals that have sort of ended up with these 5 domains contributing to adolescents' well-being, where adolescents thrive and can reach their full potential. I'm not going to read them in detail, but it's good health and nutrition, connectedness and contribution and positive values for society, a safe and supportive environment, learning competence, education and skills and employability, and agency and resilience, adolescents' ability to be active in their own activities. These are not just health goals. These are really all of society goals, but they reflect the goals in the call to action that's been issued around improving adolescent health and well-being, which we'll talk about a little more. Now, this really put us in a situation where the SDGs were calling for equal opportunities and countries prioritizing their most vulnerable. And it was very optimistic. We had an opportunity to scale up prevention for children and youth, to expand evidence-based interventions, to expand the quality of frontline health worker delivery of care to young people. And then came COVID. And this really has had an enormous setback when it comes to global goals for adolescents' health and well-being. So this was a unique combination of a public health crisis globally, not just a local one, social isolation because of school closures, and an economic recession caused by the virus and its related impact on society. This resulted in significant disruptions to routine care services. You can see that globally, 35% of adolescent health and nutrition services continue to be disrupted in countries to more or less an extent. This is worse in lower income than higher income countries, mostly because the health systems are less resilient. And our ability to even know what's happening, the data and surveillance systems were significantly disrupted, both by the school closures, but also by surveillance staff being deployed to pandemic response activities. Now, I'm going to just briefly talk about some of the impact on major health issues for adolescents, thinking about those different preventable non-communicable disease categories. So, for example, for mental health, COVID has led to somewhere between a 25 to 28% increase in post-traumatic stress disorder, in depression, and anxiety, and grief-related symptoms for adolescents. It's been worse in places with highest rates of COVID among young women and among younger people in general. Again, mediated by individual and family vulnerability and coping and resilience, and some optimistic data that coping strategies such as keeping a routine, being physically active, positive reappraisal and reframing are associated with reduced distress. This data from the Zurich longitudinal study that was already underway. In places with prolonged school closure, the impact on mental health has been worse. It's still a concern. This graph shows the suicide presentation rates for young people aged 12 to 25 in the US. And you can see the lines for 2019 and 2020 on the bottom there, but the rates have been higher in 2021 and continuing to 2022, significantly higher than in prior years, suggesting that the chronic impact on mental health continues to be of great concern. And what to do about this remains really a challenge for many systems. When it comes to food and eating, there's been increased hunger and food insecurity from the COVID pandemic. 2.3 billion people moderately or severely food insecure, worse among women than men. This is due to country disruptions in food supply and food prices and loss of family income and in price inflation as well. Eating behavior in general from surveys is both better and worse. People who were more obese were more likely to eat more. People who were less obese were more likely to eat healthier in general from most of the surveys. School food program closures had a big impact on children's access to healthy food. Physical activity, a meta-analysis recently showed that there's about a 20% decline in exercise among populations, worse for more vigorous exercise opportunities. An eating disorder evaluation, again, a meta-analysis in 26 studies, both restrictive eating disorders and bulimia, but also overweight, obesity, found that in general, people with disordered eating of any sort did worse. There was symptomatic deterioration in people with eating disorders. Again, about half of the people who were already obese increased their weight. And obesity is a significant COVID risk factor for more severe disease. And people with eating-related issues had over a 50% reported rate of both depression and anxiety symptoms. When it comes to sexual and reproductive rights and health, there were both direct and indirect disruptions in family planning services, reduced access to care, closures of clinics, limited supplies, staff deployed to the pandemic, especially sexually transmitted infection, surveillance staff, disruptions in education and social development, in immunizations affecting HPV rates. And in general, there mostly have been decreased sexually transmitted infection rates, although about a third of young people reported they were still meeting friends face-to-face, even during the most severe times of lockdown. There were disruptions in interventions to reduce child marriage. There were significant increases in adolescent pregnancy rates because of the disruptions in family planning reported in papers out of both Ethiopia, South Africa, and Kenya in the past year. And there were changing use of sexual and reproductive health preventive and screening services. In the US, our electronic health data showed HPV vaccinations were down by 68%, more so than other vaccines. Globally, about 25% of HPV vaccine coverage was lost, and we were already starting out in the worst place there. And this has not recovered in the way that early childhood immunizations have come back when it comes to routine service delivery. And then finally, for drugs and alcohol and tobacco, again, drug use can increase the risks associated with COVID. Social distance, isolation, and quarantine can also intensify drug use, but most of the surveillance systems were disrupted. And data that has come through, alcohol and marijuana use has remained fairly stable. For tobacco and electronic cigarettes, similar to the obesity and eating issues, there were some increases and some decreases. People were more likely to try and quit, and some people were more likely to relapse. The industry did some significant misinformation campaigns. In general, perceived risk of smoking led to more quitting. And in fact, smoking is a risk factor, and secondhand smoke is a risk factor for more severe COVID, but there's very little surveillance of that evidence. And interestingly, the past 30-day vaping, electronic cigarette use from CDC's new surveys of adolescent behavior, adjusting for the lack of a full school frame, showed that 25% of in-school students reported past month use, and only 9% of those who are virtual. So we continue to see social transmission in school settings and very high rates of e-cigarette use. It's important to remember that COVID itself is becoming a common chronic disease, and the post-acute COVID or PASC or long COVID syndrome still leaves us with a lot of unknowns about who's most at risk and how are they affected. And the prevalence of long COVID is running anywhere between 12 and 45% of people who are infected. This varies with which virus strain, which wave you were in. Earlier strains seemed much worse for this. More severe disease is worse. And also immunization is protective. But this is going to be an entirely additional and new population when it comes to the chronic conditions and the need to have systems and services to address them. A couple of points that I'd like to make, and Anshu will talk about the call to action. This is a global call to action from PMNCH, and it's really framing adolescent well-being as a priority for governments, for civil society, for professional organizations. There are three priorities: engaging and empowering adolescents, going beyond the health sector, and strengthening a political commitment through a global forum. I want to spend just 1 minute, if I still have it, on IAAH, the International Association for Adolescent Health, because we are committed to the call to action. Our priorities as an organization include leadership and engagement, education and training, policy and advocacy, and youth engagement. And I just show you our council because it really is a global organization of adolescent health professionals. We're very fortunate to have Asha Pemberton on your team there as our Caribbean vice president, but you can see that the leadership is from across the globe. Our young professional network, or YPN as it's called, has a leadership of folks, again, from across the globe, young professionals working in adolescent health with a very robust committee structure. And I would invite you to check out our website, the YPN part of the website, and to consider ways that you can be involved in helping engage professionals around advocacy and education to improve adolescent health. The YPN has more than 500 young professionals in the network and is representing folks from 86 different countries. And I'm just continually impressed by this because they built this network in about 3.5 years during the pandemic, and more than 400 of the YPN came to our last Congress, the Global Congress in Peru last year. So just to summarize, issues for young people, the strategies to actually address prevention and reduce risks are moving slowly. They're competing for resources with other services. Surveillance systems, public health programs, and clinical systems that actually address adolescents' need continue to be stressed. And we need evidence-based advocacy to prioritize young people's health and well-being if we want to address the call to action and if we want to reach global goals. One of my mentors, Dr. Julius Richmond, who was a U.S. Surgeon General and who was very instrumental in actually recognizing that tobacco affected children, always used to use this framework of scientific knowledge and social strategies and political will are all needed to get the job done. We have the scientific knowledge around what prevention is needed and what systems and services are needed to have good care for our adolescents. We have the strategies to implement those in our health systems, in our schools and education systems, and in our communities. Whether we have the political will to do so is really where the call to action is heading. And it's an opportunity for us as adolescent health professionals to bring our voices to bear to try to convince our governments that now's the time to invest in adolescent health. So let me stop there, and I hope I've stayed inside my time, and I look forward to the discussion and questions.
Thank you very much, Dr. Klein. And we await the question and answer period.
At this juncture, I would like to warmly welcome to the stage Dr. Sonia Cafe. She is a national from Suriname. She has a master's in health sciences and a master's in public health with concentration in international health, a PhD in public health from the University of New Mexico. She holds a university certificate in sexual counseling and is a certified master health education specialist. Prior to joining the UN, Dr. Cafe worked at the Ministry of Health in Suriname and at the University of Suriname. She's been with the UN for more than 20 years now, including 4 years with UNICEF, and for the past 17 years with PAHO, WHO, on country, sub-regional, and regional level, working in the areas of HIV, STI, epidemiology, and health system strengthening, and since 2015 as the Regional Health Adolescent Advisor. Let us warmly welcome Dr. Cafe to the stage as she delivers her presentation on the status of and current priorities for the health and well-being of young people in the Caribbean. Dr. Kafi.
Thank you very much for this kind introduction. I apologize in advance for my voice, still recovering from something. Let me also start by saying I'm so happy to be here and to see all of you, many faces from our last Congress in 2019 and some new faces. I'm very pleased, very happy to be here and to share these days with you. So in my 15 minutes, I'm going to try and elaborate a bit on what John presented with some data, some information specific to the Caribbean. So if we look at the health and well-being of young people in the Caribbean, we have to start with survival. You know, also in the SDGs and in the Global Strategy for Women, Children, and Adolescent Health, there are three things that we want to achieve. First, survive, to end preventable mortality. Thrive, to ensure that people can live to their full potential. And the third one is transform, to transform our environment, to facilitate people's development, their health and well-being. Now, if we look at the data from our region, and when I say our region, I mean the Americas and in the Caribbean, we have an unfinished survive agenda. We have not progressed much when it comes to preventable mortality. In our region, 60 to 80% of young people die from 3 causes that are all preventable, which are, of course, I'm sure you know, homicide, suicide, and land traffic fatalities. So we do have an unfinished agenda when it comes to survive. And of course, later on, I'm going to elaborate a little bit on thrive. So let me try to go into a little bit more depth when it comes to the Caribbean specific. And I know that there's a lot of lines in the slide that you are seeing, but just follow the red line, because the red line represents the Caribbean. It also gives us, these slides give us an opportunity to see how the Caribbean is doing compared with other subregions in the Americas. And so if we look at this slide, you see on your, I think it is your left, we have the males in the age group 10 to 14, and on your right, the females in the age group 10 to 14. And so the 5 leading causes of death of young men in the Caribbean are interpersonal violence, homicides, land traffic injuries, leukemia, self-harm, and drownings. And if you look at the trends, in fact, these trends are quite promising. If we look at the trend between the year 2000 and 2019, that honestly, when it comes to homicides, it seems like it has been going down with a little increase again towards the end of 2018, 2019. This is the whole Caribbean. It doesn't mean that it's the same trend for all the countries, but at least it's a promising trend. Now, if we look at females, there's a little worry there. Again, look at the red line. The leading causes of death for females age 10 to 14 are road injuries, interpersonal violence, self-harm, leukemia, and congenital anomalies. And if you look at the leading cause, which is road injuries for girls, you see that's going up. So that already is an area of concern. Why is it that we cannot make our traffic safer for our young girls? Now look at the age group 15 to 19. And again, just follow the red line if you don't want to compare how we are doing compared with other regions. At least here we can see again that there is no increase in the leading cause of death of young people aged 15 to 19, which is again interpersonal violence, but also it has not gone down. So that is an area of concern. We see again the road injuries, the self-harm, the drownings, the drug use disorders are coming in at age 15. So that's where we begin to see, we know that young people start using drugs earlier, but around age 15, that's where it's really beginning to impact mortality data. And when we look at females in the age group 15 to 18, again, follow the red line, no improvement in the leading cause of death, which is road injuries. And what is really interesting in this group is we see a new cause of death is being introduced, which is maternal conditions. Young girls 15 to 19 in the Caribbean, and because this is all data from the Caribbean, maternal deaths are the third leading cause of death. When we are talking about preventing unwanted pregnancies, unplanned pregnancies, we speak a lot about the impact it has on the conditions of living of our young girls. It has a direct impact on their death, their lives. And so again, that's being introduced, maternal conditions as a leading cause of death in adolescent girls in the Caribbean. And then since we are talking about adolescents and young adults, here we see the trends in the age group 20 to 24. And I'm not going to elaborate too much on it, but again, we see the same causes, the same preventable causes, and no improvement. A little encouragement is that we see that there is a reduction in self-harm, that's to suicides, in the females in this age group. But other than that, in all the other leading causes, we see no improvement or an increase. Now we're going down from mortality to what we call years of healthy life lost. I'm going to say YLD. That is a reflection of poor health. It goes beyond just death, but it shows how poor or not poor the health of the population is. And here I'm starting with the age group 20 to 24. If you are able to not only follow the red line, the thick blue line shows the regional average. And so you can see how our region is doing compared with the regional average and the other subregions in the Americas. And so what are the leading causes of ill health, the YLDs, in the Caribbean? Drug use disorders in young adults, 20 to 24, depressive disorders, anxiety disorders, migraine, and then you have back and neck pain in the young adults. In the age group 50, and this data was both genders. In the age group 15 to 19, you also see again the same depressive disorders, anxiety disorders, back and neck pain, migraine, drug use disorders. You're beginning to see the pattern, right? The things that we know are affecting the health and well-being of our young people, and that we cannot say we don't know where to start. We don't know what the burning issues are, because the burning issues are very clear in the data. And then when it comes to the age group, in the previous slides, if you have been able to follow, the average of the Caribbean was always below the regional average. And when it comes to 10 to 14, shockingly, the leading causes of poor health are way above the regional averages. And what is the leading cause? Childhood behavioral disorders of poor health, the leading cause of poor health. And again, we have anxiety disorders. As John said, the whole issue of mental health is very clear in the data. And what is important is to note that the mental health crisis of young people existed before COVID-19, and COVID-19 has just made it worse. So if we look at another area, there's many other areas to look at, but I only have 15 minutes. I just want to touch briefly on adolescent pregnancy, because again, that's also one of the public health problems that continues to plague our young people. And here you see again, the red line is the Caribbean. You see the trends in adolescent birth rates in the Americas by sub-region. And we're encouraged if we see that the line is going down everywhere, including in the Caribbean, but it's going down very slowly. If we compare our downward trend with other regions, our region actually has the slowest trend of decline when it comes to prevention of adolescent pregnancy. On top of that, it is not equal in all the countries. Here you see the variances between countries. On the high side, we have some countries, including our host, Jamaica, Suriname. Suriname is my country, Belize, Guyana, Dominican Republic are the countries with high elevated adolescent birth rates compared with some of the others. And so again, the burden of adolescent, say, undesired sexual and reproductive health outcomes is much higher in some countries compared with others. Throughout the Congress, you will hear a lot more about this. My little talk is only to give you a little a sketch of where we are. John also mentioned the theme of leaving no one behind, of equity. And again, if we analyze data, we see in the Caribbean, we see that there's really inequities based on where a person lives, their education level, their income level. And this is just an illustration of applied to adolescent pregnancy, where we see that adolescents in countries, selected countries, by wealth quintile, income level from their families, and also by education level, have much higher risk of an early unplanned pregnancy. And this doesn't only apply to adolescent pregnancy. If you do this analysis, even for land traffic injuries, you see that some groups are much more affected compared to others. There's no equal distribution of undesired health outcomes. I'm almost there. When we talk about the social determinants of adolescent and youth health, we see that, I'm just going to mention a few. Unemployment among youth is much higher, 3 times higher than among adults, and girls are more likely to be unemployed or underemployed. We have the enrollment in schools. It's not very high, and secondary school completion is also not what we would like it to be. Until now, we still have higher percentages of girls in education, but girls are more likely to drop out if there is an issue, and including if there are school closures. Here, I just want to stick a pin on the issue of boys, marginalization of boys in health, development, and well-being in our region. So I'm just going to finish with some considerations. Young people in our region, in the Caribbean, face persistent legal, policy, societal, and health systems barriers. There is insufficient investment in programs, in interventions, and John mentioned that, that's globally and definitely here in our region. Youth participation is limited and ad hoc. With this conference, we're trying to create a space for full youth participation, and young people are disproportionately affected by poverty, unemployment, underemployment. All these factors affect their health and well-being. So what are our priorities at PAHO? First of all, we want to encourage our member states to increase strategic investment in adolescent and youth well-being, to support and develop multi-sectoral and equity-based program planning and implementation, to expand adolescent responsive health services, to implement evidence-based interventions in schools, families, and communities. We still see too much in countries that people experiment. Let's try this. This can be fun. Youth will like it. We're beyond that. We have enough evidence to do our research and select evidence-based interventions. And of course, we do want to encourage youth participation, full youth participation in every aspect of the response to improve their health and well-being. Thank you very much for your attention.
Thank you, Dr. Kape, for that extremely insightful and thought-provoking presentation. And of course, you will have an opportunity to ask questions afterwards. At this point, I welcome to the stage Kendall Vincent. Kendall is the chairperson of the Caribbean Regional Youth Council. He's a youth development and communications professional from Trinidad and Tobago, and he is very passionate about what he does. He will be weighing in on the challenges and priorities for the health and well-being of young people in the Caribbean from a youth's perspective. So welcome, Kendall.
Good morning, everyone. Good morning. We're from the Caribbean. I think we can get a little bit more energy than that. So good morning, everyone. Yeah, that sounds better. Let me firstly, of course, take this opportunity to thank each and every one of you all for better now. Okay, good morning, everyone. Let me first and foremost thank each and every one of you all for taking time, to be here this morning. I just want to start, just give yourselves a round of applause, like let's raise the energy level up this morning. So good morning, everyone. Once again, my name is Kendall Vincent, and I thank you for this opportunity, of course. We're better? Great. So my apologies for that, but I just want to take this opportunity, of course, to thank the organizers for giving us this opportunity as young people to be here and to present and share. I know this might be daunting because as young people, we have a lot of challenges, isn't that right? Young people, isn't that right? We do have a lot of challenges. So my presentation this morning really just gives a sort of brief synopsis as to the challenges and priorities for the health and well-being of young persons. And this is from a youth perspective. So I know the presenter before would have kind of like outlined and shared some of those challenges, but I'm just gonna give it a bit of twist and share it from a youth perspective. So who am I? Of course, who's this person coming to present to you this morning? My name is Kendall Vincent. I'm the chairperson of the Caribbean Regional Youth Council. I'm also from the beautiful Twin Island Republic of Trinidad and Tobago, where you get a lot of pan, soca, carnival, you name it. That is what Trinidad and Tobago, that's part of our culture. But I'm here representing the Caribbean. So no matter where you're from, whether you're from Jamaica, Antigua, Anguilla, Bahamas, wherever, or Jamaica, I'm here this morning representing you this morning. So that's a little bit about who I am. I've been involved in doing a lot of work with sexual and reproductive health. I was also a part of the Youth Committee for the National AIDS Coordinating Committee in Trinidad and Tobago, and I've been doing work surrounding young people and health for quite some time. I think it's only probably like 7 or 8 years, but let's get into it. So one of the first things is that we have to be able to ground this, and I want us to look at. I want to paint a picture for you this morning as to our reality as young persons, and then we'd understand why it's important for young persons to not just have a seat at the table, but also be involved in this evidence decision making that my previous presenter would have spoken about. So according to the United Nations World Population Prospects in 2015, they identify that young persons between the ages of 10 to 24 years comprise 25% or 10.8 million of the total Caribbean population. I just want to also paint a wider picture in terms of not just within the Caribbean, but young people comprise 60% of the Commonwealth. And what that tells you essentially is that a significant part of the population or the youth population that is makes up or comprises the Caribbean. So you can see based on that synopsis that young persons, if we're talking about 60% of the Commonwealth being young persons, we're talking about over 1.8 billion. And the UN would have also quantified that in their report in 2015. We can see how, therefore, it's important that conferences such as these and why youth needs to be, engaged. So the Caribbean, going further, and I want to be able to, because it's important to know that this is not the beginning. We have to link what would have happened before in the previous conference, the Congress, to what is happening now. So I'm just quoting from the first Caribbean Congress on adolescent and the roadmap, and I think that is very much important. If you have not yet accessed the roadmap, I want you to, of course, visit the website and access the roadmap, because I think that is important in terms of bringing further context to what is presented here. And it shows basically that there are major disparities in the health for young persons, and this is caused by, of course, financial, societal, health systems and barriers young people face to accessing health information and quality health services that responds to their needs. And it goes further to show that in places such as Guyana and Suriname, the rate of suicide is high. It speaks about the high adolescent fertility rates. And it also speaks about, this one is a bit, because I've been doing some work in young persons as it relates to HIV. So HIV epidemic is extremely high among young persons. And of course, we also want to look at, because I think it's important that we look at, of course, inclusion, not just their young people face additional levels of marginalization if you come from persons who would have identified from special communities and other communities, especially along the LGBTQI spectrum. So we can see that based on with disabilities as well. Regardless, we know that young persons face challenges as is, and there are also other special groups, I would say, that also face additional challenges on top of the burdens that I would have painted previously. So we know that young persons, and there are a lot of challenges facing young persons today, but I'm just going to focus on essentially 2 to 3 of those challenges. And I linked challenges and priorities because, of course, the challenges really sort of identifies and would place what are the priorities. So these are our challenges, and I'm saying here that this also should be, or this must be looked at in terms of priorities. So let's look at mental health, and the Caribbean Regional Youth Council, the organization that I have the opportunity to serve before lead this organization, also known as CRIC. We conducted a survey, and I just want to recognize, of course, the hard work of the entire team, which would have led by, he's now Vice Chair Policy and Advocacy, Mr. Shamal Wedderburn, who's in the audience here, volunteering and exceptional. We all volunteer, but the work of the former executive and that of Mr. Wedderburn regarding this regional youth survey that we would have conducted last year, because we were operating from a sense and what we work, and we, from the Caribbean Regional Youth Council, we like to fashion our strategy and our advocacy based on, of course, we have to understand where we are, what is happening with young persons and young people. It's a very dynamic, we're a very dynamic group of persons, young persons, don't you agree? Aren't we dynamic? Yeah. Great. So during the pandemic, we would have conducted in 2021, actually, we would have conducted a survey to understand what were some of the challenges facing our young persons, and key among the challenges. And I think number one would have been tied towards uncertainty regarding the future. Could the young persons in the room identify that? Could you all agree that that has been one of, during the pandemic, you know, while we're in quarantine, a lot of the things and plans that we had in place were, you know, we were kind of like uncertain as to when would this end, what is going to happen, you know. Don't you all agree that that would have been one of your number one uncertainty? Would I be alive? Would I, you know, would I survive this thing called COVID? But, you know, kudos, of course, to the health professionals and, you know, everyone involved in the fight against COVID. And we had a lot of young persons on the front line doing exceptional work, that we're here to survive, that we're still surviving, and that we're here today. So I know that COVID for me, and I just want to bring this a little bit personal home, and I think in my interactions, many interactions with young persons, I think mental health, one of the top thing that we would talk about, uncertainty surrounding the future, and then of course your mental health. And I think that has to be, and I know October is normally mental health day, so we see a lot of the green ribbons and all that. But mental health is something that is real, and is something that, you know, we've all had to, you know, I would have had to, you know, encounter, because I think COVID really, in those moments when we were quarantined in our rooms and in our spaces, we had to like really look at, you know, everything that is happening around the world, what is happening with my life, where, you know, what's next. And I think in those moments, in those solemn moments, that we had to mental health really sort of, I think during COVID really sort of taught me really the importance of, you know, mental health, and of course our mental well-being, that is. And I think that is one of our main challenges as young persons. Another one is access, and I say access, or adequate access. So to more so further quantify that, and my colleague, you know, in reviewing this, would have also added, you know, nutritional and health, access to, you know, proper nutritional health and food and nutrition. So I think those are some of the three main challenges in terms of mental health: access, and of course, you know, healthy access to healthy nutrition. Those are some of the three main challenges that our young persons are facing. And some of the data would have come out from the Caribbean Regional Youth Council survey that we had. I just want to make a plug here for persons who are probably hearing about the Caribbean Regional Youth Council for the first time, essentially who we are and what we do. We're an organization responsible for working with a dynamic group, with a regional coordinating body for youth councils, national youth councils across the Caribbean. And we work not just with national youth councils, but organizations across the Caribbean. So you can follow us at our CRIC, OURCRYC. We're available on Facebook, Twitter, TikTok, LinkedIn, you name it, we're there, to learn a little bit more about the work that we do. So we work across different issues. And I just want to see that our challenges, the challenges I would have identified before, that needs to be, I just want to use this platform here to say that those challenges need to be prioritized and continuously needs to be placed at the forefront. So I know that I would have spoken a bit about the challenges and priorities. How about solutions? Because I know sometimes we as young persons are, you know, accused, or basically we're painted as persons that, you know, feel easy to you know, complain, you know, but what are your recommendations? How can we change that? So I just want to see, and it's very important that I continue to refer to this document, or this roadmap document, because kudos, a lot of work would have been placed in putting forward this, and I want us to not just, you know, put it as a document at this side. So I would encourage you, continue to plug that. You need to look at the documents. And one of the first things is that one of the first recommendations that I like to put forward is providing young people with a seat at the table in decision-making spaces. And I don't think that sometimes we put young persons in these spaces. We put just putting a young person's seat, just put them, to see that we have youth representation. But I really want that for decision makers in the room, those who are listening, those are in a position, even as young persons, you may be in a position to put another young person or to plug a young person, as we would like to see, in a space. So whoever we are, whenever we give young persons the opportunity to make a space at the table, we should be ensured that young persons are actually engaged in the several aspects of it. So we will look at providing youth with a seat at the table in decision-making spaces, fostering an environment for intergenerational collaboration. And the team of International Youth Day this year spoke about intergenerational spaces and the need for, because we as young persons cannot do it alone. We do not know everything. And in order for us to really make a positive change and impact in terms of addressing adolescent health issues, we need to understand that we have to work together. We have to work together. Could I hear that? Could I hear everyone in the room repeat that? We can only do it together. So after 4, 3, 4, we can only do it together. Let me hear you all. Let's go. 1. Great. And I just want to that is one of the things that, solution that we have to be able also our role as part of that jigsaw puzzle, every piece in the puzzle would create that, puzzle. You can't do it without, if a piece missing, it throws the whole dynamic off. So we want to utilize appropriate network and social media platforms. We have to be able to meet our communities or where they're at. So if they're in the LinkedIn and the TikTok, that's the thing now, we have to be able to meet them or meet our young persons. We want to expand and develop capacity, technical and civic engagement. So we know that our elder persons have a lot of experience, a lot of expertise, but we want to ensure that that trickles down and that everyone can benefit, so expanding and developing youth capacity, as well as facilitating political commitment and support throughout the process. And those are, what I would, use the opportunity to reaffirm that these are some of the commitments that need to be made in order to move those challenges towards, actually from challenges into, our success story. So once again, I want to take this opportunity, of course, to thank each and every one of you all. You all have been an excellent audience. And I just want to close by just giving yourselves one more round of applause for youths, for the organizers of this platform. Have a good everyone, and thank you for the opportunity.
Thank you, Kendall, for an interesting presentation. Our next speaker will be Dr. Elizabeth Lloyd. She is an expert in monitoring and evaluation. And as you heard from Kendall, an output of the last conference was the Caribbean Roadmap. Today, Dr. Lloyd will present some key results and achievements of the Caribbean Congress on adolescent and youth health. So I now invite Dr. Lloyd to present findings for us. She's presenting from Trinidad.
Yes, thank you, Chair. Thank you, Dr. Forrester. Good morning, ladies and gentlemen, young persons and those who are young at heart, to use a quotation that was formed a central part of our Congress last year. Thank you for having me. I am very pleased for the opportunity to share with you the results of the work that was done in an attempt to receive feedback on the progress that was made since the last Congress, which was held in 2019 here in Trinidad. And I must thank your last speaker, Mr. Vincent, for highlighting a number of times the roadmap and saying that if you have not seen it, please be sure to take a look at it and continue to use it. So I had the pleasure of participating quite fully in your last Congress and playing a role in pulling together that roadmap, but also the monitoring and evaluation component of the roadmap. So this morning, I'll be speaking about the attempt at sharing with you a snapshot on what has been achieved against the call to action, which forms an integral part of the roadmap report. This roadmap contained not only a summary of the inaugural Congress's proceedings, it also contained a clear call to action, which was indeed endorsed by a number of regional, international, and indeed, I am certain many of you who are present at this year's Congress. The roadmap also contained a chapter which articulated the M&E component, which was titled, "How Will We Know We Have Brought the Congress Actions to Life?" And those of you who have access to it, you can actually pull up and read and review that component, both the call to action as well as the roadmap outcomes, so that you can use this indeed as a springboard in the current Congress, and even as you hear a bit of a telescopic report on what was done. We conducted a survey that was focused on a number of key outcomes that were articulated in the call to action of the existing roadmap. The methodology involved use of a list of Congress country and regional focal points, including a list of the attendees. This took the form of an online survey using a SurveyMonkey tool that was pinned to your email addresses that were reported during the Congress in 2019. The online survey was conducted starting in July of this year, and it was not closed. In fact, up until yesterday, I am able to review the results that continue to come in, even though I must say the needle is not really moving in terms of the number of results. We also sent out a number. The SurveyMonkey, as you know, generates automatic reminders and quite nicely worded to encourage persons to either continue to complete or to provide us with the feedback. Now, that tool included invited respondents to speak to what they were aware of as happening in their country or regionally. They were invited to say yes or no whether a target was met or being implemented. They were also given the opportunity to provide qualitative feedback, to describe what some of the activities or initiatives, so provided quite interesting information. We then synthesize these results and have them ready for you in a PowerPoint presentation. I must say that due to the time limitations, I am only able to share with you a snapshot of the indicators aligned to each of the Congress thematic areas. A more complete report would form part of that narrative report in which you will see the feedback on all of the indicators or all of the outcomes. I was able to receive a response rate of 10%. So we had 7 respondents from responses from Guyana, Jamaica, Suriname, and Trinidad and Tobago. And I must thank Lucian Govard for his support in encouraging persons to provide this feedback. I think without his input, we may not have gotten even the few responses that we were able to receive. And I expect that going forward with the input and collaboration of my colleague, Kendall Vincent, and many of you in the room, we would be able to solicit and gain a more comprehensive and more structured feedback. In fact, in my last slide, I will make a recommendation for your consideration for how we may go about increasing the level of feedback that we receive post-Congress. So by way of sharing with you the results, I must say that all of the respondents indicated that there was actions, that there had been actions over the period of 2019 until 2021 against each of the Congress thematic areas. And these include mental health, sexual and reproductive health, nutrition, as well as climate change. So you all noted that there was progress around each of these. Now, when we look at the actual Congress outputs, the actual Congress outcomes at the regional level, the extent to which these actions would have shifted the needle is where we need to pay closer attention. I must recognize the work of the Interagency Committee comprising PAHO, FPA, and a number of UN agencies in implementing their joint work plan, which indeed is focused around the roadmap outcomes. And the more fulsome report certainly will include these activities that continue to be implemented. So let's look at each of the thematic areas, starting with mental health, substance use, violence, and injuries. And we heard from my co-panelists, Dr. Cafe, that this area continues to be one of leading causes of death among young persons in the Caribbean region, and that the Caribbean region is leading the region of the Americas when it comes to issues of violence and injuries, substance abuse, and mental health challenges. So the respondents were asked to indicate the extent to which the roadmap is being implemented through coordinated interagency action at their country level. 60% of respondents indicated that this was the case. In terms of the qualitative highlights, I heard that not that much is being done, but it is being used by international NGOs and indeed if I may add, the UN agencies in implementing and informing their work plans at the country level. I heard as well that the youth ambassadors are fighting for a lot to occur, but they haven't seen any major changes in helping our teams. This is what was reported verbatim in the qualitative component. Asked whether your country has improved its legal and operational frameworks to improve enforcement and protection of victims of all forms of violence and abuse, particularly meted out to the most vulnerable adolescents, both males and females. And I must remind you that at the last Congress, the audience, the members were very vociferous about this particular outcome being forming part of the call to action. We heard that 80% are saying that some level of action has been mounted in this area. And I want to note here the report that the Child Protection and Family Support Agency has improved its reporting and enforcement mechanisms to safeguard children from becoming at risk through child risk rights advocacy and public education, and to ensure the safety, security, and well-being of those identified as at risk from neglect, from abuse, from trauma, disability, and any other factors. So this was one highlight that we heard of. Moving on, has your country strengthened national systems for generating data and information to guide evidence-based decision-making on adolescents and youth health, ensuring the involvement of youth in this process? Now, I would really want to lobby that this priority continue to be a central part of the focus of this Congress. as Dr. Cafe mentioned earlier, and indeed your first speaker, Dr. Klein, it is important that we are able to get the evidence, not only on what is happening, but around the involvement of young persons, including their training and the level to which they are receiving that capacity to enable them to have active and meaningful involvement. Here we note 60% of the respondents indicated that this was not being done. It is being done to some extent, but information and data come mainly from research efforts. And we all know that research in our region is underfunded. Although there are, and indeed in your host country, Jamaica, there is indeed quite a wealth of research capacity. So that issue of alignment may be up for your consideration. Another respondent indicated they are currently working on the adolescent health strategy to identify the data and further implement it. But I must say, this very exercise has indicated the importance of the focus on this area of evidence, data collection, reporting, and evidence sharing. Looking at us, whether your country currently is providing training to caregivers and personnel who serve children on the common signs of mental health, substance abuse problems, self-harm, and suicide. And based again on the impact data that we heard from Dr. Cafe, this is quite an important area if we are to change that impact, that red line where we are seeing that red line. So we heard from respondents that 60% indicated no, this is not happening to the extent that we would like in terms of the training of personnel to capacitate them to identify early and respond to mental health, substance abuse, self-harm, and suicide issues. And this, of course, is borne out in the impact data that we heard a few minutes ago. Qualitatively, I heard that training is being done by the Ministry of Health and Wellness through their adolescent health and mental health units consistently and highlighted during their mental health week, that this is a time where, as my colleague, Mr. Vincent indicated, October, where we tend to hear a lot about mental health, but we want to look beyond that to see what is happening on the ground and how are the actions really moving the needle to improve these outcomes, these roadmap outcomes. Looking at sexual and reproductive health and rights and HIV and AIDS, this is an area that if we were to rank each of the themes, this is one of the areas that would rank perhaps first or second as an area requiring concerted attention. And again, I must refer to Dr. Cafe's impact graphs that also show a good alignment with the fact that we do require quite a bit more work in this area. And I think the issue is not one of effort or implementation, but one of the type of implementation that allows the Congress high-level outcomes to really be affected. So you were asked, has there been a regional lobby resulting in legislation being reviewed or repealed with an aim to promote information regarding early marriage and access to family planning services by young persons? Quite a number of you said that you weren't aware and that there really was no mechanism for identifying the extent to which this was happening. But we also heard a further 40% indicating that this was not the case. So clearly an area for attention. Has your country been engaged in actions aimed at changing the social and cultural gender norms through media sensitization and campaigns? Another area indicating that not enough was being done here as it relates to sexual and reproductive health and rights. Is your country engaged in the formulation of laws and policies to increase adolescents' access to contraceptive information and services, including emergency contraceptives without mandatory parental and guardian authorization or notification? And this is perhaps key in shifting the issue of the third ranked area that we are, this area is the third ranked concern for health among our young persons. And we see 60% indicating that further action is required here. Does your country demonstrate the inclusion of curriculum-based sexuality education and family planning aimed at reducing unwanted pregnancies and optimizing the age at first pregnancy and birth intervals? Another key area that requires concerted effort. Looking now at nutrition, physical activity, sports, and youth development, we've noted some progress in our region in this area, in that asked whether countries were demonstrating improved physical activity in school settings. We indeed have seen quite a bit across the region in Trinidad and Tobago, Barbados, Jamaica, Guyana, improvements in the integration of physical activity in schools. Now, we heard that prior to COVID-19 pandemic, there was a reported increase in physical activity in school settings based on the Jamaica Moves program, and that this would have been implemented in Jamaica in schools and in homes and would have contributed. Indeed, this program also is in place in a number of countries across the region. Looking at climate change and the environment, this is on the second area that is competing with sexual and reproductive health and rights as the area that requires most effort. That quite a bit of work has still to be done. When we ask whether adolescents in their countries have been positioned at the center of climate change strategies and response actions, you are reporting that not enough is being done to engage in there. We heard qualitatively, to some extent, there is an advocacy group called Jamaica Climate Change Youth Council, which is quite notable, and it's promoting climate change and sustainable living. Youth reps have gone to the COP 2021 in Glasgow and would have represented the region and would have led different initiatives and had different conversations around climate change. And this is also notable. We asked whether countries were providing complete accessibility to climate change curriculum and education resources in the school settings. This was not reported as being done in a way that is really visible and notable. There's a need for more focused action and attention in this area, and this is happening only incidentally through the structured education program. So what have we learned from this exercise? A couple key points I want to leave you with for consideration as you engage in the Congress. Firstly, that notable progress has been made in the areas of mental health and nutrition. However, in order for those efforts to really rebound at the outcome level, which means seeing changes in impacting youth, there needs to be continued, targeted, and strategic work. Targeted attention is also required in the two areas that are lagging behind, sexual and reproductive health rights and health, as well as climate change. There is clear need for a comprehensive database of contacts of Congress participants in order to engage you, to continue to adequately engage you beyond your participation in actually attending the Congress. There is a need for a funding mechanism to support the implementation of Congress agreements that is linked to strategic programmatic actions at the country level. There is the need for a robust M&E system aligned to the roadmap in order to facilitate country level and regional level tracking of progress in a more comprehensive way. As I said, this really is a telescopic report in that it gives you some amount of details, but only looking through a small telescope, so to speak. But we need to do a lot more in order for us to have a more comprehensive view of where we actually are at against these Congress priorities. By way of improvement and way forward, I would want to suggest that we identify country level focal points for implementation and with responsibility for reporting against your Congress agreements, and to improve the overall culture of data and reporting, engaging in surveys, collecting data, sharing reports, collecting and documenting the good work and excellent work that young people are doing in each and every country across the region. We need to improve our mechanisms to capture what is being done. And lastly, I want to leave you with a recommendation of perhaps going forward, we may want to consider engaging in the exercise of reviewing progress at the current Congress, so that ideally at this Congress, you would have been engaged in coming to the Congress with your reports, with your data, with your indicators, information, to then report on the data from the last Congress. I think it is perhaps when you are face to face, present and feeling the energy and enthusiastic around the issues that you may, we may stand a better chance of getting from you quantitative and qualitative data to give us a sense of where we are at as a region. I thank you for the opportunity to not only engage in this exercise, but also to share some of the telescopic results with you this morning. Thank you.
Thank you very much, Dr. Lloyd. And it's not until we do the monitoring and evaluation that we know what has been done. Margaret Chan used to say, if it's not measured, it's not done. I have an announcement before we introduce our last speaker for the morning. Question and answers. Could you please write down your questions? And at the time for question and answer, the ushers will collect your questions. Thank you.
At this point, I wish to introduce our last speaker for this morning's session, Anshu Mohan. She is from the PMNCH, Partnership for Maternal, Newborn and Child Health. She's going to speak on the adolescent well-being, 1.8 billion acting on the call to action. Let's welcome Anshu.
Thank you very much. This is a really, really hard act to follow all the wonderful speakers before me. I want to acknowledge John, my colleague, Sonia, the great youth speaker, and of course, Elizabeth, who brought so much evidence to the table. I thought it's only fitting that I come in at the end and to wind up all the threads that have been spoken this morning about various aspects that contribute to the adolescent well-being. So what I showed to you just now is a small trailer of the work that PMNCH is convening partners around. It's a call to action for 1.8 billion adolescents and youth across the world. And all of us gathered today in this room feel so passionately about their well-being. And we have started a campaign and we will be working towards it over the next year or so. To make sure that this population group is the spotlight for policymakers, for people who make decisions on financing, and eventually for impact at the country level. John, you spoke very eloquently about NCDs. Sonia, you focused on SRHR. Kendall, you referenced mental health, access to health. And Elizabeth, you brought evidence across a spectrum of themes and issues. The Adolescent Wellbeing Initiative of PMNCH, it brings all of these together. And I'm just going to start with sharing my screen and to take you through a very, very small slide deck on the Adolescent Wellbeing Initiative that is being led by PMNCH and its partners. So I'm not going to belabor very much on this because you know most of this, and you've spent a lot of time discussing this morning. So just to give you a sense of, if there is, sorry, something wrong with my screen. Just give me a moment to sort this out. Okay, excellent. So we begin with a little bit of background around what is adolescent, how did we get here? And the work begins in 2019 when the UHC declaration was being discussed at the WHA in 2019. And one of the key observations of partners around this was that adolescents don't seem to be mentioned. Now, in this age and date in 2022, towards the end of 2022, 2019 seems a lot far away. But at that point in time, it was very important to identify that gap, to make sure that this gap is noticed by partners. And then we started building a movement towards bringing focus on this population group. And a group of us got together along with UNICEF, UNFPA, WHA, WHO, IAH, CHI, and PMNCH to bring partners together. And we developed a white paper called Adolescents, the Missing Population in UHC. That was the beginning of this movement. And then subsequently, there was a call to action for adolescent launched in 2019 at the General Assembly at that point in time. That call to action, which my colleague and friend referred to, John referred to in his presentation, and Sonia did too, that references three very important aspects to adolescent well-being. One is to engage and empower adolescents. Two, go beyond the health sector and launch a really powerful multi-stakeholder response. And then finally, strengthen political commitment and funding, leading to a global conference or summit on adolescent health and well-being. Now, the first two aspects are ongoing pieces of work. We continue to work with young people. We continue to be their springboards. We continue to make sure that meaningful adolescent and youth engagement is central and hard to our work. And then we launched a multi-sectoral response through designing and developing a definition of adolescent well-being that was agreed upon by all 86 partners, and work continues. But the third bit, which is calling for a global summit on adolescence, now at this point in time, at this moment in time, this is what we're working at. We are working at engaging 1 million young people to say what they want, to articulate clearly what their governments, what the people, the stakeholders that support them should be doing to ensure that they reach their optimum potential. We've used a multi-pronged approach to move forward on this. I spoke a little bit about building consensus on the call to action for adolescents, and that was by bringing together all groups, the partner governments, academia, young people themselves, the H6, which are a major player for this population group. Then we diversified a little bit and started working with young people and towards a campaign called #Adolescent2030, and now which has morphed into 1.8 billion young people for change. But because this was a multi-pronged approach, there are multiple angles to it. So one, you have the adolescent and youth engagement. The other is, there is no political advocacy without evidence. So we started on a huge body of work around evidence for adolescent well-being, including a new definition, which is adolescents thrive and are able to achieve their full potential. And this is supported by many knowledge products on this. At this point in time, in October 2022, we are now planning for a global forum for adolescents in 2023, which is next year, and then eventually working with partner governments to secure political and financial commitments for this population group. This is just to give you a small taste of the kind of work that we have done. For example, since September 2019, we've launched the definition, the framework, a series of technical papers. Your region, PAHO, and the Latin America and Caribbean was greatly involved in this. My colleague Sonia from the region led on this. This has then led to tools being developed for meaningful adolescent and youth accountability. Then more recently, all the yellow colored diamonds that you see at the bottom of the slide include a BMJ adolescent wellbeing collection. The first one is expected to be out on the 27th of October. The second one next year, early Jan, Feb, and then April, and then finally in October 2023, that we come together to launch multiple products, for example, indicators and monitoring framework for adolescent well-being, an investment case for adolescent well-being. The Global Forum is also going to be a platform for launching the Lancet Commission's second report. Plus, you're all familiar with WHO's global guidance, AHA. The platform will also see the launch of AHA 2.0, which is the reboot, expansion of the AHA to include well-being elements. What does the 1.8 billion campaign seeks? The 1.8 billion campaign seeks to change how we view young people, how we work with them, and articulate our ambition to secure a better future for them. It's a multi-pronged, multi-year advocacy campaign, which is coordinated by PMNCH. And the first major key milestone for this campaign will be the Global Forum of Adolescents that will be organized in 2023. The campaign and the forum will share evidence. For example, all the knowledge products that I spoke about, it will work with young people. It will engage young people. It will engage partners for action, which will stimulate bringing together, coalescing partners around this important area of work. What are the key elements of this campaign? So there are 4 key elements of this campaign. One is high-level political mobilization, for example, working with the G20, working with UNGA, ensuring that young people and youth and adolescents are a focus area of the SDG review process. Grassroots mobilization, working with youth-led organization at the country, at the subnational level to generate their demands through a very innovative approach, through using chatbots to find out what they want. Constituency mobilization, which would mean working with different constituencies of PMNCH. Sorry, I skipped my slide. The forum at a glance. What does the forum actually look like? I talked about engaging 1 million people. But how do these 1 million people come together in these days where climate change has become such a priority, such an area where people need immediate action? So this is going to be immensely virtual. It will be coming together, 1 million people and coming together in a massive digital advocacy effort to drive community, national, regional, and global change. We hope that for the forum, 100+ countries will be a part of this vibrant, innovative set of discussions, activities, and events. What will be new? We just discussed that, there's going to be new knowledge, data, evidence, innovation. But what is unique about this forum is youth voices. Youth voices will be at the center of this, speaking for their own health and well-being, their empowerment, their resilience, education, skills, all the things which are essential ingredients to making sure that young people of today, the future of tomorrow, they are secure in who they are, what they are, and how they want to take this discourse forward. And another essential part of this discourse is the agenda for action, which builds on the evidence that I just spoke about, the BMJ collection, the investment case, but then it socializes these recommendations coming out of the evidence work with young people. So therefore, the first point on my slide, 1 million adolescents and youth, they are going to be engaged in developing this agenda for action. What are the key features of the 2-day program? Remember, this is a virtual stage, so we can include time zone free programming, and on the global main stage, it'll have spoken word, it'll have concept, video, art. There would be, of course, certified online advocacy for capacity building programs for young people and those constituencies that serve young There would be a space for digital innovation, marketplace. There's going to be an Africa Regional Media Summit. Plus, there are going to be knowledge products that I've spoken about, you know, the investment case, the indicators. There would also be award and recognition for youth champions. Young parliamentarians will come together. There is going to be a ministerial dialogue. So this is very much the shape of the program and how this program is going to run over the course of 2 days. But remember, I said that this is going to be a global program, an inclusive and a digital program. And there are two aspects to it. One is, of course, the global program, which is I just spoke about. And then you have the country-facing events. How do we ensure that voices from the countries and communities are a big part of this discussion? So we are encouraging our partners across multiple countries to hold their own versions of the forum and for them to beam live into the global main stage, highlighting issues around the various thematic areas and the 5 domain areas that comprise adolescent well-being. And this would be an opportunity to kickstart a conversation that brings about a shift in national policies and programs and is engineering, redesigning of adolescent well-being programs at the country level. This is going to be very much an inclusive, digitally powered approach to promote adolescent well-being. We do appreciate that there are digital divides, and it may not be possible to include as many as we would like to, but to the extent it's possible through reaching out to them in a usual survey method, we will try and include as many young voices as possible in this call to action for adolescent well-being and the 1.8 billion campaign. A little bit on the technical side, because I'm mourning, the earlier part of my presentation spoke a lot about what the platform, the global forum, and the 1.8 billion campaign speaks about, but this focuses on the meat of the issues. What is it that young people want? And this morning we spent quite a bit of our time discussing some of those efforts. So the key domains of adolescent well-being that have come out of the BMJ related work are these. And I would refer to the small pizza kind of a diagram that we have. And these domains include good health and optimum nutrition, connectedness, positive values. It also includes safety and supportive environment. It also includes learning, competency, education, skills, employability, and agency and resilience. Now, these are the 5 domains with 27 domains that support the adolescent well-being. Now, from each of these domains, based on the work that we have done, there are 5 asks that have come out under a broader chapeau of all governments and stakeholders should protect adolescents in all their diversity using principles of equity and equality to promote the multidimensional nature of adolescent well-being. And also asking for data-driven, strengthened political commitment, policies, and domestic resource mobilization and financing, of course, supported by ODA, and which is in these times a very big ask, but we have to try, we have to include everyone. This is the time to act. This is the biggest cohort of adolescent and young people, and we cannot let them down. Some of the asks that have come out of this work include promoting agency and resilience, promote improving adolescent health and well-being, then prevent stigma and discrimination and sexual and gender-based violence towards adolescents, support adolescents to stay in school, invest in education and skill development, foster connectedness, positive values, and healthy relationships. This is the scaffolding for what the asks to policymakers, to finance ministers is going to be. So what then forms the program of the Global Forum and the campaign? And you would recognize some of these. For example, in track 1, we have good health and nutrition, and there are spotlights here: mental health, physical health. Mental health, if you see, is a cross-cutting issue. SRHR, gender-based violence, equity. Domain 3, then domain 4, and around learning, competence, education skills, then around agency and resilience. Now, these are the 5 domains. They were there in the previous slide, and here again, they're made much more visible But what is important is text at the bottom of the slide, which talks about the cross-cutting issues, which are becoming much and much more topical. For example, humanitarian and fragile setting. Then there is COVID, effect of COVID, digital health, cybersecurity, tele-education, climate change, civic agency, youth leadership. All these are cross-cutting issues. And when at this point in time, we are still developing the program, but this was just to give you a trailer of how exciting, how all-encompassing the program of the forum is going to be. How do we engage with partners? We've laid out our ambition that this is going to reach more than 100 plus countries. This is going to engage 1 million young people. It's going to engage many more others. But how do we do that? We do that through multiple things. There are lots of digital innovations. There are lots of digital outreach methods that we are doing, including digital advocacy hubs. The programming is very digital to allow people from remote locations to join in. The programming is also time zone free, which allows people to view and visit the content in their own time. And then we are going to be crowdsourcing multiple things. Example, the Agenda for Action ask. We are going to be asking our partners to support us in commitment mobilization. And of course, because PMNCH is a partnership hosted by WHO, we are going to encourage our governance structures to be a part of this. And that's the first element on the slide is the standing structures, including committees, working group, and constituencies. And PMNCH is a partnership, like I said before, 1,300 plus partners at the national, regional, and global level who have volunteered to join the forum committees and engage in other ways, plus the community engagement aspect that I spoke about. All these three elements are going to encourage, foster engagement, spreading the message, ultimately leading to that 1.8 billion campaign to go to help us achieving our aim until 2030, but also going beyond 2030, because some of the gaps that we've identified is around measurement. Elizabeth quoted Margaret Chan, Dr. Margaret Chan, that what gets measured gets counted. Exactly in that spirit. We want a new set of adolescent well-being indicators, building on the indicators that are already there, to be included in the post-2030 conversation, because indeed what gets measured gets counted. So that is also one of the aims and goals of the 1.8 billion campaign, to get political attention, to get financial commitment, domestic as well as ODA, also to get program implementation. My last slide is just to give you a sense of how we have laid out the road from now to October 2023. And this maps out a set of events. Some of these would be familiar to you and others not so much. And these include a curtain raiser that's happening on the 28th of October. You saw the trailer video of that curtain raiser. Then there are multiple conferences and events that have happened already in 2022, and going forward. For instance, we would have the 10th October, the World Mental Health Day. The COP27 is the next opportunity after the curtain raiser, which will see the launch of the BMJ collection, also the announcement of the Agenda for Action. Similarly, the Family Planning Conference in Thailand, then the Regional Forums for Sustainable Development, ECOSOC is a key moment in April 2023, plus the GA and the SDG Summit. Women Deliver in Kigali in July is another very important moment for this conversation, ultimately leading to the Global Forum for Adolescents in 2023, and eventually the final moment for this campaign in the year 2023 would be the G20. But this work doesn't stop. It concludes, it carries on much beyond 2023 with the ICPD conference in 2024. But also, I mean, once we have laid down all these tools and evidence, it's time for countries to start acting on them. It's time for countries to take it to its logical conclusion of implementing and acting on the call to action and making sure that this population group gets what it deserves, gets what it needs. So on that note, thank you very much for your attention.
Thank you very much, Anshu, for your presentation. And without further ado, we've heard from the experts, we've heard so many speakers giving us so much good information. And now we want to hear from you, the young people in the audience, both here as well as joining us virtually. So we do have some questions, and I will invite my co-moderator to begin that ball rolling.
I'd also like to invite our virtual speakers, Dr. Klein, Dr. Mohan, and Dr. Lloyd to join us as well. Our first question is for Dr. Cafe. Road injuries are one of the leading causes among young female adolescents around the region. What are the low or high measures put in place to decrease road injuries among drivers and young adolescents?
Shall I? Well, thank you. Thank you for the question. I will mention what I know, but I would like to first start off with saying that PAHO is supporting regionally there's a whole unit that's working on this topic. There are different measures that can be put in place. Some have to do with, obviously, with policy, making the road safer, ensuring that people don't drive under the influence, above speed, etc. Policy and making the road safer. Then there are other measures that have to do with moderating the behavior of people. And because I mentioned in my presentation that it's really the under 15 in the Caribbean that we see die from road traffic injuries, it immediately reminds me of the way school children are on the road after school, walking home. I don't know if that is a fact. I don't know what exactly the behaviors are that are putting our younger adolescents at risk, but I'm pretty sure that we need to analyze this further by country to say, why is it the 10 to 14? Is it that they don't know about road safety? Is it that there is no road safety measures, for instance, around their schools? And once we have that type of information, then we can take targeted actions. In some countries, for instance, the Dominican Republic, I know that a lot of those who die are either pedestrian or on the little, how you call it? The little mopeds, on the little mopeds. And so in every country, it could be different. But I think the bottom line is this data needs to impress us to look further so we can take the targeted actions that are evidence-based to reduce this vulnerability.
Thank you, Dr. Cafe. And in addition to what you just answered, someone was asking, what do you think accounts for the disparity between young women and young men?
Yes, so that is also something that we need to do further research. We need to analyze the data, disaggregate the data, and then look at the context where these things take place. In general, young boys, when we look at 15 to 24, it's the boys who die more. Huh? It's the boys who, because they are much more prone to risk taking, etc., etc. And so The key is that once we see the data, we need to analyze it. We need to understand why these things are happening, not only what is happening, but why it's happening, so we can take action.
Thank you. This is for Dr. Elizabeth Lloyd. Dr. Lloyd, are you hearing us?
Yes.
Okay, please
I am
confirm
indeed.
that there were only 7 respondents. If yes, do you believe that this was sufficient enough to represent the status of progress in the Caribbean? And they also wanted to find out if you included any qualitative elements in the survey.
Yes, yes, indeed. I think it certainly is not enough to represent the picture of the entire region. I think, which is why I like to use the term a telescopic sense of what is happening, because it gives only a small sense of what is actually in place across the region. And I am pointing to, and I'm happy for the opportunity to reinforce the need for a monitoring and evaluation system or mechanism to support the roadmap in and of itself, incorporating the Caribbean Regional Youth Council and indeed other regional entities. There was a second aspect, can you remind me? Representation was one, and there was a second aspect.
Qualitative.
The quality,
elements.
yes. So there was a component in terms of the design of the tool, where they were asked, respondents were asked to select a response, and they were also invited to give their explanations, to give excerpts of documents, and indeed to upload any sample of documents. So there was an open-ended component to every single question. Thank you.
Thank you.
Thank you for your comment. This question now is for Anshu Mohan. How are different governments involved in the Global Forum to further adolescent well-being? Anshu, are you with us? Perfect.
Yes, I am. Thank you very much. Very pertinent question. Key stakeholder in making sure that we have enough political and financial attention to this population group. So as a starting point, we work with some of the governments that we are working with, for instance, Government of India, Government of Mexico, Jamaica has been a part of our conversations, Kenya, Nigeria as well. We are now starting an intensive advocacy, commitment, mobilization drive, where we will go to regions with the evidence that we've generated and put that evidence as an advocacy argument to say, this is the population group that you need to invest most in. If you, for example, if you invest $1 to $1 per capita, your returns can be $5 to $10 per capita. So some of the evidence that we've generated and some of the evidence we are in the process of generating by undertaking scoping exercise at the country level, and then using that to celebrate successes, to identify gaps, and that will hopefully lead to commitment mobilization and commitment making from our partner governments and eventually to action. But we want young people with us on this journey. They have to be co-leading, co-driving, and that's the space we are trying to create through this 1.8 billion campaign. Thank you.
Can I add to that one, actually? The question is, what can each of us do to try to achieve the necessary commitments by governments? And I say that because, you know, PMNCH and the call to action have recognized that given the state of the world with the pandemic and the climate crisis, that it's essential to keep governments accountable to the existing commitments they've made, except when there are gaps. And when there are gaps, like for adolescents and young people, then it's necessary that there be new commitments. And even though we can always use more evidence, there is sufficient evidence to justify action to make sure that commitments are made for every adolescent to have access to good quality primary care and access to the resources to be able to change that trajectory of the health issues that we know are before them. And so any one of you or any of your national organizations or regional organizations can and should have that discussion with your government. And there will be a lot of resources available online from the partnership and from the call to action. They're there now, but there'll be even more after the October 28th launch. So the opportunity to go with young people, with national organizations, and have conversations with health ministries and education ministries, and magnify the voices is very immediate. And I hope that many of you will take those opportunities between now and the end of the calendar year.
Yep. Thank you very much for the very important call to action, John. We need that. We need everyone to put their shoulder to the wheel. This is important, this is urgent, and it needs to be done now. Thank you.
Thank you. We just have one last question. Unfortunately, we couldn't take all. And this is for Kendall. You spoke about keywords like expand, development, capacity, meet communities, engage. Our question is, how can we build and interconnect strategies in alliance with other youth councils, NGOs, and networks in Latin America to share best practices and experience? And that comes from Randy.
Could you just repeat? Could you just repeat?
You want me to repeat it? Yes. You spoke about keywords like expand, development, capacity, meet communities, and engage. Our question is, and this is coming from Honduras, how can we build and interconnect strategies in alliance with other youth councils, NGOs, and networks in Latin America to share best practices and experiences?
Thank you very much for the question. Very simply put, I think the answer to that will be, of course, sorry about that. So thank you very much for the question. I think that is very much a very pertinent question, but just simply put, I think the answer or the response to that question would be collaboration. And how do we collaborate? How do we effectively collaborate and partner? Is that one, we have to be able to, and I think Rick has begun the process in terms of being able to sort of engage in a sort of stakeholder mapping or knowing. I think one of the key things in order to collaborate is knowing who does what, essentially. And I think really and truly, the various organizations and stakeholders have to develop a sort of whole instead of operating, because I think sometimes we operate in silos quite a bit, and therefore that creates duplication, or there exists duplication, and we operate within strenuous economic circumstances in terms of finances. We have reduced finances. So what I would say is, one, in terms of, I think what the stakeholders should do is being able to sort of, one, conducting a stakeholder mapping and analysis to understand, who are the stakeholders, what everyone is doing. And then the second part to that is now convening those, bringing everybody together and really sort of finding ways to align or realign so that we can get some sort of collaborations. I think collaboration is key. If you know someone, if you're doing work and you know someone that is doing similar work, just reach out and form partnerships.
Okay, thank you, Kendall, and thank you to all our speakers for your presentations as well as your responses to the questions. Thank you to all persons that that asked questions. And if you have any more questions, of course, we are here. Keep the conversation going after we close off. In the interest of time, unfortunately, we do have to wrap up, but I do want to extend sincere thanks for your participation as well as your attention. We have a lot to talk about. We have a lot of time, so we look forward to that.
Behind, we are behind. Okay, just some information for you. After this, the second session, after the break, and break is unfortunately only 10 minutes. So you're going to have to be quick at that. So the rooms, this is room Rock Steady 1 for those persons who are going to be part of the group here. Rocksteady 2 is next door to my left, and then the Blue Mountain room is across the lobby. So enjoy your break. I hope you will enjoy the rest of the conference. And we are going to start promptly at 11:30. Thank you all very much.
Oh, 1 second. All right, well, we'll do that. Can I take it again?
We'll take it again.
Yeah. All right, okay. But I could- Okay. All right, well, no problem. Just send me the pictures and I'm gonna check the ones from before. So she used the product from the store. So this way. Yeah, yeah, okay. So at the two locations are the crops, right? Either our own or the store's own, right? All right, well, I'm gonna check with the pictures now. I didn't second, so wait for my response. Okay, thanks so much. Bye. Hi, sorry for that. Okay, yeah, that is.
Okay, no, no, the bios, yeah. That's, Oh, let me go introduce myself. Oh, no, three. Number three. Oh, yes. Jonathan Montano. No. Oh, Jean. Yeah. That's how you pronounce it. Jean Stanley. Yeah. Okay, nice. That's good. Yeah, I'm from the Dominican Republic, but my professional side of the family from Haiti. So they gave me a Haitian. Okay, Jean. Okay, French. Yeah. Sure. Okay. Yeah. And you are? Dr. Nathan James. I'm going to be one of your moderators. That's great. Nice to meet you. And where are you from? I'm St. Lucia. From Lucia? Nice. Yeah. So the Jean is not unfamiliar to me because you speak Okay. Same here.
Yeah.
So yeah, this is the size.
Yeah.
Full body.
We have the bike.
Oh, the bios. I have it there.
All of
We
them?
can just, yeah.
Amazing.
So we can just read it off of this.
Perfect.
Yeah. Oh, okay. That's nice around here. So you can just read it off of this. This kind of thing, this is like,
Yeah, but then there. Yeah, they mentioned that the number of the room is the one that appears in paper, not in the door, like the label. But then the problem is that, for example, the technical people in this
Yeah,
room
they are kind of
are
different.
presentation, and the people in that room are like the other people.
so I think we should just switch.
Sandra,
Who is, it's very Sandra, I think like Sandra, yeah.
yeah, Sandra is
Well, let me go find out.
yeah.
But I don't know what's happening with the pipeline.
And how you yeah. So I think I have it. If not, I will ask for it. So then I do Jan and Sienna, and you do the first two.
Pauline and, okay, so Dr. Paulina and Jonathan.
Yeah.
Okay. Cayetano. Okay. Paulina. Dr. Mitchell. Yeah, yeah. So, the other presentation. So, yeah, one.
1, right? So if you rock steady 2, it's next door. All right, so just welcoming you again, and we gonna begin. All right, so good morning again, and we're gonna continue the very good presentations that we saw this morning. I'm Dr. Kim Newton-James. I am part of the Caribbean Public Health Agency. I also am part of the UWI, a fellow from the UWI Climate Change and Health Leadership Program. I'm going to be one of your moderators for this session. And here with me, I have Mr. Je, and he will introduce himself.
Thank you. Thank you. Hello, everyone. My name is Dr. Oscar San Roman. I am from PAHO, working in adolescent health, and it's also part of the organizing committee. It's a pleasure to be here and honored to co-moderate this session with my colleague, Dr. Kim.
Okay, great. So we have a real interesting lineup for you this morning. So we have 4 presenters, and one of which is online. How we're going to go about it, we're going to introduce each of our speakers with the bio, then the speaker will present, and we'll do that until we've had everybody, and at the end, we'll take questions and answers, or it will be our question and answer session. Okay, so I will begin with our first presenter, Dr. Claudina Catellano. Dr. Claudina E. Catellano is a psychiatrist with 25 years of experience in mental health service delivery. She currently works as the Mental Health Regional Advisor for Pan American Health Organization, WHO, World Health Organization, based in Washington, D.C. In this role, she provides technical cooperation to PAHO's member states in all matters related to mental health as public health issues. After obtaining her medical degree at the Universidad de San Carlos in Guatemala, she completed her postgraduate degree in psychiatry at McGill University, Department of Psychiatry in Montreal, Canada, and her master's in public health from the University of Liverpool in the United Kingdom. Prior to joining PAHO, she served as consultant for the organization, providing technical support to various Caribbean countries on the organization of mental health services. She has received numerous awards, including the 2011 Award for Outstanding Achievements in the Field of Mental Health Care from the Swiss Foundation for World Health and WHO. She has also contributed to chapters to various books published by the World Health Organization, Geneva, and has been published in various articles in peer-reviewed journals. So I now welcome to the floor Dr. Claudina Catellano. So yes, so the floor is yours. This is yours. I'm just.
So thank you so much, Dr. Kim, and thanks also to my colleague, Oscar. It's good that, we've been working together with Oscar, and finally I get to see him today. So I was like, oh, this is you. He's very tall. Didn't expect to see him like that. And the other thing is that so happy to be in Jamaica. So I'm based in Washington, very excited to come, not realizing that it will be colder inside this room than in Washington. So I'm sure we will do our best to go quicker, to make sure to be on time so you can go and enjoy a little bit of sun and then get back to continue our business. One of the things that I also like about this presentation, about being here with you, is that I like our room, the name of our room, Rock Steady. Isn't that a fantastic name? And there's another, so I think in Jamaica, they probably very good with these names, because if you are at the Pegasus, there's a room called the Talk of the Town. Am I correct? Okay, but I think I'm happy to be in the rock steady room. And I'm going to be talking to you about the impact of mental health because of this, because of COVID. I think it's important to realize that if we fail, if the government, us, individuals, and the community fail to prioritize mental health, this is definitely a disaster because there is, as you all know, there is no health without mental health. We know the impact, so I'm not going to go this number because we already know that in the Americas, we have this high percentage of death. We're talking about 44% in the Americas, 28% cases. We also are familiar with the high level of anxiety and depression, and we are already aware of the fact that this pandemic posed not only health but economic, social, human capital challenges to everyone. So no one escapes from that. But what is important for me, what I would like you to consider is that prior to the pandemic, prior to the disaster, there was a challenge. There is an issue when it comes to mental health. Globally, when you think globally, we're talking about 1 in 4 persons will experience a mental health disorder in their lifetime. So when I'm doing my training, I always tell people, well, let's go, we go 1, 2, 3, 4, 1, 1, 2, 3, 4, 2. So like in this room, we could easily have people who, because it's 1 in 4, we could easily have people between 10 to 15 that may have a mental health condition. Okay, so you see, this is a very common thing, even before the pandemic. Now, in the Americas, that's where we are now. So we know that depression is the largest single cause of disability. We know that people, even 100,000 people die by suicide every year. And we also know that in our region, in the Caribbean, Suriname, Guyana, have the highest rate of suicide. So we are familiar with this. And the sad part of this is that when we talk about treatment gap, and what do we mean about that? We mean about, people can be diagnosed, but they don't get any treatment. We're talking about 82%, which means 10 people that have a disorder, only 2 may get treated. And that's really sad. Because it's like, I always explain to people, it's like if I have a problem with my eye and I don't get my glasses, then I won't be able to see. So you don't make good decision if your mental health is affected. I remember when you said mental health, we talk about your feeling, your thinking, your behavior. So it's a lot of people who do not get treatment. And of course, the other challenge that we know, when you think of investing in mental health, most countries, so if they're going to allocate $10 to the Ministry of Health to run their business, Ministry of Health, the entire health budget, do you know how much money from the $10 is going to go to mental health? $2, okay? But out of the $2, how much you think is going to go to the real business, to community? Out of these $2, probably only 20 or 25 cents, because the majority is going to go to a psychiatric hospital. So for example, here in Jamaica, there is a psychiatric hospital, Bellevue. So Bellevue will have the major 60% of the budget. But how many people will go to Bellevue? People don't even want to go to psychiatric hospital. It has a lot of stigma. And that's happening in many countries, in Trinidad, in Suriname, so Guyana. The majority of the funding is going into psychiatric hospital where people are not there. So very small population will end up there. So the other thing that is important for us to consider is the shortage of human resources, specialists. So you have countries where there's only from 100,000, only 1 psychiatrist. And when you think of other countries that high income countries, you have 50 for over 100,000. So you see the disparity, we can compare. So we do, for when the pandemic, WHO developed this survey, the Global Pulse Survey, and this Global Pulse Survey was to give a snapshot of what's happened, what are the challenges, what are the changes, what is the policy, what is the, how do we know what is happening when it comes to disruptions of mental health services? So in PAHO, we also adapted the survey because we wanted to know what's happening in our region. So it has 3 rounds. One was done in September 2020, and the other one was January to March 2021, and so the third one, which is the last one, from November to December 2021. So I'm going to present to you some of the findings from that survey. So what were the theme? What we want to know? So there's different thematic areas. There was on vaccination, on nutrition. My area is mental health, as you can say, that's my passion. So I'm going to just focus on the thematic area, which is mental health. So we wanted to know how many countries have mental health and psychosocial support. And I need to explain when we say mental health and psychosocial support. Unfortunately, the minute people hear mental health, what they think of? Yes, they don't think mental health is about well-being. It's about sleeping well, eating well, exercising, taking care of yourself, having good relationship, not only with yourself, but good relationship with yourself, good relationship with your family, at work. They're not thinking well-being. They're thinking disease, right? That's the problem. But nevertheless, when we say mental health and psychosocial support, we know it's important. It's about, so let me just clarify, it's about well-being. It's not about disorder. It's not about disease, okay? We wanted to know then if there was disruption in services. So we want to know what are the essential services, if people have access to these services, what is the cause of the disruption, and then and what are they doing to overcome the disruptions? And then of course, the importance of surveillance. Are they doing any data, collecting data? Are they doing any research? So which countries in our region participated? So these are some of the countries that participated, and you can see them. I don't want to read them to you, but you can see if your country is one of those. So fortunately, which is fantastic, 83% response rate, and that's very good. For a response rate, 83% is fantastic, is good. So the mental health services, as I mentioned to you, 75% of the services were reported that they were partially or being completely or partially disruptive. This is a time when we really needed more mental health services. And I'm not talking about disease. Remember, it's not about disease, it's about support. This is a time when people really needed more support for their mental health, because all of us were affected. People were anxious, worried, scared. And this is the more important thing. So adolescent, women, these people with disabilities. So they were facing severe disruption to services. So 73% is quite high. Now, I want you to look at this slide. So this slide says MHPSS. MHPSS stands for the mental health and psychosocial support. So remember, it's mental health and the psychosocial support. Inclusion of services. So we ask countries, tell us if you're including mental health and psychosocial support in your program when you're coming to, for COVID, in response to COVID. Look, 62%, 18 countries said yes. That's fantastic, right? So we should be happy about that. 18 say yes, 9 say some, and only 2 say no. Okay, remember this number. 18 say yes, and 9 say no. We ask about funding. You can't do anything without money, right? You need to have funding. There's things you could do without money, but when it comes to services, you need to have funding. What do you think happened? Only 2 responded that they have funding. And this is very sad, because we're saying that mental health is important, that we are including mental health, but we are not putting the funding that requires. So that's what happened. So 2 now say yes, 100% funded, and 16 say only partially funded. So that's sad to see. And then you have 9 that were not funded, and there was a 2%, 2 countries that said there was no answer provided. So that is the challenge, is the funding that is required, that most of the time is not there. And which program, which services are disrupted? So the emergency, counseling, prescription, and clearly services for children and adolescents, which is key, very important, because this is a time when they also were not going to school, they were staying at home. The school mental health program, suicide prevention, all of these areas were critically affected. And another important thing to remember, unfortunately, people tend to think that when children and adolescents start to have depression or have anxiety, people will think, well, why would they worry? They have everything. They shouldn't be anxious. They shouldn't be depressed. And we know that by the age of 14, 50% of people can be diagnosed with a mental condition. But you know what we will say about them? We will say that they are having a behavioral problem. They're seeking attention, they're acting up. And when we do that, we are diminishing, we're not giving people the opportunity to be diagnosed, to be treated, and to be able to live effective life. So the other thing that I want to mention to you, so what was this reason for disruption? Because they were, closures, they don't have sufficient staff. They had to mobilize people, and some of you probably know this. People needed to be deployed to provide more COVID response. There were not beds available, and there was a lot of fears too. People were scared of going to the hospitals, and plus the issue of restrictions. The mental health impact. So we know that there is a huge mental health impact, not only before or during, but even after, because we know that people who are recovering from COVID are experiencing high rates of mental health problems. We have people who will be telling you, they're not sleeping well, they're getting anxious. And we know of people who did not have no previous psychiatric history. And once they were diagnosed with COVID, during the first 14 to 90 days, they were having some mental health challenges. So then we know about healthcare providers, people working long hours, and they having starting to have problems to sleep, starting to drink, starting to have more and experiencing more anxiety. And of course, you all know some family children and adolescents that face loss of loved one. This also was very challenging, that their families would be hospitalized and then they can't see them, they can't go to the funeral. And those are very challenging times and continue to be challenging times. And this hinders their mental health. We look at the outcome, we think of road crashes, we think of a suicide, that's an outcome. But before people get there, their mental health has been affected. Before, when people are children and adolescents are in school, we look at their grades and we say, oh, they're not performing well in school. But then before they get to that, their mental health has been affected. So I think I want you to see the value, the importance of pay attention to mental health. So good mental health is not it's not only essential for physical health and overall well-being, but it's our fundamental human rights. So if one thing I want you to remember is that we should demand for have better mental health services, because it's a fundamental human right. And I think it's not limited only for people who are working, it's for everyone. We need to make sure that everyone is included, regardless of their condition. We need to make sure that there is more information about what it means to have good mental health. And sometimes we also need to be working on home-based care and then telemedicine. Those are the things that we need to be thinking of, because we want to be able to transform mental health system. My dream is that when my grandchildren are getting older, I have two grandchildren, two boys, and my dream is that they will be able to live in a society where stigma and discrimination is reduced, where people can talk freely about mental health. But we don't have this conversation. People will not be talking about mental health because they fear of being stigmatized, they fear of being shunned, they fear of being judged. So we want to be able to see that we are building better health services where people can go and seek help without the fear of being stigmatized. We need to start to think beyond COVID. COVID is almost, it's beyond COVID. We have to, as I mentioned, incorporate mental health and psychosocial support into all the services. And when we talk about disaster response, because we are prone to disaster, or countries are prone to disaster, we need to incorporate mental health, not at the end when people say, oh, they're traumatized, they need counseling. No, we should do it before, in preparedness. When we explain to people, go buy your groceries before, think about what you need to do for your mental health. How do you protect your mental health during that time? That's what we call recovery. So we need to invest on this with the good investment. So investment also means capacity building, doing more training, addressing psychological impact. You know, we talk about, you know, when Red Cross do training for first aid, we talk about psychological first aid, what we mean about that. So we need to do more public education. We need to build community resilience, because this is what will help for people to be more prepared as a community. So in conclusion, we know that mental health has long been a neglected area of public health in the regions, but I think that we are more and more very cognizant of the importance of increasing the need for having mental health services. There's an immediate need to improve and to scale up services. And what is needed urgently is, you know, everything I have on that slide is extremely important, you know, in technology, telehealth, reaching people who are high risk in those vulnerable situations. But for me, more importantly, is allocating funding for mental health. I mean, more funding we allocate, I think we will have better services. So with that, I want to thank you, and I want to leave you with this page. Some of you know that we have a campaign called Do Your Share. Do your share to promote mental health. Do your share to talk about it. Each one of you could make a difference when it comes to reducing the stigma and discrimination. That's one of the huge barriers when it comes to seeking help, because people feel that they will be stigmatized. So if each one of us do our share, I think we'll have a very healthy countries. Thank you so much for your attention.
Thank you so much, Dr. Carolina. Thank you. Thank you. I really like that phrase. No health without mental health. Excellent, excellent. Okay, so we will move on to our next presenter, and this presenter is online, and this is Jonathan Manzano. Jonathan Manzano is a 19-year-old gap year student and mental health advocate. His passion for this advocacy was birthed from the participation in a group called Fatima College Young Leaders in his 4th year of secondary school. Since then, he has met the president of Trinidad and Tobago to converse about mental health and its various implications. He has founded the NGO Mental Health Mission, TT, Trinidad and Tobago, with his friend and partner, Adam Bartholomew, and joined both the PAHO Youth and the Health Group and the Mental Health Call for Action Subcommittee of the Health Caribbean Coalition, along with the host of other things. He says, "It is one," and I quote, "It is one of my goals to educate myself and others about matters such as mental health, so that we could help not only our country and the region, but the world at large. And I believe all people should have this goal." End of quote. I share that quote with you, Jonathan. So in terms of titles and organizations, he's the founder of the Mental Health Mission, Trinidad and Tobago. He's also a member of the PAHO Youth for Health Group and Youth Advisor for PAHO. He's a member of the Mental Health Call for Action Subcommittee of the Healthy Caribbean Coalition. So please join me in welcoming Mr. Jonathan Manzano online. So the floor is yours, Jonathan. Thank you.
Hi, good morning, everyone. Hope you're doing well. Once again, my name is Jonathan Manzano, and I'll be giving a presentation on my study, Effects of COVID-19, Lockdown, and Upcoming Exams on Form 5 and 6 students in Trinidad and Tobago. So let's get started. So of course, we're all familiar with what occurred in 2020, with seemingly out of nowhere, the COVID-19 virus that's really plunged into the lives of every single person on this earth, including the citizens of Trinidad and Tobago. But more than that, this virus didn't just infect and take the lives of thousands of persons. But the very presence of the pandemic severely affected countless communities of people. One of these communities being the Trinidadian students. A year into the pandemic in 2021, and conversations with my peers conveyed feelings of sadness, lack of motivation, and uncertainty. So in this time, in the midst of the pandemic in 2021, where it seemed like it had a melting pot of stress with COVID, lockdown, online school, and we had the upcoming exams in 2 months, My friend Adam Bartholomew and I, he's also a part of the Power Youth Health Group, and we have done a lot of mental health projects together. He's basically like my partner in crime. We decided to create a questionnaire to examine just how much these phenomena were having an impact on us and our peers and our mental states. So we decided to create a questionnaire, and we sent it nationwide to try to reach as many students as possible. And in the end, we were left with 862 students' information to analyze. Information which I'm about to share with you this morning. So let's get started. So the questionnaire was basically broken up into two main categories: health and well-being of students, that was the first one, and the second category were the notions on the upcoming exams. And let's get started with the health and well-being of students. And we see right away that when asked the question, has your mental health been affected by this time of online learning, isolation, and preparation for exams? We see it there in blue. 76.8% of all students said that their mental health had surely been affected. Add to that, students expressed that they were feeling high levels of stress and anxiety, even depression. Specifically, one student had this to say, and I'm sure that most of us that did online school, if anybody there did online school, we could relate to this in some degree. The student said, when asked the question, in what way has your mental health been affected? He said, waves of sadness due to constant school pressure. With the pandemic, half of my screen is kind of blocked off. Later. Sorry about that. Yes, he said, waves of sadness due to constant school pressure. With physical school, there's a balance with friends, extracurricular distractions, and then I make time for school, which is how I work best to avoid burning out. But because of the switch, which was unfortunately inevitable due to the virus, I'm home 24/7 on the online platform doing schoolwork with no other escape outlets, unfortunately. In terms of preparation for exams, it is difficult to keep a momentum because studying tends to get monotonous. So it's hard to find ways to make studying fun and enjoyable, as every day is pretty much the same. Do you all relate to this? Anybody that did online school? I know I surely relate to this. The days feeling the same, drowning in schoolwork with no real outlets to release that stress and anxiety that we were feeling in preparing for exams and enduring online school. When asked the question, if you're ever stressed or anxious, what do you try to do to alleviate it? Some students stated that they prayed, listened to music, or exercised when feeling stressed or anxious. They also took naps, meditated, cried at times, watched television, played video games, or associated with friends. And when asked if they engaged in any physical activity at home, the majority said that they did at 56.4%. But still, a lot of students at 31.2% engaged in no sort of physical activity at all when they were at home, which obviously is not good for the body or mind. So let's look at how online school impacted the students. And I'm sure that we could all guess how it impacted them. We see that 76.3% of all students said that they were negatively impacted by this time of online school. And in this text box, it shows more of the issues that they were having with online school and studying at home during the pandemic. Predominantly, students stated that the greatest hindrance to their studies was a lack of motivation. Furthermore, they stated that they cannot seem to stay focused. Many also revealed that there were many distractions in their rooms where they spend all their time due to COVID-19. So we're seeing all these problems that students were facing: lack of motivation, they can't stay focused at home. There's a whole set of distractions because that's where they are all the time, doing school in your bedroom. And obviously, if they're feeling like that in online school, they're going to be worried about exams. So when asked, are you worried about how you will perform in your upcoming exams? Almost everybody said yes. But this wasn't unusual, obviously. And when asked what advice they would give to someone who is struggling to find motivation and who does not believe they will do well in these upcoming exams, some students, so the minority of students, suggested making a structured plan and keeping desired goals to the forefront, studying in many short sessions, getting sufficient hours of sleep, or associating with friends as much as possible. But we could infer that these are like the most dedicated students in the region, the top tier students. On the other hand, the majority stated that they faced a lack of motivation and focus and disclosed that they themselves needed advice. Others' advice was not well thought out. And due to these students having issues with their school, it's no surprise that for the past 2 years, CXC grades have been on the decline year after year. So why were students feeling like this at this time? Why were they feeling depressed, anxious? Well, let's go back to school and look at some science. Humans are social creatures who have evolved to feel safe in groups, obviously. So when people are deprived of social connections, they feel lonely. And it's this loneliness that signals to them that they need to form deep social connections for their own safety. However, when prevented from making these connections, such as during the lockdown, people's bodies react by producing the stress hormone cortisol, which keeps them alert to threat. Their bodies enter a state of increased inflammation to heal any injuries that they may get, and sleep is shallower so that they can awake to danger. However, if this state is prolonged, it can take a significant toll on one's body, which explains why perpetually lonely people are at greater risk of physical, mental, and emotional problems and have weakened immune systems. So it's clear why so many students have indicated that their mental health has been affected, why they were facing lack of motivation, why they were depressed, why they were anxious, stressed. And this is why it's so very refreshing that physical school has reopened in Trinidad and Tobago and in many Caribbean countries. But while that is good, so much more has to be done. So in conclusion, I think that the educational health sector need policies that encourage and promote young people's positive mental health, and one that teaches youth effective coping mechanisms to relieve anxiety and stress. Added to that, to prevent these effects in the long run, schools should be better equipped to deal with students learning and studying and have systems in place to do mental health checks and referrals. Furthermore, the mental health stigma in Trinidad and Tobago, regionally and worldwide, has to continue to be broken so that parents, friends, and even teachers can get involved in their students' mental health. And if they notice anything, talk to them, ask them how they're going, and if need be, direct them straight to professional help. If this pandemic has taught us anything, and it's taught us a lot, is that we need each other and we need to perpetually work together. And as we're now seeing the light from the tunnel of this very dark pandemic, we have to keep these ideals to the forefront of our minds. Thank you.
Thank you. Thank you very much, Jonathan. Please, to the audience here and the virtual, those virtual attendees, if you have any questions for our speakers, please type them in the chat, send it to us so that we can give it to the speakers later. We'll go there. Thank you. So now it's my pleasure to present John Sano Santana. He's an impact advisor at Bodily Go Philanthropy and member of the Pajo Youth for Health group. John is also a philanthropy impact advisor, human rights activist, and a political researcher. John has a background working with the UNFPA and the UNDP in the Dominican Republic, mainstreaming human rights in development and youth policies and programming. Currently, John is a member of the Pajo Youth for Health group, as I mentioned, and is completing his Fulbright academic training program at Bodily Go Philanthropy after graduating with a Master of Public Affairs at the University of Texas at Austin. John is interested in transformative social actions, data science, and influencing the flow of capital to solve social problems. So please welcome John.
Good morning, everyone. Good morning, everyone here and at home. Thank you so much for your time. I will time myself because Dominican people can speak forever, and I don't want to do that to you all. Um, Here I go. Perfect. So this research that I'm gonna present to you all today is actually my thesis for my master. So I have a hate-love relationship with it. If you have done a thesis, you probably feel the same way. So I'm gonna speak about the LGBTI plus youth human capital in Dominican Republic. I'm from Dominican Republic, and this data that I'm gonna use is a snapshot of the situation of youth, LGBTI plus youth in the Dominican Republic during the pandemic. I stress that is youth in the Dominican Republic because the survey not only included Dominicans, but everyone that was living in the Dominican Republic, and I will get to that into that later. Well, as a methodology and data, I'm gonna explain a little bit here what I did. As methodology, I wanted to know if LGBTI plus youth in the Dominican Republic can achieve their economic potential. And that translates into multiple things. But I use as a methodology and framework the human capital approach that says that if everyone in a society has fair and equal treatment and access to healthcare, education, workforce participation can reach that economic well-being, as you can see on the graph. The data collected comes from the National LGBTI 2020 survey in the Dominican Republic that was conducted by the United Nations Development Program in the summer of 2020. So this is during the pandemic. There were many, many responses in this survey, and it is actually the most comprehensive survey of LGBTI plus people in the country. But for my research, I created a subset and in which I took away people that was just visiting the country. I was interested only in the people that actually live in the country or have lived in the country. So I ended up with a data sample of a subset of 7,070 responders, which is a very large sample, but it is not a census. So the data, it is a good proxy to understand the situation of LGBTIQ plus people in the Dominican Republic, but it is just a convenient sample. This is kind of a little bit of the description of the sample. Most of the responders were gay people. As you can see, almost 3,000 responders were gay men, followed by bisexual women and lesbians. In terms of gender identity, I hope you all know the difference between gender identity and sexual orientation. If not, please ask me later, but gender identity is how people understand themselves. And most people were cisgender men, and followed by cisgender women. As you can see that the responders that we have the less responders were trans people, both trans women and trans men. This is kind of the ages of the people that were responding. As you can see, it started at 18 years old. Of course, we cannot, well, the survey could have asked adolescents, but that required a pretty complex legal procedure to ask minors for this kind of information. So the UNDP decided not to ask minors and started collecting data on people 18 years and older who are adults in the Dominican Republic. Most of the responders were from 18 to 30 years old, and under the Dominican youth law, that's called a young person. I know it's very generous, but I wish I could still be called a young person when I'm 50. And it's one of the most generous laws in the region. So this data is a very good representation of young LGBTI plus people in the R. And this is kind of these are two other parameters. I'm just choosing some of the parameters that I use: race and residency. Race is a very complex question in the Dominican Republic, if you know Dominicans. As you can see, most people consider themselves mixed, but many people that look just like me will say that they're mixed. So this is not a trustworthy data because there's a lot of denial of our offer, I know. I'm putting myself forward so people don't say otherwise, but it is true that many people in the Dominican Republic will not consider themselves Black, which is kind of the third answer here. And many people that are just light skin will consider themselves white. So this data will have an implication later on the analysis that I run. But this is not trustworthy. Just want to highlight that. And then the residency. In terms of residency, most of the people were living in Santo Domingo, which is the capital, and the surrounding towns. And then the second largest group come from the north, which is also a kind of more after Santo Domingo and the metropolitan area is kind of the most wealthy zone of the country. And we have less responses from the rest of the country. Well, I'm saying we have because I work for the UNDP during the building of this survey. I'm normally that I use the data then as a graduate student to do this analysis, but I was there. Okay, so I wanted to know if LGBTI plus people in the Dominican Republic who achieve their economic well-being. And the first pillar that you saw in that graphic that I showed was equal treatment, fair and equal treatment, right? So I first did kind of a overall, or like an overview of our laws, because laws can be used as a proxy variable to understand whether people are respected or not. And I look at the laws of the pillars of the approach, which were labor rights, education rights, and health rights. In general, we can say that there's a relative fair legal framework in the Dominican Republic for youth people. Our labor rights laws do not explicitly protect LGBTI plus people, but the code does establish that no one can be discriminated. And in fact, the Ministry of Labor has a whole office that's dedicated to diversity, and whoever is affected at the workplace coming from a minority can go there and present their case. What happened after that? Sometimes it's just in the unknown, but at least there's an office. In terms of education, we have two kind of laws. We have a education law that goes from kindergarten to high school, and then a law that goes to university level education. And none of them protect LGBTIQ plus youth as a separate group, but again, they do recognize that no one can be discriminated in the education system. The Ministry of Education, which, as I said, rules from kindergarten to high school, does have peaceful, coexistent norms that explicitly said no one can be discriminated in our public schools based on the gender and sexual orientation. I still believe in gender identity, which will include trans people there, and it's something that need to be changed. And then in terms of health rights, our health law do not, again, explicitly protect LGBTI plus youth, but those says no one can be discriminated. And there's a law about HIV and AIDS that does specifically say that LGBTIQ youth should be protected. Okay, so that's kind of the overall law, right? If we go by the law, LGBTI plus youth in the Dominican Republic are good to go. You guys are thriving. But I wanted to see the answers of the survey and run some data analysis to make sure that those answers, the answers that the laws are saying correlate with experiences, the life experience of the youth people in the Dominican Republic. So I did something that is called in data analysis linear probability model, which is kind of a statistical tool to isolate variables impact on others. It's like how A impacts B. It's a little complicated to explain, but in general, I wanted to explore the layers of discrimination, and I use linear probability models to estimate the effect of identity, race, job position, professional status, region of residency and education on discrimination. So I was like, are people discriminated at the workplace? What is driving that discrimination? Is it their race? Is it their gender identity? Is it their sexual orientation? That's what I wanted to see. I was at the beginning having some, theories, and I thought that Black people and people living outside of Santo Domingo were to have the worst results. But when I run the data analysis, you guys will see it later. Don't get afraid of it. I will explain it. I found that it was not statistically significant. The race, of course, as I said before, because that data doesn't work, doesn't reflect the reality of the country because people are biased. We are educated. I want to say that we are educated to be biased of our race. And in terms of the residency, this is my personal experience. What I saw and suggested is that outside of Santo Domingo, in the rural areas of the country, you are not the faggot or the queer or the real one. You are someone's son, someone's daughter, and people protect you and people care for you because they went to school with your parents. Those are small towns where everyone know each other. And that's my experience. I'm from the South. And when I moved to Santo Domingo is when I actually started experiencing many kinds of discrimination because of my color, because of my sexual orientation, because of my gender expression. In my hometown, everyone knows me. And even though I know they are thinking about saying stuff, they don't because they respect my father, they respect my grandmother. So that's kind of why when I run the data analysis, those are my hypotheses as to why the regional residency and the race are not statistically significant. In other words, race and where you live doesn't tell in the Dominican Republic if LGBTI plus youth people will experience discrimination. Okay, so let's dive into I think I'm running late. Okay, I'm good. Let's dive now into the pillars, and the first one is access to health. 1,075 responders indicated that they cannot afford medical attention when needed. That's when looking at the answers, right? Remember that the sample is equal to 7,070 responders. So that's a very small number compared to the overall answers, right? Most people can afford healthcare. But I wanted to know within those that cannot afford healthcare, who are they? And that's when the data analysis comes in with the probability model. And then what I found is that people who were assigned female at birth, saying women, trans men, and bisexual women have less access to healthcare. And that was something shocking for me when I saw it for the first time. And the regression analysis supports this. You can see the graph here. And trans people have the worst outcomes in terms of access to health. And trans men in particular have 0.015 percentage points less are minus 0.015 percentage points less likely to access or afford healthcare. So in terms of access, trans men have the worst results, but anyone who was assigned female at birth have less access. In terms of education, most of the responders have at least graduated from high school, while only 1,399 abandoned the education system during elementary or high school. And here we can see that trans people have lower levels of education, especially trans women. And this goes back to that kind of norms that the ministry has. It don't respect gender, sexual orientation. It says no one can be disrespected or discriminated if they're gay or if they're lesbian, but there are no protections for trans people. So here we see that trans people in general have lower levels of education in the country. In the regression shows that trans people are less likely to access education, trans women in particular, and they are 0.383 percentage point less likely to at least obtain a high school diploma. This is not in this regression that you see here, but in this one, race was statistically significant. And what I found is that Black and Asian people in the Dominican Republic are less likely to have education. I still cannot explain as to why that is happening, but that was one of the results that I found. And then access to workforce, the majority of the sample was currently working during the pandemic, either part-time or full-time, and 3,025 of the responders were not working. And when we look at the regression, the graph says that bisexual women are minus 9.9 minus 0.091 percentage points less likely to be employed. And the results for trans people are not statistically significant, so I couldn't demonstrate statistically that they were significant. But the relationship between the higher levels of education and workforce was statistically significant. So because they have less access to education, they have less work. Okay, so some of my conclusions are that the survey has an overrepresentation of gay men who are almost half of the responders. And that, of course, drives the data in many answers. Trans people were less represented in the sample, as well as intersex people. Intersex people are people that are born with different sexual characteristics, and they were less than 1% of the sample. Most of the responders identify as mixed race and live in the metropolitan area of the country, in Santo Domingo and in its surroundings. Trans people and gay men are statistically more likely to face discrimination in the workplace or during job searches. People who were assigned female at birth across groups are less likely to afford healthcare, especially trans men who, along with trans women, represent the two populations with less access to health. In terms of education, trans people are less likely to have access to education, especially trans women. And the lack of education of this group translate to having less access to employment. Almost half of the responders were unemployed despite the high level of education across the group. And that answer is mostly driven by the pandemic. Many of our responders were sex workers and people that simply work outside. They needed to go to the streets to work. And the country had a lockdown for a very long time, especially during the period where we gathered and collected this data. So most of these people that were working on the streets couldn't work during the period of the time that we collected the data. In terms of recommendation, the Ministry of Health could provide the healthcare workforce sexual and gender identity diversity training. So when trans people in particular, but queer, LGBTI, youth people come into the clinics and the hospitals, they know how to treat them. I've spoken with people, and like we have other research in the country where nurses are not willing to treat a LGBTI plus person only because they say that what we are is against the religion. So they will let someone die in their hands at the hospital because they don't want to attend them. Also, the Ministry of Education could provide diversity training to the teachers and the school leadership. In many cases, it's not the teacher that wants to take the kid out, but the principal of the school. And that also could be a measure of making sure that these kids can get education. The Ministry of Labor could develop kind of like a pool of LGBTIQ resumes or curriculum vitae and have kind of like diverse job fairs for us. And the Ministry of Industry and Commerce could provide entrepreneurship and vocational training as well. And then looking outside of the country, the development agencies should focus on economic and development-oriented programming. And this program should be targeted to trans, Black, and Asian people in the Dominican Republic. That's it, folks.
Thank you very much, Jan, for your presentation. So now, last but not least, it's my honor to present Fei King. Faye is a 24-year-old woman who was born and raised in Suriname. She has her bachelor's in business administration from the FHR Institute of Social Studies, School of Business, with a specialization in international business and management. She is currently pursuing her master's in international affairs and diplomacy, and also currently employed at the Inter-American Institute for Cooperation on Agriculture. She has been a gender and SRHR advocate at the Youth Advisory Group of the UNFPA Suriname for the past 7 years. In addition to that, she has also been selected as a Woman Delivered Young Leader in her capacity as also PAHO Youth for Health leader in the PAHO Youth for Health group. She works with several young people from Latin America and the Caribbean to improve the health of young people, especially the mental and sexual health of young people. Please. Okay.
Good afternoon, everyone. Can everyone hear me clearly? Yes, okay. I'm going to keep it short and sweet. I do also talk a lot like Sean, but I'll make sure that my presentation is a bit shorter and sweeter. On your booklet, you can see that Sienna was supposed to have this presentation because I wasn't sure if I was going to attend the conference or not, but I'm happy I'm here. And I'm happy that I can represent the PAHO Youth for Health group COVID-19 campaign and tell you more about what it entailed and what we have done as a group. And Sienna was also part of that team and was also going to tell that story. And because I was the lead with one of the other writers called Shani Waite, she asked us to do the presentation. Yes. So my presentation today will be on the voices of youth health and a COVID-19 vaccination campaign. So a little bit about the background. If COVID-19 taught us anything, it taught us the importance and the power of science in mitigating global disease burden that we have. And historically, vaccines have played a significant role in combating life-threatening and infectious diseases and has saved us from a lot of atrocities. But with COVID-19 came a lot of controversy. There was a lot of hesitancy, despite there being over 6 million deaths. And there was a lot of hesitancy around young people in general. So we as a PAHO Youth for Health group saw this as an opportunity to start a campaign and start an initiative to stop misinformation and to inspire young people to get the vaccine and get vaccinated. Some of the methods that we used were post creations. We did it with memes. We used our main tool was our Instagram page and our TikTok just got to share their story. Myself and Shani created a Google form for them to share what they have experienced getting the vaccine, their reasons behind getting the vaccine and why it was important to them. We also ensured that people from different backgrounds were able to highlight their testimonials and share their stories because our group also consists of people from different backgrounds from Latin America and the Caribbean, and we made sure that both voices were heard. There were also videos and TikToks made of young people getting the vaccine, getting vaccinated, their reasons for getting vaccinated, and what the benefits were for them. This was also to create a level of normalcy for the people that follow us and follow the Youth for Health group. The climax of our campaign was an Instagram Live with the immunization experts from PAHO, both in English and in Spanish. To guide out this campaign, we started with sending out a Google form and got over more than 70 plus questions from young people all across the region. Questions such as, how is the vaccine effective? It was made in such a short time. They just wanted to understand the myths, understand the difficulties and concerns that they had. And some of the questions were very interesting, especially in that period. It was in 2021. There was a lot of conversation around menstrual health and the effect that COVID-19 vaccine had on menstruation, and also on fertility. A lot of young people were afraid, especially young women were afraid to get vaccinated because of the myths and rumors and conversation around infertility if getting the vaccine. So by that time, we didn't have a lot of data on that, but the immunizations experts were able to explain it clearly as to why it doesn't have a large effect on your fertility and on your menstruation, and what caused a menstruation, what caused menstruation to fluctuate and change during that period. Also, if mothers were allowed to get vaccinated, which vaccines were most safe and effective, and also questions such as the difference between a RNA and a viral vaccine, and just understanding how vaccination works. Those were some of the questions we got from young people across the region, and just creating a forum where they felt comfortable to ask these questions, because when it came to misinformation, a lot of young people got backlash as well as to having IDs and having myths, but creating that safe space where they can ask these questions and share the myths that they heard and debunk them was very important to us. Now we have a short video of one of our young people who shared her experience getting the Pfizer vaccine. Yeah, I want to play it. Yeah. If he goes to the video, if he goes to the Yes, thank you for bearing with us and bearing with me. It's very important to see the experience of how the young people created the video. Yes.
Getting my second dose of the Pfizer vaccine. We're here, waiting. All set. Time for the jab. 20-minute observation time. Fully vaccinated. Minute observation time. Fully vaccinated. Getting my...
Yes. Thank you. So that was a short video done in a very youthful way, in a very TikTok style of how young people get vaccinated and how they share their story. And the results that we saw during this campaign was that, the results that we saw is that there was great interaction amongst young people and the people of the Paho Youth for Health group. Many people received the answers to their questions. Our live, which was the highlight of the campaign, reached almost 500 viewers. And this was one of the first rollout campaigns that we did on our Instagram page. And it was also one of the first initiatives of one of the projects that we created ourselves, and we led ourselves as the Paho Youth for Health group. Usually we join a campaign or advise on projects, but this was really ours from beginning to end. And it was very exciting to see the impact that that was making and seeing the growth not only in our Instagram page, but in the notoriety of the Paho Youth for Health group, and seeing that people, that the myths were dispelled and the myths were busted through the conversation. So it was a good introduction of the Paho Youth for Health group to the general public, with support of the Paho's main page as well. My mouse isn't working, so can you go to the next slide? Yeah, okay. So this is another video. Yes. So this is another video of one of the leads of our project, of this vaccination campaign project. She couldn't be here with us today, but she was also one of the main ones that started this campaign and shared her story as well. So she can.
2021, and I'm going for my first dose of the COVID-19 vaccine. Your girl is going to have #vaccinated girl summer. Is that how it goes? But I'm excited, definitely. Kind of nervous. I absolutely hate needles. But I'm excited. So it's gonna go well. So see y'all later. So I'm about to go in, but I'm not allowed to take any videos on the internet. So I'm still a bit nervous, but I'll let y'all know how it goes. Wish me luck, pray for me, everything. Okay, so it is an hour since I've gotten the vaccine, and I just got a little, post-vaccination injection site on it. But outside of that, I get to go. But it's an hour down, so stay tuned.
Yes.
Hi.
So in conclusion, what we take away from this project is that youth really have the power to influence others positively. We started with this campaign that we had the power to inform other young people, and we encourage other organizations to implement and use their voice, especially to raise awareness in the importance of getting the COVID-19 vaccine. It's still not where it needs to be when it comes to young people. We're still seeing a low number of young people getting vaccinated. So for us and for the Paho and for the Paho Youth for Health group, it's very important that we encourage others to get vaccinated. If you want to learn more about our campaign and about this project, our poster will be out outside where you can learn more, see some of the posts that we made. Thank you so much for taking the time to listen and learn as well.
Okay, wonderful. Thank you so much. Very interesting information, very interesting projects and all of that. So we'll take questions now. And you want to make the announcements first before we take the questions?
So we will just take one or two questions. Sorry for that, but unfortunately, well, not unfortunately because we are all hungry. But lunch will be served from 1 to 2, so we'll take a couple of questions and then we break out to lunch.
Okay, good. So we have one question here, and I think this one I will throw out first to Dr. Catayano. And if anybody else wants to chime in, you're free to. So the question is, why do we only fund hospitals? Have we thought about branching out to other centers to help with mental health?
The person who did that question, so thank you. I'm sure you were listening because, as you know, that's exactly what we don't want. For politicians, they want to fund something that they can see, right? Infrastructure, hospitals. For us, we want to be, not that hospitals are not important, okay? Hospitals are important, of course, but what is important is the community, building the community, having services at the health centers where you can walk to a health center and you know that there is someone there that understands what is mental health, that understand how to address issues such as LGBT, that understand everything that has to do with disabilities, and that you don't need to go to a specialist, that we have that at the community level. So we should be, so remember when I was telling you about the funding that we get from mental health gets, that's a disparity, that's inequality, because what we want is funding more at the community level, funding MHPSS. I mentioned that when we ask country how many are having MHPSS interventions during the response for COVID, most of the countries say yes. When we ask them, are they funding it? No. So we need more funding at the community level, not necessarily at the hospitals. And not everyone required to be hospitalized, but almost every person may require some kind of mental health assistance. Remember I mentioned to you 1 in 4, so they don't necessarily require hospitalization, but they may require some kind of support. I'm extending too much, I know that, but I just want to, the point is not about hospital, it's about building community. And that's where youth and adolescent has a huge role to play when it comes to resilience. I'm sure you have, no, okay, thank you.
Thank you, Dr. Claudina. So now the next question goes for Jan. So Jan, is there more information or research on why cis women have less access to quality of healthcare? And there's, I think, a second one here also connected. Was there research on the degree of sexual orientation expression, gender expression, and the influence on in the effects? So
Can you repeat the last one?
yeah, was there? I will give it to you.
Thank you. So on the first question, which is pretty good, thank you. I was surprised too because on a cultural level, I would say that women are more likely to go to hospitals in my country. But on the data that we found for queer women, for LGBTI plus youth women, is that in those 1,000 and something responders that said I cannot afford healthcare, those they were more likely in that sample to be women. And as I said before, this is just kind of a snapshot of the sample in this period of time. We cannot extrapolate that information and say that most Dominican women are, or most Dominican women who are lesbian or bisexual cannot access healthcare. That is the truth for the sample, which is still surprising. Yeah, but I do recognize that assigned female at birth is definitely a disadvantage, especially when trans men are the ones going to the hospitals. There's even less knowledge of them than trans women, for example. No, so there were no questions related to this, and thank you for asking. There were no questions referring to how the sexual expression does affect discrimination outcomes on this on the survey, but in the education one, we found that gay men were less likely to have access to education alongside trans women. So we can infer that the reason that is happening is because of the gay men very female presenting way of living and performing at these schools. I like performing because I see, for me, gender is a performance. So we got these trans women who are fabulous in the art, and then these very fun gay kids at the school, and that's what gets in the way of then completing the education.
Thank you. Thank you. So if you can give it to Faye. So Faye, I have a question for you. So in terms of the forum that you had and the questions that you received, how did you get that initial buy-in? Because you got a lot of respondents, 500. I mean, that's a lot.
Yes.
So how did you get that initial buy-in from the youth to their forum?
So we narrowed it down to, because a lot of the questions were similar or had the same context. So we narrowed it down to about 14 to 20 that we had during the live discussion. But during the live, more questions also came up. So we had to address those as well. But the immunization experts of PAHO knew the information, they knew what to share. They already had the experience with most of the questions being asked to them and most of the studies that they do relating to those topics. So that was really how we narrowed it down and got the essence out of the campaign and the project.
Okay, thank you. Thank you. So there's one more question. Okay, so we'll take that quickly and then after we'll head to lunch. So you wouldn't say no to the question.
Okay. To John, what are the limitations of the research?
Thank you. That's it, perfect.
Yeah.
The research had many limitations. First, we were doing it, it was an online survey. So not everyone had access to internet. And this was happening during the pandemic. So it means that for many, we were kind of, that's one thing, right? There was limitation in terms of who was the survey. This was kind of a snowball sample, right? It was people sharing a link through social media. There were organizations that got involved in kind of promoting the survey, but in the Dominican Republic, the oldest and most important or relevant organizations for queer people are men-led and focused. So because these gay men-led organizations were the major kind of promoters of the survey, that's why we got tons of gay men responding, because we got these two organizations that mostly focus on serving gay men, that were the ones every time that they were sharing the survey in their social media, it was reaching only the gay men they serve. So that's another limitation. That's why we got an overrepresentation of gay men. Another representation is in terms of geography. We did some in-person surveys, like 300 responses were in person, like someone went out with a tablet and asked the questions. But during the pandemic, that was pretty hard. So it was very limited, and we could not get answers for many people outside of Santo Domingo because of that reason, which is another problem about the organization, is that these organizations serve gay men, but in the capital only. So those were, just to say, there are more, but just to say kind of the biggest one as to why we got the sample we got was mostly based on, and the outreach we got, the situation during the pandemic, who were promoting, and the kind of survey we did, which was online.
So thank you very much, Jean. So in closing, before we give our last announcement, I'd just like you to put your hands together for our presenters online, as well as with us. For a job well done, very inspiring work as well.
the last announcement, I'll repeat it. So lunch will be in Rocksteady 3 from 1 to 2 p.m. And we will be back with our plenary in Rocksteady 2 at 2 p.m. Also, if you're not in the WhatsApp chat of the participants, log in, register. We're like sending different messages through there and interaction. Thank you everyone again for your attendance, and see you later.
A little less noise would be appreciated. Thank you. Excellent. Thank you. So welcome again. And I would like to extend welcome also to our participants in Belize and Trinidad who is with us today. I am Michelle Small-Bartley, Deputy Program Manager for Youth Development in the CARICOM Secretariat. Today, I will be co-moderating this session with my colleague,
Christina Williams. I am the Policy Advocacy and Research Lead for the Commonwealth Youth Health Network, as well as a Youth Accountability Panelist with She Decides. And I'm really excited to be here today, co-moderating this panel on mental health. But because we're talking about mental health, I want to just do a mental check of the room. That's okay? Yes, right. So who are all the people in here feeling a little bit tired after lunch? We call it ethnic fatigue here in Jamaica. No? All right. Okay. Or how about all of us who are excited? No excited? No, let's try again. How many people are excited right now? All right, very good. All right, how many people are feeling really happy to be here? Very good. Love that, love that, love that. So how the panel is going to be done today is each panelist will be presenting for 15 minutes tops, could be less. And then afterwards, we'll go into a question and answer section for 30 minutes. So I'm asking you to write down your questions that you may have or your comments, because we'll be taking your comments and questions from the audience in that manner, because we may not have the time to allow you to stand and ask your question or give your comment. So write it down just in case we have to take it from you on paper. And of course, we'll also be engaging with the panelists. And we have, I think it's a girl power panel this afternoon. Yes, a girl power panel. And we'll have our first panelist who will be introduced by my co-moderator.
Okay, thanks you very much, Christina. Of course, you feel the vibes a while ago, right? I'm sure you did. As Christina spoke, one of the things that popped out to me was just the other day, my eldest son, who is actually 28, said to me, "Mommy, my generation is a generation that has brought this world's attention to mental health issues." So I will bear that in mind, and you need to bear this in mind as we listen to the presentations today. So our first presenter will be Dr. Cardina Cayetano. Dr. Cayetano, PhD, MPH, is a psychiatrist for 25 years of experience in mental health service delivery. She currently works with the Mental Health Regional Advisor of the Pan-American Health Organization and the WHO, based in Washington, D.C. In this role, she provides technical cooperation to the PAHO member states in all matters related to mental health and public health issues. After obtaining her medical degree at the Universidad de San Carlos in Guatemala, she completed her postgraduate degree in psychiatry at the McGill University Department of Psychiatry in Montreal, Canada, and her master's in public health from the University of Liverpool in the United Kingdom. Prior to joining PAHO, she served as a consultant for the organization, providing technical support to various Caribbean countries on the Organization of Mental Health Services. I take this privilege to hand over the mic to Claudina. Thank you.
Thank you so much, Michelle. What a great honor is for me to share this table with fantastic women who clearly are rocking steady here in the rocking steady room. So this is definitely, and as I said, an honor for me. very pleased that we have the opportunity to pay attention to mental health. I started this morning by, is the first one, the other one? I started this morning by saying that there is no health without mental health. So we need to make sure that our head is okay, that our feeling, our thoughts. And so glad to hear that your son valued the importance of mental health, because mental health is everybody's business. Okay, that's what we want. So I'm going to talk to you today about, I think I see that this is my second slide. Is there another one prior to this? I can move it, right? Oh, fine. Okay. So we're going to talk about the direct and indirect consequences of the pandemic on health and well-being of young people in the Americas. So young people's mental health, everyone's mental health. I think that's definitely what's important. And of course, we like to bring this data, but to me, the most important thing about data, when we say that, for example, and this is data from research. I presented this morning data on this pulse survey we done in PAHO, but this one is particularly was done by UNICEF, which is interesting to see that there were 27% of people feeling anxiety and 15% feeling depression, and that only 1 in 3 were seeking help. But what is important to me when I see this number is the sad part that if you say 27% of people, let's say 30%, but you know how many of those 30 seek help? Probably only, they say 1 in 3. So which means that there is a huge number, 6% of people, 60% that are not seeking help. And that is very sad because it's for a condition that no one in their right mind wants to have a depression. Can you tell me who wants to be depressed? No. Do you want to have an anxiety? No, we don't ask to have these illnesses. Nobody asks to have those illnesses. Illnesses happen, disorders happen, and it's very important that people have access to services. So this is the sad part about mental health, that we have the numbers, we know people are suffering, but people are suffering in silence. The other sad part is that when we talk about, because when we say mental health, people or well-being, people don't think about their mental health, right? They think about the disorder. And if I say I have a disorder, I'm going to be judged. So people don't use those words, don't want to talk openly because of the stigma and the discrimination. And additionally, so it's easier to self-medicate. And what would they use to self-medicate? So we have some research. For example, the one that you see on the screen is percentage of substance use, adolescent, and mean number of substance use days in the 3 weeks before, in the 3 weeks before into the COVID pandemic. But look what happened before COVID and during COVID. So we know people starting to use alcohol, starting to do binge drinking, cannabis, maybe not so much vaping. I don't think it's very common in the Caribbean, but that is something that is very common in other countries. Interesting, when you look at the days, you see that when it comes to alcohol, for example, you have during COVID, there was an increased use of alcohol. And then people were locked down. People are supposed to be staying indoors, but there's a high increase of that. Now, this is most of the times, people, especially adolescents, you're supposed to be doing school, you're supposed to be engaging in other activities, but then people are engaging in use of substances. And it could be to self-medicate. It could be a way of distraction. It could be because they're bored. I mean, there's so many reasons why this is happening. And of course, this leads to poor mental health. So addressing young people's mental health is definitely very, very important. It's timely, not only because we want to have early diagnosis, early identification. So we also want to be able to promote preventative measures. Psychosocial, behavioral, or social approaches will help positive mental health. And what we want to be able to reduce these risky activities. We want to be able to make sure that people have not only access to care, but that they understand what are these risk factors that contribute to poor mental health. Because we know when there is poor mental health, we also understand that their performance at work, at school, at home is poor, because your thinking is not as clear when you're not well. So it's very important to pay attention to our mental health. And it is possible to have interventions that are effective, that are efficient, either online, at schools, and in communities. The problem is not the interventions. The problem sometimes is that people do not want to go for care. Now, there's different interventions. One of the ones that I want to mention to you is the one on school mental health literacy, which is for teachers. And why? Because even though during COVID, there was a lot of online everything was happening online, but there was also opportunity for hybrid sessions. And now that school is open, still very important that teachers have some kind of skills to detect when there is a mental health problem. Now, we do not want teachers to be diagnosing. We don't want teachers to become psychiatrists. We don't want them to be psychologists, but it's very important that they have the skills to know when there is a problem with the adolescent, with the youth. Because most times, kids tend to spend between 25 to maybe 26 hours in schools per week. So these teachers really get to know the kids. And we don't want them to blame them or to think that they have a behavioral problem. We want them to be able to have opportunity to be diagnosed, to be treated, so that they can get well. So it is very important to have this kind of literacy for teachers. Now, another thing that is also important, not every teacher needs to be able to build, they need to have the skills, but not everyone knows what to do. So you also have teachers that we call them the go-to teachers. You know, when you were in school, you probably remember a teacher, like I remember one of my teachers up to today, I still in primary school, you know, kind, listening, nice person. She probably didn't know anything about mental health, but she was a very good person to go to. So, you know, you have this to go-to teachers that you can go to when there are issues. And why we need to do that? Because kids spend a lot of time in school. So this is only one of those interventions that are important. Another intervention that I think I want you to know, some of you probably know about Helping Adolescents to Thrive, which is a program, and it's called HAT. And the aim of this program is for psychosocial intervention to promote mental health and prevent mental disorders, self-harm, and risky behaviors, specifically for adolescents. So it's called HAT, Helping Adolescents to Thrive. It has 4 components. And I think if we were to, you know, it's not the lack of intervention, it's not the lack of resources sometimes, it's that we need to make sure that each one of us has the opportunity to create changes. So for example, for HAT, one of the intervention is implementing enforcement of laws and policies. And then you may ask yourself, law and policies? Why? Because it is very important. If you have proper laws, if you have that there is enforcement, if you have legislation, and if you have policy, chances are that we have a better programs when it comes to adolescents. I don't know how many of you know if in your countries do you have legislation and policies for adolescents? Can anyone raise their hand? Are you aware if your country has a mental health plan or policy for adolescents? Perhaps you don't know exactly, but this is very important. But you know what? We are aware of any of the other policies that are there. So we need to be able to think that there is policy that adolescent, we should be able to go work for that. Promote environments to promote and protect adolescent mental health. Adolescents will want to be able to, health centers or health professionals are trained to treat different kind of disorders, but they don't necessarily have the skills to address adolescents' issues. And that's important. So they can also be more perpetrators for stigmatizing more people. So you don't want to go to them because you don't think they're going to be, you think they're going to be judging you. Caregiver support, extremely relevant for people when they're providing support. The majority of us who have passed the age of having adolescent, whenever parents have adolescents, they say, oh my, that's the year of, it's like the twos, right? The terrible twos, they would say. And the same thing they say for adolescents. And it's not that it's a problematic age, because if we don't understand how to do it, if we don't have the skills to deal with that age. So clearly adolescent psychosocial intervention. So this program, Helping Adolescents to Thrive, has these 4 components, and there is a component for monitoring and evaluation. So why address mental health, and specifically why address stigma? If anything, I want you to remember from today's talk, this conversation, at least from my one, is that the stigma can be more damaging than the illness itself. Someone who has epilepsy can be in this room, and the minute that, and they will not talk about having fits or convulsions. It's best to keep that to themselves and not to talk about that, because so it's more damage, the stigma is more damaging than having epilepsy. Can you believe that? So this is something very, very painful, and convulsions can happen anywhere, anytime. I recall, and because of this stigma, people prefer to stay quiet and not to talk about them. Again, suffering in silence. So example of how stigma manifests itself, because people can be dismissed, disregarded, and that hinders themselves. So people also start to have they stigmatize themselves, okay? They have low self-confidence, low self-esteem, and they don't have opportunity for employment. So it's a major barrier, and that is why people tend to avoid seeking care, and there's poor quality of care. I'm cognizant about the time. It's not moving. No, it's not. Okay. So these are the key principles why mental health is critically important for everyone, everywhere. Remember, I say mental health is everybody business. So it's important for me, it's important for all of us, because mental health is integral to our general well-being. Everyone, it is a right. Your good mental health, it's a right. So mental health is relevant to many stakeholders. Mental health is important because it helps us to connect, to function, to cope, and hopefully to thrive. That's what we want to be able to see happening. So I don't want to spend, so during COVID, there were so many, and you've probably seen so many pamphlets out there in order to, to present different guidance on how people protect themselves, what they need to do. But still, there is these barriers to seek help. And it could be different reasons. I already mentioned to you the issue of stigma. It could also be that there is no access. It could be that there's low mental health literacy. So these are different demands. And when we talk about, there's a nice narrative that I want to read to you that says, my healing only began when I overcame the stigma and I realized that there is no shame in asking for help. So each one of us have an opportunity to help people to seek help, because as I mentioned, it could be more damaging than the illness. And what are the consequences? Downplaying of a stigma, delayed diagnosis, people have a lot more anxiety, and they have a higher chance for death. I think it's very important that we learn how to support others, and we support others by asking, if they need any support, and listen without being judgmental. And, it's very important that we don't assume or we don't pretend that because they're weak or because they have problems, we all have problems. We want to be able to be kind and respectful to people. I want to end my presentation by, as you know, some of you, one of the things we've been doing is promoting this stigma campaign to do your share, and do your share to promote mental health, so we can be able to reduce the stigma. If we do that, people will have more chances to be able to seek help, and we'll have more people that will feel more empowered and more connected. So in summary, what I would want to see is that governments, communities, the country will have more comprehensive response to mental health. And when we say mental health, I mean mental well-being. We're not talking about disorders. It's not about disease. It's about our mental well-being or our well-being in terms of being healthy, be able to go to work and do our job well. We need to make sure that we strengthen the health services. There is importance of investing in mental health. And that if we do that, it will help us we will be able to reduce the stigma and discrimination and create a more happier citizens. Thank you so much. My time is over, so I don't think that's the time.
Thank you so much, Dr. Cayetano. Thank you so much. There are some very valid points that were made today, that we need to be able to overcome our mental health issues because it helps us to connect, to cope, and to thrive. I will just quickly share with you a research that I read just a day ago that says most of the persons who actually get involved in substance and drug abuse, it is done for the reason of escaping the mental anguish and the psychological effects that they're feeling from depression, from anxiety. And as a result, they use this to feel much better. It is commonly said that as human beings, we run from pain to pleasure. So a lot of us here, like myself, will indulge in eating cake and ice cream when we want to feel happy, right? And a lot of persons who are feeling the extreme effects of mental health issues will actually engage into activities that will make them feel better about themselves. So thank you so much, Claudina, for this excellent presentation.
All right, and to join Dr. Cayetano is Diana Restrepo from UNICEF. She'll be presenting on the State of the World's Children 2021 on My Mind, promoting, protecting, and caring for children's mental health. Now, Diana is a medical doctor from the Universidad de La Sabana in Bogota, Colombia, and holds a master's degree in public health for developing countries from the London School of Hygiene and Tropical Medicine. She has more than 15 years of experience advancing policy, programming, and partnerships in the area of sexual and reproductive health and rights in development and humanitarian settings across Southeast Africa and Latin America within the UN, INGOs, and governments. Please make Diana feel welcome.
Thank you so much. I'm pleased to share the panel with these mental health experts. I'm not a mental health expert myself, and I'm presenting on behalf of a team that has been working very hard on mental health in the region, in Latin America and the Caribbean region. So I would like to acknowledge the work of my colleagues who are working in this area, and I will present some of the things that UNICEF has been doing around mental health since the pandemic and until now. Thank you. I'm sorry. So this is a very general overview of what I'm going to be presenting, the general situation of the adolescents' mental health in the region of Latin America and the Caribbean, the impact of COVID-19 in adolescent and youth mental health and well-being, and how UNICEF has been supporting adolescent and youth in this region, and why we have this huge need to continue working in mental health. So globally, about 10 to 20% of the children and adolescents experience mental health disorders in a broad spectrum. Half of the mental health illness begin by the age of 14 and 3/4 by the age of 20. So if we see the figures, it's a bit alarming. And mental health disorders, we're going to see later, it's have a broad range. Mental and brain conditions are the leading cause of disability among young people in all regions of the world. And 1 in 4 children is living with a parent who has a mental health disorder. And we are seeing that 1 in 3 globally is not even treated, as Dr. Claudina showed us. Mental health has, like as I said, like a broad, like a health dimensions within the positive mental health status until psychosocial disability, and even children, adolescents, and we as adults transit in this arrow of spectrums during life. Some of us can have the ability to go from one status to another and then recover, and some others we can not have that ability and then fail into recover their mental health. And many of them don't even get diagnosed because they cannot speak it out. The State of the World's Children, it's a document that is produced by UNICEF every year. And in 2021, it was given a special focus to mental health. This document, I'm not going to go in depth because Abigail is going to talk a little bit more about what happened in the Caribbean region about it. But it shows us like alarming data after the pandemic, that every day more than 10 adolescents lose their lives due to suicide in Latin America and the Caribbean, and almost 4,200 youth. We have youth suicides per year. Suicide is the 3rd cause of death among adolescents in the age from 15 to 19 years old in all regions, including our region, and also followed by interpersonal violence that also has like mental health background usually, and road injuries. Can we have, I want to present a video of a campaign that was launched by UNICEF and it's still running, and it's a very touching video, so I wanted to share it with you, please.
How's everyone doing?
How do I tell them the truth? How do I admit that I'm unsatisfied with my life? That I'm 30 years deep into a career I regret, and the thought of living with my decisions keeps me up at night. I feel trapped and don't see a way out. But I'm afraid that if I say something, I'll be hurting my family and letting everyone down. I can't do that. So I won't let these thoughts escape my mouth. I'll just say what I always say, that everything's going well and I'm doing fine right now. Because if I confess, then all that would do is cause my wife stress. The doubts will become bigger, leading to more uncertainty, creating more mess. So I'll just keep it all inside and be strong for the family. Yes, I think that's what's best. If I just keep working and providing, then everything will figure itself out, I guess. I'm stressed and overwhelmed. I feel like I do so much for this family and I do it all by myself. All my efforts go unnoticed and underappreciated, and there's no one I can turn to for help. I'm tired of always being the one to keep things together, when the truth is, I'm falling apart. Some days I just want to give up, run away from my responsibilities, turn a blank page and restart. But then the guilt kicks in for even thinking this way. I just wish there was a safe space where I can turn to and say, I'm really struggling. I'm really not doing okay. It feels like no one really talks anymore. I'm trying my best to keep this family together, but I can feel us all slipping away. And nothing I do or say makes an impact or change. It's just the same old repeated conversations. Same words, just a different day. Different day, different day, different day. I want to be honest, but what's the point? They just tell me I'm being overdramatic. They'd completely ignore how I feel and find reasons to shift the blame, put it down to my behavior, video games, or bad habits. I can hear it now. How much could you possibly be going through? You're just a teen. Even if I tried to explain what I'm going through, they wouldn't understand what I mean when I say that I'm struggling. That it's all becoming too much. They just compare it to their own lives and tell me how what they're going through is really tough. So I just tell them I'm fine and keep it to myself. Because what's the point in even talking about it? It's not like it would help. It's just easier to keep quiet and get on with the day. But man, if only they knew just how much I don't say. I've actually got a lot on my mind.
Thank you. So it's called In My Mind, and you can see the hashtag, and there's a lot of information about it. Can we go back to the presentation, please? Slides. Yeah. Where should I point? It's not. Are you help me because it seems it's not working. Okay. No. Well, let's look fast to some figures of Latin America. The estimated prevalence of adolescents with mental health in Latin America, we compare boys to girls. Boys are in the darker blue and girls in the lighter blue. And in the ages of 10 to 14 in the first column and the 15 to 19, we see that's it, thank you, sorry. That we have kind of if numbers, but it's about 30% in boys, 11% in girls from 10 to 14, and in 15 to 19, it is increasing. So 40.1 in boys and 30.9 in girls. I just wanted to bring this to compare globally. So if you see like the high column is globally how the mental health disorders are distributed among boys and girls. And then by regions, we are LAC region, LAC region, SA, South Africa, and the other regions globally. But we are not behind, but no, but not advancing. Like we really are talking about mental health, are worrying about mental health, and we need to do something about it. Mental health also has a huge burden into systems and into governments. They account for $30.6 billion annually for the region. And from these disorders, anxiety disorders accounts for the 26.9% of the budget that is invested in health. Conduct disorders, it's the 22.6%, and depression, almost the 22%. Adolescents have still need their parents' consent to access many services, sexual and reproductive health services, mental health services, and even HIV services. So here in green, we can see in the region how many countries do not need parental consent. Adolescents do not need parental consent to access different services. And we see that mental health services are very low. Only 11 countries do not ask adolescents for parents' consent to get a consultation, to get medication, to get support on mental health. Other 13 countries require consent from parents, and 13 countries in the region, we don't have data. So probably is that they also required consent from the parents. So it's very worrisome because sometimes they don't feel confident on communicating with parents, but they need to seek help. And this is even when there's access to the health services. But mental health sometimes is not available in the health services in a specialized way, and there are barriers to access to mental health services. Now let's talk a little bit about the impact of COVID. UNICEF have been working on a report that is like a qualitative report that is called the U report. U reporters are adolescents and young people who report qualitative information on certain topics. In 2021, also UNICEF selected mental health as the main topic for the U report. We had respondents from 10 countries of the region, Here in the Caribbean, we had Jamaica, and we have also Haiti, and some other countries in the Latin American region, as Brazil, Bolivia, Mexico, as you can see in the graphic. We had in total 8,444 respondents on the survey, and it was linked on how you feel mentally during the COVID pandemic. In May 2020, when the onset of the pandemic was in a high peak, these were some of the answers of people. 27% felt anxious, 17% were worried about others, 15% were bored, 11% were depressed. In September, after almost 6 months, people continue to feel anxious. This is adolescent people and young people. They continue to feel anxious. They were depressed. Depression came up compared to 6 months before, and they start worrying about themselves more than they do before. Before they were worried about others, maybe because of COVID, their parents, grandparents, older people, but then they realized, I have to worry about myself. And they were worried about themselves. Some others became in a good mood, and this is like the perception they had about their mental health. Also, these were some of the responses or some of the data that we found, that 27% felt anxious, and 15% were feeling depression, and women were having a higher percentage of anxiousness. 31% attributed their feelings to the difficult economic situation. 46% felt less motivated. And I'm going to read here what there's in the screen, on the right side of the screen, of a 17-year-old boy in Ecuador called Marco. And he said, I'm literally collapsing. Little by little, the decline advanced. I have mental problems, which were further enhanced by the pandemic. A 17-year-old boy was able to express that. Can you imagine? It's very touching. So can young people, how can we help young people? How can we hear young people? What can we do for them? What needs to happen? What spaces do we need to create for them to be comfortable to speak out and drive actions to support them? Adolescents and young people need to be heard. And this is a global demand. Like, they're speaking out and they're asking us, and you are asking us, and there's a lot of young people here, and you can tell us. And by the support that we are doing to the different countries, we can see how adolescent people is asking, and young people are there asking, like, mental health is an issue and we need to work on that. People with mental health and psychosocial distress have in common the difficulty of sharing or communicating the burden of their suffering. We saw it in the video. It's very touching and it told everything. And another thing is that in suicide-related processes with adolescents, sometimes the difference in a better outcome is to have an adult that listen to them and probably stop them from making the wrong decisions before expressing what they were feeling. Adolescents also need participate in scenarios to work and to express and to improve their well-being. They need to share with peers, others alike, other adolescent people who speak their language. They need to diminish their feelings of loneliness. And also they need to activate the feeling of control of the environment. Like, sometimes they feel controlled by adults, by the school, by the parents, by the environment themselves. So that sense of control needs to be deactivated, and they need to be themselves. We need to really engage and drive actions for adolescents by enabling environments, create physical spaces and emotional safety space for the adolescents, welcome the issues that concern them, assure the continuity and sustainability of the processes, and also safety for demanding quality of services and accessible services for mental health. We also, as adults, need to be committed to adolescent well-being and mental health. And it is important that adults must be trained in different scenarios, health providers, teachers, even parents need to be trained to understand and approach adolescents into mental health. This training needs to have consideration of the human rights approach, also from the gender perspective. Also listen openly. Adults need to learn how to listen openly without judgment, without prejudice, to establish a horizontal communication with adolescents and to separate their own feelings as parents. Sometimes when we are parents, we have feelings about our kids, and we need to just take out the helmet of parent and put on the helmet of a listener as a peer when mental health issues are coming. And also confidential listening. This is key for building trust. Some of the work that UNICEF has been doing is to finding new ways of facilitating youth-led policies, dialogue, and programming. So we are empowering different adolescent groups. Recently, in the region, in Latin America and the Caribbean, we created a network for mental health of youth. It took place in Panama City, and we had around 20 participants from all over the region, adolescent and youth people, who are going to be building together when they're back, now they're back in their countries, on mental health issues, bringing to policy, to advocacy. And here I want to share some examples of countries in the region that are working on mental health. Some examples, many others are doing it so. For example, Brazil is having a very interesting initiative that is called Pode Falar, that it's apps where they're doing counseling and talking to people. That are strengthening also institutional capacity of government to engage with young people, to creation of dedicated focal points at the district or municipality levels that include training on health education, social assistance, professionals that focus on adolescent mental health and non-communicable diseases prevention. Argentina also is working with the government and also with the youth in health advisories at secondary schools. They have created the Youth Fora that brings a lot of issues that concern adolescents, including mental health. They had the listening centers, what they call in Spanish centros de escucha, where adolescents can come, speak out. They have psychosocial support in there. And also, they have designed like a guideline that is called Let's Talk About, or Let's Speak About what no one speaks of. Yeah. And Jamaica also is working on very interesting initiatives as You Matter, Teen Hub, that maybe some of you are familiar with this initiative. And also they are doing some trainings of teachers, specialized teachers, to be working as mental health and health service counselors and providers at schools. So there are many teachers that have been trained, and I learned yesterday visiting the different projects that and partners that UNICEF is working with. There's going to be another big training in the following month for teachers, for about 100 teachers. So this is what I wanted to share with you. Thank you so much.
Thank you so much, Diana Restrepo, adolescent health specialist at UNICEF Latin America and the Caribbean Regional Office. Now, those statistics that you gave were alarming, very sobering for me as a young person, and I'm sure for other persons here listening, they were also very sobering for you. Just to repeat two of them. Suicide is the third highest cause of death among adolescents aged 15 to 19. Every day, more than 10 adolescents lose their lives to suicide in Latin America and the Caribbean. And when we compare those statistics with the fact that it's only 11 countries in the region that allow adolescents to access services without parental consent, it is sobering. So for my government persons who are here, I'm sorry, I like to point fingers and call names. I apologize in advance. My government officials who are here, my advocates who will go back to their countries, these are the targets we need to look at and work on. Very important. our next panelist.
Okay, our next panelist is Abigail Harrison. Dr. Abigail Harrison is a senior lecturer and consultant pediatrician, adolescent medicine subspecialist in the Department of Child and Adolescent Health. In her passion, she went on to complete a clinical fellowship in adolescent medicine at the Hospital for Sick Children, University of Toronto. She's currently the lead physician for teen clinic at the University Hospital and the co-coordinator of the pediatric residency program and the program director for the Adolescent Health and Advocacy Diploma Program at the UW-Mona. Her research interests include optimizing the delivery of adolescents' health care services, adolescent resilience, disordered eating behaviors, and the transition of care for adolescents living with chronic illnesses. Dr. Harrison is the current Vice President of the Caribbean Association for Adolescents Health and the President-elect of the International Chapter of the Society for Adolescents Health and Medicine. I take this opportunity to welcome you and to hand you over to Abigail. Thank you.
Thank you, Michelle. I'm just checking my time so I don't get in trouble with the gentleman over there. Good afternoon, everybody. I don't know about you, but I was getting a little post-alkaline tired. We have another word for it after lunch in Jamaica, but I won't bother to tell you what it is. I was also feeling a little inadequate because I only speak one language and everybody else up here speaks two. Maybe you and I, Christina, are the only ones. Some do three, and I'm like, woo! But I'm gonna just say patois is one. So I can count myself as having two. So anyway, we're gonna be talking about voices of Jamaican youth. And Diana has set the path for me to just follow on because this was work we did with UNICEF for State of the World Children's Report for 2021. So I'm happy to be here. I am very proudly Jamaican. And for those who don't know, I don't think anybody in here should not know, we're an English-speaking Caribbean island that is very loud and very enough. True? Yeah. Very true. But we have 2.7 million people. We're smaller than the non-English speaking countries, many of them, and we have quite a few Spanish-speaking people here with us. And similar to most of the countries in the Caribbean, we have about 21% of our population that are adolescents. Okay, so we've heard this before. The prevalence of adolescent mental health issues, it's going up, 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 up. And I do agree with your son. I think this current generation of young people are really the ones that are bringing it to the fore. And perhaps it is the only positive thing that came out of COVID, that there is more mental health awareness. So that's one positive thing. Now, the problem is that, you know, with this increasing prevalence of up to 20% in some countries, there's a lot of disability in terms of just quality of life for our young people. And that is really the big problem. So you could be physically well, but if you don't have mental health on board, as Claudina was saying, you know, you can't enjoy good quality of life. Now, there's an interconnection between our mental health and our social environment. And Jamaica is no different to many other countries, but we have a whole lot of violence here, and many of our concerns are within that social framework. At school, we have a lot of peer pressure, we have bullying, we have a lot of violence. Those of you who are following the news would have heard of multiple episodes in the last 2 to 4 months of young people hurting each other. And then, of course, we have lots of young people who dropped out of school because of COVID, because, you know, you spent 2 years not being in online school, although it was there, but who wants to pay attention to that? They got involved with other things and haven't returned. And of course, violence has a definite link with increased mental health. Now, COVID-19 had many challenges, not the least of which was getting sick physically.
But certainly for adolescents, they really didn't experience a lot of the physical issues, but they experienced a lot of the restrictions that went around. And now we are reaping the whirlwind that was sowed in terms of mental health challenges. So for me personally, I have never diagnosed as much mental illness in young people in my 15 plus years as adolescent medicine and further as a physician. And I suspect Claudine, I would probably say the same. I mean, we've just been diagnosing through the ceiling and it's distressing. You know, every day you give a new diagnosis of anxiety or depression or PTSD, and it's concerning. Now, what is good is that finally our health officials have acknowledged that mental health is a priority or should be a priority. What we need to do now is move from the acknowledgement to the funding. So hopefully we're on that path. And what we realized is that a deeper understanding of the drivers and the protectors of these concerns were really important. And I think that gave birth to the State of the World Children's Report, specifically focusing on mental health. And Jamaica was fortunate to be invited to participate along with the lead researchers through Johns Hopkins, along with other countries globally. So we were the English-speaking Caribbean nation that represented all of us. The local investigators were myself and clinical psychologist Carol James, both of us from the University of the West Indies. And what we set out to do really was just to hear the voices of the Jamaican youth and hear it from them. And qualitative research, as you know, can really give you a depth of understanding of a problem. We used a snowballing technique to identify adolescents from schools and within the community at large. And this was done in both rural and urban settings. Of course, we had the requisite parental consent and adolescent consent depending on their age and their assent, and we were approved by the ethics board. Unfortunately, we did these FGDs virtually, but I must say that that unfortunately is probably only for us, the researchers, because we're used to being face-to-face. The young people were quite happy to do it by Zoom because it gave them a certain added level of anonymity. And they used aliases to give them further security protection. As would be typical, we did thematic analysis. Now we had 5 urban FGDs and 4 rural, and they were split between male and female so that we could hear the different views by gender and identify, you know, what the gender differences were without any significant challenge of anybody being shy to speak openly. And it was a total of 70 young people. Now I'm going to go through some of the themes, and we had 5 basic themes that I'm going to walk us through. Now, oftentimes adults feel that young people won't talk. Well, I'm here to tell you, they talk once you are listening. And since we have a whole heap of young people in here, I'm hoping that you will agree with me that if people are listening to you and you have a voice, then it's a good reason to talk. But these adolescents were not only willing, but they were very able at expressing themselves and their emotional concerns. And what was interesting is that they really gave us the sense of just how pervasive mental health concerns were and how prominently depressive symptoms featured. They pointed to the various triggers, some of which were financial restrictions, academic expectations from their families, and abandonment by family. Now, I don't know if it's the same everywhere, but I think most people can identify with academic expectations, and there is high pressure placed on young people to get into the best high school, to pick your subjects and your career from the time you're 14 or 15. Like, you know, you have to lock in on something because nothing else will be available after. And these were all triggers for them. Now, this should not be surprising for us because previous research in the Caribbean has shown us that as many as 14% have displayed severe depressive symptoms. And this is quantitative data now. But if we add the moderate and severe, look at that, we're almost at 40%, right? So scary stuff going on. When we look at our global school health surveys, we'll see as many as 25% have considered suicide in the previous 12 months, and as much as 18% have made an attempt. What did you say, Christina? Sobering. Yes, sobering statistics. Our second theme, adolescents' voices are not being heard. Now, many adolescents, their perception is that adults, for them, they were unnoticed. Nobody was listening to them. One young fellow said, a rural young fellow said, the mentality of most Jamaican parents is that depression is not a real thing, or the mental state of a child, it's not a real thing. Some have actually spoken to their parents and their parents kind of dismissed it. So now just nobody confides in their parents anymore because that message is going around that they just won't understand. I see this in my practice as well. Differences by gender. There's always a gender difference, isn't there? Always. But I choose to speak from the male perspective today because there is so much reluctance for them to share and show their emotions. So one older urban fella says, it's okay for girls to express their feelings, right? More than boys, whereas to be men, to be tough, to keep our feelings aside. Boys have pride or confidence, so they feel like they should handle problems on their own. They don't need any help. And if they talk about emotions, they make themselves vulnerable or weak. But also, young men feel unappreciated. So our mental health and our feelings aren't really appreciated or given any consideration. That's a concern. Now, gender-based violence. I now can flip and give us from the female perspective. Girls worry about coming home alive or even safe or even making it home. Most times I don't even leave my road because you have some perverts in my community. And sometimes I feel very uncomfortable, And even if you tell somebody or say it to somebody like an adult, they will not believe you. So we move now to the impact of COVID-19 pandemic. I'm going to start with the secondary effects. And this is what I think the adolescents felt the most, not the primary stuff, basically in terms of being admitted to the hospital, but they experienced losses, not just illness in terms and mortality of parents or relatives, but academic losses, that opportunity to do the exam that you had been preparing a year or two in advance for, the losses of friendships that they had and then lost over the 2 years, and the loss of the friendships they expected to make. So talking to young people who are in university and spent their first 2 years of university, that's supposed to be like a wicked lime for the things were major, because nothing stopped sports in Jamaica and we stopped national champs. That's dread. Increased responsibilities at home. You know how parents are. I'm a parent. You're at home, then obviously I have to do something in the house. Obviously, because I'm not doing it all because you're also here. Never mind, you still have to do your studying and all of that, but you're home, so you're going to have to take on chores. So they felt that. They had to look after their siblings who typically would have been at school. And then came more free time. So what happened with more free time? We've become distant from each other, less connected, It unearthed hidden concerns. You also have way too much time to sit down by yourself and think. You're stuck in your room by yourself, thinking about everything that you've been dismissing, and that's how everything comes up. So yeah. So some young people who were very engaged at school, keeping busy, and all of a sudden, nothing to do with my time. And then they start to think and they identify the problems, and then they focus on the minutia, right? And they spiral. All was not negative. There was some better family connection. For me, I'm not really used to being around my family because I'm like at school and with my school hours and their working hours. So like, it's kind of good to like be around them a bit more so that I can like, bond with them and spend time that I wouldn't usually have. So some people improved. We picked up coping strategies, some negative coping strategies, a lot of self-harm. I think the reason why people do self-harm, like not suicide, but self-harm by itself, is because they're feeling so much emotional and mental pain that they think the physical pain is going to help block the emotional and mental pain. And this is from a young urban girl. Michelle mentioned substance use as an escape. So we know we have high usage here. I mean, in 2017, 69% of young people had used before 14. Social media is a problem in terms of what they're seeing. They use it, yes, as an escape, so there's some positives, but there are also some issues in terms of identifying insecurities, a lot of concerns about body image, developing body dissatisfaction. And we often think that we don't have that in the Caribbean. For sure, people think we don't have it in Jamaica, but when we look objectively, 1 in 5 adolescents score high on a scale that identifies at-risk young people for whether restrictive eating or binging and purging. We unearth the need for family and community support and the presence of persistent stigma in the community. So some people will mock you. They will laugh at you at things that you're going through. Okay. It stopped again. Not going. Maybe it's telling me a sign, hurry up. But I'm trying to hurry and it's not hurrying. It's not moving forward. There we go. In summary. So I'm not so bad. Jamaican adolescents will, in fact, openly discuss their psychological distress and the support and lack thereof received. There is greater desire for parent and community support. They're knowledgeable about the challenges. Recommendations. So what do we say? It's our duty, us in here, to find the resources where adolescents' thoughts and feelings can be acknowledged and they can be supported. Increase parents, HCPs, and healthcare providers' awareness that males in the local context respond differently, and so we must approach them differently. We have to guide them on how to identify the presenting features. So not all depressed people are going to look sad. Some are going to be straight up miserable and irritable. So we have to remember that. And we have to push for the government buy-ins. I'm right behind Christina with that. We need to get increased staff to offer these services so we can optimize. So we mentioned, okay, I didn't do that. And I'm stubborn. I'm going back. So Diana mentioned the school mental health literacy program. So all HFLE teachers in the island are going to be taught how to identify and recognize mental ill health and where to get help. So Ministry of Health has it. This is a text line. I know a few counselors who are on that text line very religiously. They don't miss it. They will cancel all other appointments for it. As an extension of the U report, there's U Matter, which is a text line also for young people, so they get to talk. And there's Safe Spot, which comes through the Children's Advocates space, another spot that they can talk as well. And the NCDA, that's the National Council on Drug Abuse, they have a telehealth substance abuse counseling. So we have a lot of work to do, but we are grateful to the adolescents that are helping to point us in the right direction for what they need. Thank you for listening.
Thank you so much, Abigail. And you brought up some very important points here. And one of the things that I want to say, okay, I'm just giving you some time to settle back down. Thank you. One of the things that I would like to say at this point, in agreement with Christina's statement and yours, that it is time for us to wake up and to act. It's no longer time when we just sit back and not address the issues of our adolescents and youth. What the literature will tell us that adolescence, it's a period of stress and storm, literally, where vulnerability is decreased. We saw from the presentation that Abigail gave that the social issues within the environment is actually impacting the mental well-being of our young people. So it means fix the things in the environment and we'll be able to fix our young people, isn't it so? So thank you very much for your presentation. I will now hand over to Christine.
Thank you. So when we look at the movement of addressing mental health in youth and adolescents, young people are not only quote unquote victims or survivors, we're also change agents. And so our next panelist is a young change agent, Miss Simone Bishop Matthews from Healthy Caribbean Youth, and she's a youth mental health advocate. She's a part of the youth arm of the Healthy Caribbean Coalition, and she holds a master's degree in public health and has been involved in various regional health advocacy initiatives through the HCC, such as front of package labeling and mental health. As she explores more of the public health field, Simone hopes to improve the health and well-being of Caribbean people, particularly more holistic approaches to mental health care and women's health through research and health promotion. In early 2022, Simone joined the dedicated subcommittee to bring this Caribbean youth mental health call to action and the related sensitization and launch activities to fruition. She's the HCY lead for Trinidad and Tobago for an upcoming meeting with mental health representatives within the Ministry of Health to discuss this youth mental health call to action and its possible integration locally. She'll be joining us virtually. Simone?
Hello, good afternoon, everyone. Can you hear me okay?
Yes, we are.
Yes, okay. So thank you. It's a pleasure to be here with you virtually. And last but not least, so I'll just share my screen. Okay. Okay, so my name is Simone. I will be talking about the Caribbean Youth Mental Health Call to Action on behalf of the Healthy Caribbean Coalition and the youth, the Healthy Caribbean Youth. So for today's presentation, I would give some insights into the development of this call to action. I would speak about what Caribbean youth are calling for. I would talk about the significance of the call to action and the potential outcomes if implemented in the Caribbean context. So, fair warning, I'll be mentioning the word prioritize a lot during this presentation. So feel free to take a drink of water because we're still working here. If you hear the word prioritize, but moving on. So this Caribbean Youth Call to Action, it stemmed from the collective feedback and concerns shared during 2 mental health related webinars. So as you would see here, the first one, reopening schools, shared perspectives on navigating mental health in the classroom during COVID-19. During this webinar, Caribbean students, parents, and teachers, they shared the challenges that they were experiencing with the virtual transition in pretty much every aspect of their life, learning, physical activity, interaction with peers and friends, and how the negative effects that this played on their mental health. The second webinar, which was held in 2021, the Future Talks, Cultivating Healthy School Environments, Navigating Mental Health. So as the title suggests, this was an open forum where Caribbean youth, specifically secondary and tertiary level students, they shared their experiences with how their mental health was not given the priority that it deserves, and they were finding it very difficult to cope, with this new normal, as they call it. But also with these webinars, we also use the Youth Advocacy Toolkit, which was developed in partnership with the Healthy Caribbean Coalition, the Healthy Caribbean Youth, and also the World Obesity Federation. So strategies from this toolkit, we engaged youth and the public through various social media tactics, including infographics where we hope to raise awareness and build support for the call to action. We came up with dedicated hashtags such as hashtag youth speak up, hashtag healthy Caribbean, and hashtag no health without mental health. We released a collaborative video showcasing the different voices of youth. We hosted 2 youth-led Instagram lives to really propel that messaging and to maintain this messaging, not only for the launch of the call to action, which was World Mental Health Day, but beyond, because mental health should not be just an issue that we tackle on one day, 1 month of the year. We also recognize the crucial role that our governments play in health advocacy. So We send letters to the relevant policymakers where we intend to meet with them to discuss the call to action and also its implementation in local context. We also engaged with the media, with the media, and we held a press conference and subsequently released a press release to not only inform the media of the call to action, but the media has such a crucial role in spreading mental health related news and also in responsible reporting. So with this in mind, we then started to develop the call to action. But it wasn't just these webinars that's I guess sparked the development. Some of the key concerns that we tried to maintain throughout this call to action, particularly the need to prioritize mental health and well-being of youth by creating more supportive environments where youth feel heard and they feel free to share without fear of stigma and discrimination. As the previous panelists would have mentioned, stigma and discrimination are still factors affecting, health-seeking behaviors and just persons acknowledging that they are struggling mentally. We also hope to encourage more equal investments in mental health as we would physical health, because we can't just not improve mental health if we want to ensure universal health coverage. That is a goal that we're looking at. So mental health must be included. Through the development rather of the call to action, we also had insight from persons with lived experiences, so persons living with NCDs, persons with pre-existing mental health conditions, and they really showed how the pandemic worsened things for them in terms of access to care and medications. And more importantly, we hope to amplify the role and the value that youth have in advocating for the change that we want to see, particularly with our mental health. So to develop this call to action, we know we wanted to take a multi-stakeholder and an intergenerational approach. And by multi-stakeholder, I just mean a group of organizations that we thought would give useful insight, not only from across the region, not only the different risk factors or determinants of mental health, but solutions that we feel would be able to address all aspects of the mental health crisis that we are seeing. So these virtual consultations, they were conducted from the beginning of the year to August 2022. With various stakeholders such as private sector, particularly an insurance company. We did secondary school students, we did primary and secondary school teachers, youth advocates, national and regional civil society organizations. We did youth organizations, persons living with NCDs, and also we wanted to include underrepresented and marginalized groups, so representatives from Indigenous and the LGBTQ communities. We also received technical guidance and feedback from our regional partners such as UNICEF Jamaica, PAHO, and CAFA. So these consultations, rather, they spanned across 10 Caribbean countries. So we have Belize, Jamaica, Aruba, the Bahamas, Antigua and Barbuda, Dominica, St. Lucia, Barbados, Trinidad and Tobago, Guyana. So we really try to capture as much of a Caribbean representation in this Caribbean youth mental health call to action. So the call to action outlines 4 key areas that we believe and we hope will tackle the mental health crisis among youth, but also to strengthen mental health care systems for our collective society. So firstly, and also it's important to note that each call was accompanied by specific actions and implementation considerations that were informed through these consultations as well. So firstly, we are calling for leadership. to prioritize the integration of mental health into policies, existing policies, and emergency plans in all its phases, including preparedness, response and recovery, and also providing opportunities where youth can be engaged meaningfully in implementation considerations. Because at the end of the day, youth are the experts, or we are the experts in the issues that we are facing. So use us to that advantage. We are also calling on our government to prioritize research to improve mental health in terms of increasing the evidence-based approach to inform the implementation and evaluation of mental health policies and plans through public to private partnerships, and also providing innovative and sustainable funding to support and incentivize youth-driven evidence-based mental health initiatives. We are also calling on our governments to prioritize regulations or policies to protect and safeguard our children in the spaces that we occupy. So in schools, in the workplace, in the community, really. So particularly protection from exposure to health harming products such as unhealthy foods and beverages, vaping products, tobacco products, alcohol and bleaching products, discrimination in all forms, in person and digital, and also discrimination and stigma towards seeking help for their mental health. And finally, services. We are calling on our governments to prioritize services, improving the accessibility, the affordability, and the quality of services that are available. And particularly in schools, the presence of a guidance counselor or master's level clinical psychologist, and also increasing the student to mental health professional ratio in schools at all levels. We also thought that implementing protocols and referral systems for students and staff who find it difficult to manage or have mental health challenges, that they can use that to seek help. In the workplace, we also want to encourage an environment where emotional health and wellness is prioritized. And that includes through increased affordability, ensuring that mental health care and treatment is included in insurance schemes and packages. So basically, with these youth-informed solutions, sorry. With these youth-informed solutions, we hope that it will not only carry the dialogue forward with mental health, but kind of set the tone for our governments to prioritize mental health more. So we haven't just made up these calls out of nowhere. They actually align with global mental health guidance and plans and recommendations from the WHO, particularly the WHO Mental Health Action Plan, recommendations from the WHO World Mental Health Report, the Live Life Implementation Guide for Suicide Prevention, and also the recently published Policy for Improving Mental Health. So we also wanted to increase the prioritization of mental health and well-being in primary health care. So we would hear this whole universal health coverage, universal health, but mental health needs to be something that is prioritized by our physicians, by our mental health care professionals, by our nurses, by all health professionals. We want to also amplify that multi-sectoral dialogue that we hope to achieve with this call to action, to bring our issues, to bring our concerns for our mental health to regional policymakers, because we are recognizing that, while we can't advocate individually or collectively as a group of youth, we know the influence and the impact that our governments have. We also want to prioritize youth voice. Again, youth are the experts in the issues that we are facing, so it's important that youth be meaningfully engaged in these discussions. creating supportive environments where youth feel, safe to express how they feel and not just focus on, as was previously mentioned, the presence or absence of a mental illness, but just holistic mental health. So if you remember anything from today's presentation, the potential benefits and outcomes of this call to action, if implemented, can be vast. But really, we want this call to action to promote mental health more than it has before. So we want to create more holistic and tailored mental health systems in the Caribbean. And tailored meaning we want our mental health systems to reflect the different users, to reflect their unique needs in terms of their age, their gender, their socioeconomic status, and also to reflect the different risk factors or determinants of mental health. That multi-stakeholder intergenerational dialogue, we cannot do this in silos, we have to do this collectively. So increasing that dialogue where youth are engaged as well would definitely propel this conversation and action on mental health further. So our schools, our workplace, our communities, we need to make mental health and well-being of our children, of young people, a priority. We can't just send them to school and expect things to be okay. We need to have policies or services in place where they feel that they are comfortable and they can share how they are feeling. So we also want mental health policies or plans to be informed by research and youth input. And as you can see, the interconnectivity of the four calls. Research is needed not only to back the policies or plans that we hope to implement with related to mental health, but also research is needed to build research capacity in mental health, and also in the planning, in the delivery, in the evaluation of mental health services. So, youth. Amidst all the tragedy, the COVID-19 pandemic has provided a window of opportunity that's, to bring NCDs and mental health to the forefront. And we must not let this opportunity slip from our grasp. So if you agree with anything I have said today, I encourage you to scan this QR code where you can find out more of the call to action on our webpage. And if you believe that you want your voice to be heard, and you want society, a country, a region that prioritizes your mental health and well-being, I encourage you to also sign the pledge that we have on the webpage and let your voice be heard, because we cannot just sit still. Mental health is an issue that has been, we cannot just expect to quote unquote build back better beyond COVID-19 without addressing the issues that have arisen or been worsened by the pandemic. And unfortunately, mental health is still on the list. So in closing, as this beaten up brain on the side here in this image signifies, there can truly be no health without mental health. Thank you, and I look forward to your questions.
All right, thank you so much, Simone. There can be no health without mental health. So we're going right into our Q&A. We are a little bit beyond the time frame that we were given originally. So we will try to make this section very pointed, but still profound, right? So do we have any little papers in the audience that we want to send up with our questions or our comments? So you need to give my co-moderator some of these. Or let me just have a, she took all of them. Okay. All right. This is, wow, I love to see this when everybody was really engaged, right, Michelle? Everyone was really engaged, really writing down their questions. All right, so this one is for you. Okay. Let's See if we see any more for you. Yes, there's another one. All right, you could read one in the meantime, Michelle, while I give Dr. Cayetano hers. We're not sure where.
I'm going to read this one. Something in it caught my eyes. A friend texted me that she was everything, has everything, ready to die by suicide. What can I do? What resources can we have to help? Consider two scenarios. One can reach that friend. She lives close. And the second one can't reach that friend. She lives far to anyone. So I'm throwing out that that's a matter of concern, yeah.
Thank you for your question, and I'm sure you're very concerned. So the question is, it has been read, it's someone who has a close friend that is considering a suicide. And you know, every person, I hope that we get it clear, because sometimes we tend to think that people, as I mentioned before, are just pretending or calling for attention. I know there's no such a thing. People are suffering, people are having issues. So I think that every call should be taken seriously. And when I say taking seriously, is that you want to encourage the person. If it's too far from you, encourage them to seek help. I think when Abigail was doing her presentation, she presented some, I think the helpline, share a helpline. If you can go with them to seek help, go with them, don't send them alone. So you make sure you're there and do not judge, just be a listening ear. I think it's very important that we take every call seriously. And you know, sometimes people will tell you, no, I don't want anybody to know. I don't want nobody in my business. I don't want to. Yes, and I understand and I'm hearing you, but you know, this is very serious and we need to do something about that. And that's why I'm here with you. Walk with them. Don't let them walk alone. I think that will be my message. You wanted that was what this one?
Okay. Hello? Yeah, sorry. So I have two questions. I would like to be kind of brief and find the best, but not the perfect answer. So here's one question that says, parents and teachers often want and need to be in total control of their children. How can they be convinced to give up that control? I will answer with an African proverb that I like a lot, and probably you might heard in the past. And it says, it takes a village to raise a child. Sometimes parents believe they are the only ones who need to raise their children. And this is why sometimes they feel they need to control every movement. But here, with the presentations that we are listening, we are trying to build networks. We are trying to get support from peers, from health providers, from teachers, and also to train parents and teachers how to better be teachers and parents for the adolescent and young people. It is a challenge. When you're adolescent, you think, you know, these parents, but then when you become a father, a mother of a kid, an adolescent, you start understanding so many things. So the way of giving up control, I think it brings individual issues as a parent, recognizing your limits and also your role as a parent, but also with all these mechanisms that we are trying to provide as Helps Adolescent Thrive, that is a strategy from UNICEF that is creating like training curriculums for teachers, for caregivers, for parents on how to better support adolescents and youth on caregiving, on supporting on mental health. These are tools, but also it takes individual recognition of the task and also get support from many places, from the village, from the peers, from the teachers, because there's no perfect answer for this. This is a way of responding to it. Of course, it's not probably what you were expecting, because I cannot say Like each parent is different, but there are tools, there are mechanisms, and also the society needs to work together to respond to the adolescent needs. So this is the other one, now that I have the microphone, or someone else. Yeah, or monopoly. No, and the other question is, parental consent was highlighted as a barrier to adolescent accessing mental health services in some Caribbean and Latin American territories. However, the cost of these services is also a barrier, and many of the free clinics are overwhelmed. What moves have been made to overcome the barrier of cost, and how can youth leaders support this initiative? This is a great question, and it's a reality. There's a barrier of accessing because there are very few specialized people in mental health and psychosocial support in our region. Most of these specialized professionals are in the private sector, not in the public sector. So this is why it's very expensive. And in the clinics where it's free, it's overwhelmed. So there are many things that are being done. Is training health providers. Although there are no resources in some of our countries in the region to have psychologists, psychiatrists in every clinic, at least train the health providers in providing services and also in identifying mental health and psychosocial support problems, as Dr. Cayetana was referring, teachers, health providers, so that they can refer in the network to whoever can provide it. This is something, of course, adolescent and youth people can do, like raising up your voice in these adolescent groups, making advocacy in decision-making, and saying like, we need services. Like you have to raise up your voice. So this is something that has to be done. And also, regarding consent, also many partners are working in legislation to reduce the consent for the services. And also, as you were saying before, Christina, like governments, people who are here, we need to bring back what we are listening from the young people to our countries and really bring that to decision makers. It takes time, but I think now that is starting to come up, we need to continue working on it. Yeah, thank you.
All right, thank you. We're going to take another question. Okay.
It's a good one. Thank you so much. I think if we were in school, in class, this will be a test. This will be one of those test questions. And I'm sure Abigail would like that because she's teaching. So you say, what strategy do you recommend to destigmatize mental health? Isn't that a test question? So there's different strategies, but maybe what is important is to know what is according to research, and we should do more research in the Caribbean because this is research from other countries, but according to research, there is 5 or 7 different kind of strategies to fight stigma and discrimination. And remember what we're fighting is discrimination, right? Because stigma, we all stigmatize, don't we? We do. Be honest with yourself. We stigmatize people because they are different. They're not like us because, you know, internally we tend to do that. But what we want to fight is discrimination. Everyone has access. So I always tell people this story, and I know we're running out of time, but I have to explain that to you quickly, that if someone was to tell a parent, you know, Mom, I'm in love with this young man, he is an attorney, he has his own private practice, and he has a thought. Mom will say, yes, marry that. I mean, that's okay, that's a good catch, why not? Oh, but you know, he has bipolar disorder, and he suffers from schizophrenia, his parents have schizophrenia, and his parents will start today, what's happening to you? Why would you want to marry? Remember, so that we tend to, these are the things that happen, and these are real issues. So now, what I wanted to bring to you, when you talk about stigma, we have to be very careful that what we want is to be able to decrease discrimination. And what are the strategies? So we have reform, we have people protesting, there is policy, there's educating ourselves, learning more. But according to research, as I say, social contact is the best strategy. So what do we mean about social contact? Someone in the room saying, I suffer from anxiety, but I have a job and I'm successful and I recover, I do well. Because we tend to think that people with mental disorder it's a life sentence or a something like that. So, but when we see people that can recover, they inspire hope. We know they can do well. And of course, they have the relapse. It's just like having hypertension or diabetes, but they can lead healthy life in general with support. So I think that's one of the best strategy. But as I said, this is according to research. We'll have to do more research in our Caribbean to understand whether this is consistent with other researches. Countries.
And then the last question we'll have from
Okay,
Dr. Harris.
so I had many, but I will combine one. There were two persons who asked about mental health from the male perspective and how we can work on that. And I would piggyback on what you had just mentioned, Claudina, in terms of social contact. I think we are getting to the point where some men now have the concept that they recognize they have mental health challenges and they're ready to talk. So now we have to find where they can talk. So we have to create the spaces. That means that both the men and women have to now be willing to listen. Sometimes, your own partner will tell you, oh, get real. You can't be like that. So we have to now get into the space where we can listen. And sometimes we don't have to say anything. There's always this temptation that once somebody speaks to us, we have to say something. We have to fix it. No, sometimes they just want to be heard. So I think one is creating that space in the smaller areas where they can talk. And then persons who carry swing can stand up in public and start to talk about their own struggles. It's happening elsewhere globally. And slowly but surely it's starting to happen here. I mean, we just had, is it Sim Soul? I think it is, where Simone Clark Cooper has her talk show. And there was a male there, voicemail singer, who spoke about his own struggle with depression. And I think that can make it more real for other persons. Part of the question that was here is, how do I protect or manage this to protect the next generation? And I think if we start in our homes, so we here are the converted, so one by one, we convert the next person beside us.
Thank you so much for those questions and answers that were provided today. And some of the questions were very excellent. And I'll just throw this one out. I think some of the answers actually came out in the responses that were given, because these two questions actually points to the fact that we have been talking about the problem. How is it that we solve these problems? And I think these answers were given. So in summary, we need a cultural transformation. We need to have that social change that will take over. We need to create the supportive environment for our young people, our youth, our adolescents to actually grow up and be nurtured in a positive way, moving away from the deficit approach of nurturing, where we consider young people as the problem. They aren't the problem. We should be able to hone their skills using the positive youth development approach. We should be able to hone those skills, and we should be able to help these young people to capitalize and to become more resilient. So in closing, I'll just like to say it is time for us to act. We need to remember also that our young people, that they are a homogenic group. There are no two groups of young people who are alike. They're all different with different needs, and we need to bear these things in mind. And as government representatives and civil societies and all the other groups out there, parents, schools, we have to begin to act now. I want to thank the presenters today again for the invaluable contribution that you made and the information that was brought out to us. And also for my co-facilitator, who did an excellent job as usual in helping to moderate this session. And thank you, the audience. And for those who are online, Belize and Trinidad, we are also thanking you for your participation. Thank you.
Hi, everyone.
Thank you very much to that panel, but I just want to make some housekeeping announcements. On behalf of the planning committee, I want to say that we want to encourage everyone to ensure that they are in the rooms, in the right places, at the right time to participate in all of the sessions. We do have a level of accountability to our sponsors who committed their resources to this Congress. And therefore, we kindly ask you all, please, if you see your friends, just remind them that the sessions are taking place and they ought to be in the rooms. Some people are asking for even, I think, a CMEs, they call it. And therefore, we can't provide those if you are not in attendance at the various sessions. So please, I urge you to be on time and also to encourage your friends to make sure that they're in the rooms and attend the sessions that they wish to take part in. So now we have the building sessions we have the skills building sessions that are going to take place now. And therefore, Shanti is asking that Maria Fraser, Zoe Simpson, Akil Nibite, and Sienna Luan meet her out in the front. Right here, right in the room here. And Shanti is right here in front of me. Okay, so thank you all very much and continue to enjoy the rest of the sessions. And don't forget, after the skills building, we do have a very important function. We do have a very important function this afternoon, which is the opening of the Congress, and we have a number of dignitaries that will be participating. So we would want to encourage you to take your seats in the meeting at least 10 minutes before the function begins, because then we will have the arrival of the dignitaries to participate in the session, okay? Thank you very much.
Just one reminder, sorry, those who need CMEs, please, you said it. Good. Yes, make sure you're here. Don't be fluxy, right, Donna?
Good afternoon, everyone. Afternoon, just asking for everyone's attention just for 1 second, please. Unfortunately, in the interest of time, we will be starting the sessions at 4 o'clock, which is immediately. So we'll be having our break after the sessions. And on the sheet where you see we're going to be starting the evening session at 6, that was a mistake. We'll be starting at 7 instead. So the breakout rooms will start actually now, please. This is Rocksteady 1. joking. I'm just going to invite everyone sitting in the room to just come to the front of the room and fill the seats at the front as we start this session. Please, just inviting all to the front to fill the room. Okay, yes. Yes,
Hello, good afternoon, ladies and gentlemen. Can you all, we're going to start now. So we'd love if you could come a little forward. The sooner we start, the sooner we can finish. You can get yourself all dolled up for the function later on. Dolled up and what's the man's name? Dolled up and manned up.
No, I don't know these gender roles. These things were lost as I was growing up in a household with very woke women.
Oh, okay. Yeah, it's just I think guys can doll themselves up too.
Maria, that was you, right? Correct? All right, okay. Rocio, can you hear us? Can you hear us? So you'll speak in Spanish in here. Is she here?
You're right, Sharon. Just trust me. I know how these things go.
Correct? Yes. Yeah. Well, yeah, you need to go to the English. So someone needs to hear her.
As long as the presenters are here, we can start.
Well, Dennis is here. He's the first presenter. So.
Hello.
Yeah.
Shakira
and yeah. And we have
she's online.
She's online.
Okay. And Adu. Where's Adla?
Hello.
He was here a minute ago.
This is Breast Cancer Awareness Month. I thought we'd have more representation.
Yeah, right. Not sure. You know, I think I have a question down. When is it on hold the mic? Sure. Yeah.
You have to switch your system.
Okay.
I think the mic for you. Check, check, check.
Okay, folks, we're going to start in a couple of minutes as soon as we're joined by the rest of the presenters.
By the way, thanks for sticking around this late. You guys are the real MVPs. Just letting you know upfront. I know you guys are tired. To fill the room while we wait, I will sing. No, I won't.
Is everything okay there, Shakira? Leslie, you're okay? Okay. Oh, okay. Okay. As soon as you're ready, just give us the go ahead and we'll start. Shall we start? Okay, well, okay. So then we're gonna start. Great. So a special good afternoon to all of you, all you adolescents, young people, those who are young at heart. I'm really excited to be here. Welcome to all the persons who are here with us in person as well as to those online. It's a pleasure to share the co-moderator role with my newfound friend here, Stephen Andrews, who's definitely very young, but I'm the one who's young at heart, so not to worry. My name is Denise Chavans, and my passion for sexual and reproductive health, including HIV, was born really when I did my PhD in epidemiology on sexual and reproductive health and HIV, and I did it research in an inner city community in Jamaica. So the importance, for example, of gender and the way it drives sexual and reproductive health behaviors was something that I learned early on. I now work with the United Nations Population Fund. I'm based here in Jamaica. We cover 22 countries and territories. We are the UN Agency for Sexual and Reproductive Health. Welcome to all of you to this abstract-driven session. We're going to be having 4 presentations followed by a question and answer period. We've been hearing firsthand today of some of the issues that affect adolescents and youth in all their diversity and vulnerability. We know that we're talking about a diverse group. This is not a monolithic group. So we're talking about in-school unattached youth, LGBTQI persons, young people living with HIV, persons with a disability, sex workers, teenage mothers, indigenous persons, migrants, refugees, and persons living in slums and rural areas. We're going to be hearing from some of the work that has been done by a number of our presenters this afternoon. I'm going to yield the floor to Stephen to do the introductions of the first set of persons, and then I will introduce my colleague from UNFPA, Adler. Over to you, Stephen.
Thank you, Denise, so much. Like Denise would have said, my name is Stephen Andrews. I'm a doctor at the University Hospital of the West Indies, and I am also very passionate in sexual and reproductive health. Maybe baby steps for the past 5 years, trying to follow that path that Denise and others would have left behind. Today, our presentations, I just want to remind our presenters that you have 15 minutes to present that action-packed presentation, and afterwards we'll have that question and answer segment. Our first presenter is a young man hailing from the country of Guyana. He is a humble champion in his own right and has a wealth of knowledge with over a decade of experience in civil society leadership, as well as he has a decade of experience in civil society leadership in Guyana and the wider Caribbean region. He completed his tertiary education in the area of communication studies and is now in his first year reading for a bachelor degree of law from the University of Guyana. Mr. Dennis Glasgow's development work in Guyana spans 8 of Guyana's 10 administrative regions, and Guyana is a huge country, 83,000 square miles approximately. He focuses on issues like life skills development, human rights, sexual health and rights, gender equality, gender-based violence, and education. He loves traveling, meeting new people, as well as learning about new cultures. And he's passionate about volunteerism and has a talent to literally connect with people anywhere he goes. His presentation promises to be quite engaging and eye-opening, and please help me in welcoming Mr. Dennis Glasgow, everyone.
Thank you, Stephen. I think you were lying a bit or fluffing information, but it's fine. I appreciate it. My presentation would be on a program empowering teen mothers. I don't know where the presentation is right now. Okay, there it is. Yes. So this is an abstract I submitted based on the work I do with an organization in Guyana called Women Across Differences. This is a civil society group that works primarily with young girls, teen mothers, and at-risk women. And the background of the project is that there was this, we recognized that Guyana had one of the highest rates of teen pregnancy. You can go to the next slide for the background. One of the highest rates of teen pregnancy in the region. And this has been something our government and civil society and development partners have been addressing over the years. You can go to the next slide, please. Pardon? Oh, there's a click. Oh, fancy. I feel like I'm not so young right now. As I was saying, just to give some background of the program, Guyana is one of the few countries in the Caribbean with a reintegration of teen mothers policy, which exists in Jamaica as well. And I'm not sure which other Caribbean countries have one, but that means that young women should be afforded the opportunity to return to school after they would have become pregnant. But this does not happen all of the time. This is because adolescent mothers often lack the life skills, the knowledge, and of course, the support to do so. So we embarked on this project teaching key life skills, exploring self and values, discussing topics like sexual reproductive health and rights, focusing on contraceptives and condom use to not only prevent sexually transmitted infections and diseases, but also other unintended pregnancies. We also focused on mental health and providing peer counseling and support to these young mothers. Some of the key actions. So we met and a training curriculum was developed to cover some of these key issues affecting the mothers, focusing on self-esteem, life skills development, and increased competencies in understanding and caring for their sexual reproductive health and rights and their mental health. An activities-based interactive peer-to-peer learning workshop was also conducted. Peer counseling and professional counseling services were made available to these young mothers. And at the end of the workshop, they were outfitted with not only brochures and learning materials and condoms, but care packages and hampers for their babies as well. A post-workshop survey was also conducted. Some of the results, this is more so a bit more about what happened after. So the participants either returned to school because now they had a support system with other teen mothers and with the organization as well, which has a social worker heading that organization who also offers counseling support to these young mothers. So if they didn't attend school after the program, they made plans to attend an academic or a trades-based learning institution with the support to the organization. There's also increased knowledge on sexual reproductive health and rights issues, specifically around contraceptives and condom use. Virtual support group was established for participants to keep in contact with each other. And they were also networked with a larger group of teen mothers who have recently formulated their own civil society or are in the process of formulating their own civil society group to provide support to teen mothers and at-risk girls in Guyana. A few of the participants did access mental health services, and some of them also brought their partners in for counseling as well. General conclusions from this particular workshop or from this particular program was that teen mothers need support when they get pregnant, during the pregnancy, and especially after they would have given birth. And this is not to say, oh, the government has to do everything or the government isn't doing anything, but there's a need for a multi-sectoral approach to address this particular issue with the support of civil society partners, of course, the communities they are part of, and their immediate support group or their immediate systems or their family units. We also need to have more opportunities for teen mothers to receive additional support when, which can return the power to them when it comes to their education and development. Because oftentimes we say things like, oh, they need a second chance, or we need to give people more chances, but we are not actively providing the spaces and opportunities for this. And we know about stigma and discrimination in the actual high school system from other young people and even from teachers and support staff at these institutions who often have very negative things to say when young girls become pregnant. Lastly, programs like this give teen mothers a chance to balance self and professional development with their long-term childcare obligations, taking care of their mental health and being present for their babies. So the idea is if this program can be streamlined into other existing programs from government and civil society agencies on a long-term basis, I think providing that support to teen mothers will sort of help them provide that support and of course improve their parenting skills and of course their overall development. And I think, yeah, that brings me to the end of my presentation. Thanks.
Thank you very much, Dennis, for that presentation. Guys, jot your questions down, and also those online, have your questions ready. All right. Now to introduce our second presenters with an S. There's been a twist. We'll be having two very influential women from the country of Barbados. They are from a movement called Dance for Life Barbados. And if you've never heard about Dance for Life Barbados, then you're missing out on a very incredible international organization. These two women by the name of, please, if I mess up the pronunciation of your name, I'm so sorry. Shakira Mtaj Cave and Miss Leela Raffel. They are both co-founders of Dance for Life Barbados, which is an NGO in Barbados that seeks to inspire, educate, as well as activate young people to reduce the spread of HIV, STIs, unwanted pregnancies, and sexual violence. When you think about dance, you want to always conceptualize that it is something that helps us to express ourselves, all right? And this is something that they hold very close to them. Just a bit about them. Shakira enjoys horseback riding, and Leela is very avid in free diving, rock climbing, and wildlife exploration. So there's just more to them other than sexual and reproductive health. They both have over 10 years of experience, more than 33 years between them both when it comes to sexual and reproductive health. So these very young people that we have coming up before us will give us a little about some of the work that they would have done in Barbados and through Dance for Life. Please help us welcome Shakira and Leela.
And also, I just want to add, I'm not very young, but young at heart. Are we able to move that? So we had some technical difficulties and we just are trying to, okay. Are we able to switch it on this? Okay, it was just. So good afternoon. Thank you. We had a few technical difficulties, so we're just trying to wing it and make sure we give you the presentation we wanted to. So as Stephen said, we are Dance for Life. We are a youth-led comprehensive sexuality education program based in Barbados. And we are going to have three kind of presentations today amalgamated into one. Don't worry, we're not going over our time. Firstly, we will talk about the general Dance for Life program, our ethos that runs through all of our different programming. Then we're going to look specifically at how we involve youth in a meaningful way. And finally, we'll look at our vulnerable youth programs and talk about exactly how and why we include vulnerable youth at every stage in our programming. So those of you that might not be familiar with Dance for Life, our mission is really to bring an end to STIs, including HIV, unintended pregnancies, sexual violence. And we do this by providing young people with the knowledge, skills, and hopefully the confidence to promote safe sexual choices and make good decisions for their lives and for their futures. So we're going to go into our methodology now. So primarily we are focused. We're focused on young people 11 to 19 years old. We have programming in the secondary schools in Barbados, both the public and the private. And we also work with government industrial schools. If any of you are familiar with those are kind of like the juvenile detention facilities, as well as the children's homes, the adolescent youth within the children's homes on the island. So we're also peer-to-peer. We try as much as possible to get the people delivering the program to be young people. We understand the importance of peer-led education. So we recruit volunteers from different youth organizations around the island. We recruit them from UE. And then we train them in a method of really in keeping with the Dance for Life ethos. So making sure that the information they provide is accurate, that they are non-judgmental, that they meet young people where they are, that our sessions are always youth-friendly, they're really interactive, and that they're approachable for young people. And we are also informed. We start every single session, regardless of whether we're in the schools or in the out-of-school sessions, with a baseline survey. We think it's really important in order to deliver effective messaging that's going to affect behavior change, to have all of the information. So we start with a baseline survey that helps us to tailor the program in conjunction with guidance counselors to the specific cohort's needs. So we're not giving information that is irrelevant to them. And we also are able to do an endline survey at the end of our sessions to measure our impact. We also do follow-up based endline sessions. We try to do about 2 years out from the program because we really want to measure longevity, retention of information, and long-term behavior change. We also have a National Youth Council that informs all of our materials, all of our data, and they act as an advisory board for us. We are fun, or at least we like to think that we're fun. So our sessions are always really interactive. They're, as I said before, youth-friendly. They're activities-based. We do a lot of games. We try to stay away from the traditional lecture style of classes that are certainly the norm in Barbados, probably the Caribbean as a whole. We use different incentives as a way to encourage quieter students to speak up. And the real purpose is for them to have fun without realizing that they're learning. And we're also advocates. We also encourage our young people within the National Youth Councils, as well as in all of our programs, school-based and out-of-school-based, to be civic-minded, to think about community actions that they can do, put their mind and efforts behind, and we support them in that. And then just cross-cutting themes, we try to stay as current as possible. So in keeping with where young people are, meeting them in those places, we challenge youth to think critically. We know that while we try to give as many situational
experiences in our classes as possible. We know that young people are faced with all sorts of different realities, and just being able to examine a situation on their own and think, well, does this make sense? Am I putting myself at risk if I do this situation? We try as much as possible to be clear and approachable, and we again try as much as possible not to be top down in our approach. And we'll talk about that in a bit when we talk about how we meaningfully engage young people.
So our delivery, so how does this actually look? So we have 4 steps to the program. We're going to go through each of them. The first is inspire. And the aim of this step is to create a movement that young people really want to be a part of. One of the things we learned when we were kind of doing a situational analysis before starting the program was that young people retain information that they hear from cool people, their friends, older cousins, and we knew that in order for them to really resonate with the information, they had to think that the movement, the program was cool and fun. So our first session is basically an introductory session. We try and gain their buy-in by doing a lot of games. As Layla said, we use a lot of incentives. We do music, dance. There's a lot of dancing in that first session, which you'll see in a little bit. And we just hope that with their buy-in, they're going to internalize those messages.
So the second step of the program is focused on education. It's called Skills for Life. And the purpose of this step is really to ensure knowledge transfer in a fun and interactive way. So within the school setting, we work with the health and family life education curriculum, and we have a minimum of 6 contact sessions with students, sometimes more, depending on what the issues within that particular demographic are. Within our vulnerable youth institutions, we work primarily in the summers, and we do intensive programs then, and then we do regular monthly sessions with the adolescent children's homes and the juvenile detention facilities. The core topics that we cover are reproduction, pregnancy prevention, STIs, substance use, self-esteem, empowerment sort of throughout. And then based on the baseline results, that helps us to really tailor the program to meet the specific needs of the young people at the particular institutions. So we might look at our baseline results before starting and say, okay, well, we need to specify, like specifically focus on mental health within this particular group, or we need to focus on negotiation, self-efficacy. So that really helps us to specify the topics. We also have a manual that was created by young people as well as other partner organizations. This is our second version. We're currently finalizing our third, but every student is given a Skills for Life manual. It's like the textbook for the education classes. It's theirs to keep. Our sessions follow along with the manual. Of course, we don't have the capacity to go through everything that's in the manual in our classes, just because of time constraints, but it does have a whole host of different topics, and this allows students in their own time to go through. We also know sometimes students don't feel as comfortable asking questions in class, and so they're able to use this as a reference point. What we also find is it does spread the information, because we have a lot of parents, a lot of guardians, siblings, cousins, who get the manual at home as well and come to us asking for it.
And our final session, we do a little game that tries to consolidate all of the information and reinforce it. And that is also the session in which we will conduct our first our first endline session with them, and then we'll do a follow-up a few years later. So our third step is activate. We talked a little bit about that earlier. It's where we try and foster that civic mindedness. So young people are asked to plan a community action of some sort that does not benefit them. And the community can be their schools, it can be their neighborhoods, it can be, national. And we will provide technical support, any type of funding that they need for them to execute these actions. And after that, they become agents for change. And we find that this is a really big step to help them with empowerment.
So our final step of the 4 steps is a celebration event. And the purpose of this step is really to bring young people together and to celebrate the achievements that they've done throughout the program. So this is a biennial event. Every 2 years, we bring young people who have gone through the program together in one space, as many young people as the venue can hold. We also invite partner organizations who we ask to create some sort of very interactive session at their different booth. So it's an event that we have lots of DJs, different performers, a lot of musicians, dancers, things that, again, young people really enjoy. And this also feeds back into that first step because it makes younger students who haven't been part of the program want to take part in the program because they want to come to the event. In terms of our incarcerated youth, we try to replicate this as much as possible within the institution by just having different fun day events of their choosing. So whatever activities they decide that they want to do, that we're able to do within the institution, we'll do.
So our results, we're not going to go through all of them. We have a plethora of results, but this is from our latest 2022 endline survey comparative to the baseline. And knowledge increased by 24.8%, which is usual. Condom use increased by 2.2%. This is a lot significantly lower than we normally get. We kind of attribute this to maybe being in lockdowns. However, an increase is a win for us, so we'll take it. Substance use decreased by 9% and stigmatizing attitudes decreased by 12.2%. We do have our full data sheet that is expanded. If anybody wants, we've printed some we can share.
So the next presentation that we'll just move right into is looking at meaningful youth participation. This is something that many presentations throughout the day have spoken a lot about that we also think is incredibly important in all aspects of our programming. Why youth participation? Because of course it's their right to be involved in programs that are meant for them. We need to hear their voices in programs that are targeted at their needs. And they should be part of it. They should be the biggest part of it.
And so we know that we can't create programs that are going to be effective if we don't have the voice of the youth. They know the issues that are affecting them. So obviously we need their input on that. And in order to it to be impactful and relevant to them, we need them to help us adapt it and make sure that it speaks to them. And then of course, it needs to be in their language. It needs to be attractive. They need to want to access the information and read about it. And so with their input, we get greater reach.
So our methodology in engaging young people in a meaningful way, first and foremost, is avoiding tokenism. Young people are bright, teenagers are bright. They know when they're just brought in to be the token teenager. Trying to avoid that as much as possible and recognizing that their input is incredibly valuable and it's what makes the most impact in programs.
And I'm just going to add, not just to have their input, but we also aim to place young people in positions of decision-making as well, so that they're actually helping to develop policy. And so how do we do this, functionally? So we have a National Youth Council. I think we've heard a lot of different organizations that have youth councils as well, and ours is crucial to our program. It's comprised usually about 10 to 15 students who have gone through the program from a wide variety of schools. We try to have it as diverse as possible. So we will look for young people from not just the school system, but also our vulnerable youth, disabled youth, LGBTQ+ youth, because we know the more diverse, we're going to capture more needs. And they really help. They look through all of our materials. They advise us on topics, not just, how materials look, but what we should be focused on. We were not focusing on mental health a few years ago until one of our youth council members said, this is a huge thing. It's affecting our friends. It's affecting me. This is something you guys need to look into. And then also our peer educators, sorry. We, all of our peer educators, I think we spoke about this before, are young people. And we do feel that it's really important for our program that our messaging is delivered by individuals that our students can relate to, they can identify with, they see themselves in. We think that helps with retention.
Yeah. So we also try as much as possible to employ young people so that they're part of every aspect of programming, from design, implementation, monitoring, and evaluation. We have different youth internships that we offer. So regular internships for young people who've been part of the program, but we also have a lot of vulnerable youth internships. So that's targeting kids transitioning out of the children's homes and the juvenile detention facilities. And they are instrumental in really informing a lot of our vulnerable youth programming, which we'll get to in a minute. And then active participation. I was speaking to someone, I don't see him in here now, from Youth Hub in Jamaica, Teen Hub. And yes, and he was, we were all just saying that they're the same issues in all the islands, that the most vulnerable young people tend not to be the ones who are seeking out the organizations and the social services that are there for them. And so it's really needed to make it easier to access them, but to go to them, to bring them in so that they are able to access these services and have voices and have their voices be heard.
And of course, we meet young people where they are, and young people tell us they're on social media. They want lessons that are completely different from math and physics and English. So we use a lot of multimedia, we use a lot of stories, we use a lot of audio visuals as well.
So essentially, our content is driven by youth, and it is continuously adapting, recognizing that young people are ever changing, and we need to keep up if we're going to be impactful in our program and to meet their lived realities.
So our results, these are all very qualitative. We know that young people tell us that they understand the materials a lot better. They love our manual, being able to take it home and flip through it. They feel that they are able to ask questions more in class because they have, we'll have one that talks about young people, her being able to relate to young people, and the guidance counselors are old. But yeah.
We also and we won't go through a lot of these testimonials for the sake of time, and the presentations are available after. But Jerome is just one of our young people that is a great example of why or how meaningful youth participation works. So while with Dance for Life, so we met him at the children's home when he was very young. He was the impetus for us starting the birthday program, which we have been doing for many years now at the children's home, and we'll talk a bit about in a bit as well. And Jerome went through the entire program with us. He came back to us as a vulnerable youth intern. We facilitated him getting employment, and since he's just been a huge friend to Dance for Life.
And he volunteers with us in some of our summer programs as well. Again, these are just testimonials. The one I was just chuckling about, she says, I could never ask my HFLE teacher about this. She doesn't even want to talk about sex. She told another girl that she shouldn't be having sex and that she was going to talk to her parents about it. No way would I ask her anything. I love that you guys are not one of our older teachers and don't judge any of the questions we have. So that's the sentiment of young people in relating to youth peer educators. And of course, I think everybody knows this and can relate to this. And this is our ethos behind meaningful youth participation.
So finally, it comes to engaging vulnerable youth. This is an area that we've been working in for quite a few years now, and I think is something that we are both very passionate about. We hold very closely our vulnerable youth programs.
They really began organically. We were asked to come into the juvenile detention facilities as well as the children's home on separate occasions and deliver our program, our schools-based program. So we started with the summer programs and really just looking at the lack of programming that they had, while recognizing that they were the most at need. A lot of our programming for them just originated
out of recognizing need. So we know that vulnerable youth are particularly distinct because they have obviously a very unique social context. They lack access to structured prevention programs that are typically in schools or in very structured organizations. They typically have lower self-worth, lower self-esteem. They're disproportionately affected by all of the issues that SRH tends to focus on. So they're much more likely to be at risk for STIs, unintended pregnancy, sexual and gender-based violence, unemployment, housing insecurity, poor academic issues, substance use, neglect, stigmatization, all of the issues. But they are, as I said before, the least likely to really seek out the social services that can help them. They're less likely to advocate for their needs. And so we need to focus on them in a different way than we do the other general youth.
So how do we do it? Our methodology, we've learned very early on that we have to focus on empowerment. And empowerment is a thread that we weave through all of our programming. But for our vulnerable youth, we have to really focus on it. it's almost more important in the beginning than the knowledge transfer, because a lot of these young people have not been able to visualize a really positive future that they can be excited about. So when we preach, messaging about protecting your future, it fell short. So we needed to address some of the gaps that were, leading them to, low self-esteem and whatnot, and really focus on empowerment so that eventually they could envision a future that they wanted to protect. So then we can really focus on the SRH messaging.
So within all of our programs, but specifically within our vulnerable youth programs, you really have a whole person approach. So as Shakira said, really recognizing all the issues that young people are dealing with and these vulnerable youth are dealing with, and realizing that we can't focus on them in isolation. You can't talk about CSC and sexual and reproductive health and rights without looking at all of the other areas that are that they might be struggling with. And so again, a lot of these we recognize just from working with young people, recognizing issues with literacy and determining that we needed to create programs to help those areas, because the goal that we sort of have at the end of the day is not for young people to just survive, but really to thrive and to be able to be powerful young people.
So some of the programs that we have in our vulnerable institutions, we have our empowerment and educational support. We talked about a few of them, the summer programs. These are intensive 7-day programs where we go through the basic skills for life programming. We have our monthly programs in the government industrial schools. These are driven by the residents there. They tell us what they want us to focus on in the upcoming month, and we find the experts to come in. We have a remedial reading program. Again, this is one of those, we realized that in our sessions, there were some boys and girls that were disruptive. They were, and uncharacteristically so. And when we dug deeper, we realized that they had challenges reading and they weren't able to keep up, and, dealing with kind of the shame of that caused their behavioral issues. So we started a remedial reading program with them. All of the residents in both the male and female units are now part of it, and we've had tremendous success. We had a young boy that's gone on to do CXC, English CXC out of that, which is great. We have a tutoring program at the child care board, the children's homes. We recognize if anybody has children here that are at school, how much parents have to help with homework. And these kids were not getting that help. So we basically organize extra lessons for them in whatever areas they need. We have a birthday program that Layla talks about. Kids were not having their birthdays celebrated in the children's homes there, and we thought that that was just unacceptable. And so we celebrate every birthday with each adolescent in the children's homes. And we have holiday programs, which are just Christmas and Easter programs. We go up and do fun days with them. And then our traditional support, transitional support programming, we have employment workshops. We find that a lot of kids that are transitioning out of both institutions have a difficult time. There's housing insecurity, employment insecurity. And so we try and help them connect with employers that are looking for entry-level employees, to speak to them on, interviewing skills, CV building and whatnot. And our main goal out of these is to try and get firm commitments for young people that are coming out to be able to find jobs. And then we have our vulnerable youth internship program, as Layla mentioned. Those that are finding difficulty, we take them on for 2 months. We give them a stipend, and they work with us in our program, learn to be on time, learn how to dress properly, and we in tandem help them with CVs and finding jobs. And thus far, all of the youth in our internship programs have left with a job. Not with us. Yeah.
Yep.
Okay.
Yeah. So we will leave you guys with a very quick video that just shows what Dance for Life looks like in a nutshell. Hopefully it will work, but it does a good job of summarizing everything that we talked about that's very difficult to do in a short amount of time. There doesn't seem to be audio.
Yeah, there's no audio, but
yeah. Yeah. Anyone's a good singer and wants to add some audio to it. Yeah,
That's
we
a
can leave
great-
you with that because it's.
Can you imagine the song? The young people look very animated. It looks very fun, I'm sure. Yeah. But even without the sound.
Yeah.
Thank you very much, Dance for Life.
Yes.
Thank you very, very much. Stephen will now introduce our other our online participants. Yes, Rocio.
Thank you so much again. That was a lot to unpack. Yeah, good job, guys. Good job. Our third presenter, let's see how well you guys know some geography, just to keep your minds ticking, all right? She is from the 8th largest country in the world, and it's home to one of the 8 football teams that would have won the FIFA World Cup. You know where she's from, right? Argentina, correct. She's very bold. She's very bold, inspiring, and she's a very brave individual, breaking social barriers and norms to help minority groups without a voice. Her name is Rocio Molina. She's a mother, a healthcare worker, a sexual and reproductive health and rights activist, like I said, in Argentina. She obtained a bachelor's of nursing degree from the National University of Patagonia San Juan Bosco in Argentina, and she's currently employed as a pediatric therapy nurse. In her spare time, Miss Molina does CrossFit, and we can all learn a thing or two from Miss Molina. And what's really touching about Miss Molina is that she is a mother of an 11-year-old boy, and she's an individual that is very open about her status. She first learned about her diagnosis during pregnancy and has been an activist for the past 3 years, making herself visible, as she would put in her own words. She is the provincial coordinator of the Argentine Network of Positive Youth and Adolescents, and she will tell us a little bit more about this. They basically help adolescents and young people living with HIV in Argentina, and they give them a voice. So let us give a warm welcome to Rocio Molina, everyone. Oh, we can't hear you, Rocio. She's still muted? She's not muted. Apologies for the technical difficulties. Can you hear us? Yes. I can read lips, but I don't know about the audiences. Not sure why she's not getting it. Oh. Oh, we have a translator. So she has a translator. Oh. Oh.
Okay, I propose that we move to Adla in the interim. While we fix this. Yes. So if somebody can communicate to Rocio, because we really want to hear her presentation. But while that problem is being rectified, please let us move on to Adla, because in the interest of time. So it is my pleasure to introduce my colleague, Adla Bino. I just have to get into my phone because my phone closed because I was like, aha, right. So Adler is a national of Guyana. He's a PhD candidate and the holder of a master's degree in public health from the University of Liverpool in the United Kingdom. In his current role, he serves as a head of office for the Guyana Office of the United Nations Population Fund, his official designation being UNFPA Liaison Officer for Guyana. Adler considers himself to be a development practitioner with a passion for population development activities. He possesses several years of professional work experience in gender equality and girls' empowerment, as well as gender-based violence, adolescent mothers' reintegration into secondary education, adolescent sexual and reproductive health and rights programming, and mainstreaming and integrating sexual and reproductive health and rights as part of health sector reforms and institutional strength. And please let us welcome Adler to the podium.
All right, good afternoon, everyone. I know what I'm being asked to do is a really hard task, to come here at 5 o'clock in the afternoon and to make a presentation on a research and to ask you to be patient and all of that. But I appreciate you being here. This is something that I wanted to do for quite some time now. It's a presentation based on a research that was done for academic purposes, but one which really lines up with the mandate of the United Nations Population Fund. It was a really interesting study, and I'm hoping that everyone involved in this field of work, adolescent sexual and reproductive health, would find it as useful as we certainly have. So bear with me. I assure you, I'll take less than the 15 minutes. It will be very pointed, very direct. So the name of the study is titled Barriers and Facilitators to the Provision of Contraceptive Services to Adolescents via Primary Healthcare Facilities in Antigua. And it really addresses the knowledge, the attitudes, and the skills of healthcare providers in the primary healthcare service in Antigua. What did I do? It's working fine. Okay, I'll proceed.
It's not working. It's not working.
All right, so I thought we'll start off with a quick visual of the adolescent fertility rate in the Caribbean. And then if we shift quickly to the abstract, we can then chat a little further about the adolescent fertility rate. So the adolescent fertility rate for the Americas is high when compared to the global indicator. In the small islands of the Eastern Caribbean, the twin island state of Antigua and Barbuda has one of the highest adolescent fertility rates in the Caribbean. Got it. We know that research evidence indicates that a vast majority of adolescent pregnancies are unintended. Further, barriers to adolescents' access to contraceptive services do exist. So the removal of barriers to contraceptive services for adolescents in Antigua, which is the most populous of the two islands in the Twin Island state, could help address the high rate of adolescent pregnancy. So this is really the background, what drove the research. In terms of the aim, the research really sought to examine the knowledge, the attitudes, and the skills of healthcare providers as barriers and their facilitators in the provision of contraceptive services to adolescents via the primary healthcare facilities in Antigua. So in terms of the importance of addressing the issue, and then we're going to get into the actual results. Addressing adolescent pregnancy in Antigua and Barbuda has clear public health implications. That's well established by other literature. By meeting adolescents' contraceptive needs, the number of adolescent pregnancies can be reduced, including those which end in unsafe abortions, allowing for improved maternal health. And we do know that one can also point to the protection offered by the condom contraceptive method in terms of preventing the transmission of STIs and HIV. Another factor we can consider in terms of the importance of addressing the issue is that reducing adolescent pregnancies will also allow for enhanced educational opportunities for adolescents through uninterrupted, continued education, which enables improved emotional as well as psychological health of adolescents. And the last one I'll touch on is the fact that through this study, gaps in the Caribbean adolescent sexual and reproductive health literature can be addressed. We know there's there's always this dearth of information that exists. So this really allows us to fill some of the gaps that currently exist. It's by no means exhaustive, but it's a step in the right direction. In terms of the study setting, the study really involved 20 of the 21 primary healthcare facilities in the island. So it really covered rural, urban, mini clinics, as well as the larger clinics. It covered all except for one primary healthcare facility. In terms of the sampling, all primary healthcare facilities in Antigua were considered for inclusion in the study. As I mentioned, a total of 21 providers were identified and recruited, one from every primary healthcare facility, but a total of 20 providers actually participating in the study. There was an instance of no response being received from one facility, which resulted in that facility not being included eventually. The inclusion criteria were male and female healthcare providers employed within primary healthcare facilities in Antigua and possessing at least 2 years of experience providing contraceptive services to adolescents, since it was felt that such individuals possess a wealth of knowledge and experience of interest to the study. The sampling was purposive. All participants expressed their willingness to participate in the study, and given the existing staffing structure of the healthcare facilities, one in which only nurses/midwives met the inclusion criteria, and one in which there were no male nurses/midwives in the community health setting, it meant that all of the participants meeting the inclusion criteria emerged as being nurse midwives and as being female. There were no males. So in terms of the data collection, to enhance the data credibility, open questions were used and technical terms were avoided. Initial questions were framed to facilitate the establishment of rapport between the researcher and the participants in an attempt to decrease the likelihood of socially desirable answers being provided. There was the use of probing questions allowed for additional information to be provided by participants, as well as for validations of meanings offered by participants. The first section of the interview guide explored the knowledge and skills of providers in delivering adolescent contraceptive services. And the second section of the interview guide examined providers' attitudes towards the delivery of adolescent contraceptive services. The third section of the interview guide examined providers' knowledge, attitudes, and skills. And as part of the interview, participants were allowed an opportunity to share their own views on the topic and on any relevant issue not captured by the interview guide. Generally, the interviews lasted between 18 to 39 minutes. In terms of the results, following the application of what's called thematic content analysis to the interview data collected, 3 broad themes were identified. The first being adolescents, but also providers' own behaviors. The second theme being the health system itself. And the third theme being societal influences. So the results centered around these 3 themes, as we call them. So if we were to go into that a little bit very quickly, starting with behaviors, this really speaks to provider attitudes as demonstrated by the behaviors of providers, as well as the behaviors of adolescents, perceived to be partly influenced by the behaviors of the providers. So behaviors on both sides, the providers as well as the adolescents, having the potential to hinder adolescent access to contraceptive services. And some of the key things that came out here in terms of adolescent behaviors, participants were unanimous in stating that adolescents generally do not visit the primary healthcare facilities for contraceptive services. Participants suggested that in cases where adolescents do present themselves, the adolescent clientele is largely comprised of pregnant adolescent girls or adolescent girls who have been pregnant in the past. In terms of healthcare providers' behavior, more than a quarter of the participants very openly expressed judgmental attitudes. Looking at the health system, and when we speak of the health system here, we're really speaking to the knowledge and the skills of the providers, as reflected by the providers' level of training, the protocols and the guidelines enforced by providers, as well as the level of contraceptive service delivered to adolescents, having the potential to hinder adolescents' access to contraceptive services. And so I'll take you through quickly some of the key things that came out here. Half of the participants were of the view that adolescents up to the age of 16 years require parental consent to access contraceptive services, but responses varied among participants from the same parish. So even if these were healthcare workers within a given parish, they were giving you different responses as to what really is the criteria being applied. But it also varied between parishes. The extreme differences in the protocols and the guidelines applied to adolescent access to contraceptive services appears to be rooted in two issues. Firstly, an anomaly in the age of consent, which is stated as 16, and the age of access to services, which is stated as 18. And secondly, the absence of a clear adolescent sexual and reproductive health policy. Another key result that emanated is that decisions on whether or not to facilitate adolescent contraceptive access is being predicated on providers' discretion. So it was largely discretionary. And this has led to all sorts of confusion as demonstrated by the varying practices of providers across as well as within all parishes. It was also noted that data analysis suggests that there's a need for providers to be offered additional training to enhance their knowledge and skills as reflected by an accurate provider contraceptive information and providers' acknowledgement of the absence of required skills and the absence of dedicated sexual and reproductive health programs within the primary healthcare system across all the parishes. A quarter of the participants appeared less reluctant to provide contraceptives to boys as against girls. So they were more comfortable sharing condoms, for example, to boys. Some providers highlighted difficulties in ensuring the availability of contraceptive supplies as hindering any provider effort to deliver adolescent contraceptive services. So it meant that there were also issues of supplies, shortages within the healthcare system. And some participants pointed to the inadequate physical facilities which can hinder providers' application of their skills in delivering confidential, quality adolescent contraceptive services. So in terms of the last theme now that emanated from the study, societal influences, this really focuses on the analysis of the data, which suggests that providers are of the view that apart from the health system and the behaviors of providers and the adolescents themselves, providers' ability to apply their skills in the provision of contraceptive services to adolescents is influenced by factors within the society, such as parents and schools. And so two of the key things that came out were, one, some of the participants perceived the influence of parents as having an adverse effect on providers' ability to apply their skills in the provision of adolescent contraceptive services due to the perceived reluctance of parents to acknowledge adolescents' contraceptive needs. And then secondly, a minority of participants were very vocal in highlighting their perception of the need for their greater access to schools to allow for the application of their skills in providing adolescent services, adolescent access to services. So what are the implications of these findings? I'm just going to go through some of the implications and then quickly the conclusion. In terms of behaviors, we know that with the exception of two providers, all providers acknowledge adolescents' reluctance to visit healthcare facilities, and such reluctance is perceived by providers as a major barrier to the provision of contraceptive services to adolescents. Correlatively, the data suggests that interpersonal factors such as providers' judgmental attitudes act as a barrier to adolescents, particularly adolescent girls' access to contraceptive services via primary healthcare facilities. We also know that a judgmental attitude cited by approximately half of all the providers does not allow for relationship building between providers and adolescents, nor for provider interaction at a more personal level. And thereby it exacerbates the barriers at the interpersonal level and fuels adolescents' reluctance to visit healthcare facilities for sexual and reproductive health services. And there are quite a few for the health system. I'm not going to go through all, just to pinpoint that I think one of the key implications here is that there's an absence of clear protocols and guidelines and legislation for contraceptive services provision to adolescents, and providers rely on their own discretion, influenced by their own attitudes towards adolescents' contraceptive access, which of course adversely affects adolescents' access. There's a whole lot of training that is needed to address that issue, as well as strengthening of the commodity system to ensure the availability of supplies. In terms of the societal influences, providers appear to value the involvement of parents in adolescent sexual and reproductive health and contraceptive decisions, which means there have to be mechanisms developed for engaging parents on sexual and reproductive health issues around adolescents. And we can also point to the fact that providers do need to find a balance between involving parents while maintaining some level of adolescent confidentiality. And the last thing I'll say on this particular implication is the need for school-based interventions to be revisited as well. So in terms of the conclusion, and this is my last slide, the data revealed the existence of several barriers which hinder adolescents' access. We saw that across the three themes that came out from the research. The barriers identified include judgmental attitudes displayed by providers, the absence of adolescent sexual and reproductive health protocols and guidelines, the anomaly in the age of consent and the age of access to services, the absence of provider adolescent-specific contraceptive training, the absence of comprehensive adolescent sexual and reproductive health services, the shortage of contraceptive supplies, inadequate physical facilities, gender disparities in adolescent access to contraceptive services, providers' perception of parents' reluctance to acknowledge adolescent sexuality, as well as the absence of well-structured school-based interventions. So it's quite a long list of stuff that emanated from the research. And these barriers, of course, severely hinder adolescents' access to contraceptive services. So it really requires a comprehensive response to address such barriers. The research data indicates that provider knowledge, attitudes, and skills contributes to these barriers to adolescents' access to contraceptive services via primary healthcare facilities in Antigua. It tells us much of what we long suspected. So it's good to have actual data to back up much of what we knew in the field. So thank you.
Thank you very much, Adler. So colleagues, I have an announcement. You want to make the announcement, Stephen? Okay, so we've been advised that we have to leave the room at 5:30. We have precisely 6 minutes left. Are there any questions that you'd like to pose to our fantastic presenters? Any questions that we can do in 6 minutes and then leave the room? And then perhaps with Rocio,
Just before.
perhaps we
just
can
before we get-
reschedule. Mhm.
Yeah, just before we get into the questions, I must apologize for the technical difficulties that we've had in being unable to have Rocio present today. However, we've had to reschedule due to time constraints. So she will be still a part of the track session, but in one of tomorrow's session instead. So remember everything I told you about her, because we're going to talk about the same things again tomorrow. However, quickly, we have 2 questions so far, and I have a question myself. The first question, well, the presenter has already been made aware of the question, but just for the audience, to Dennis, should one wish to adopt, does the program have a large or major impact on reducing the occurrence of 2nd and 3rd adolescent pregnancies, part A, and now B, is the program equally effective across the different regions in Guyana since it was implemented? And I will give you an opportunity to answer.
Oh, I'll be quick. I'll say this, that the program is relatively new. So we're still sort of collecting that sort of information. But there are other programs that are happening in other administrative regions, primarily in the hinterland communities that center around empowering young people around sexual reproductive health and rights and providing them with the necessary information, and also as it relates to avoiding unintended pregnancies. I can talk a bit more about this outside of this session, but there is not that sort of concrete data as yet, as the program was literally implemented just a few months ago, or started just a few months ago.
All right. Now I have a question that's directed to the wonderful ladies from Dance for Life. COVID has been a big bummer, right? It has hindered a lot of our movement and our interaction with people. How has COVID affected your service delivery to the youths of Barbados over the past 2 years? And what methods have you used to mediate these challenges?
So COVID in Barbados is with many other parts of the world, schools shut down. Because we use so many audio visuals, it was actually fairly easy for us to transfer to the online space. So that worked out really well because we were able to reach more young people. We were able to do more year groups at schools. We were able to do more classes. So it worked in our favor in that regard. But we did do a lot of survey and data collection on just the mental health implications, and had a lot of young people sort of report in, as was evidenced today in some of the sessions, just some of the struggles that they were facing with the online forum. And so that was something that we tried to challenge and to mitigate by trying to make our sessions still as interactive as possible, even though we were online, and students, I think, were just completely fatigued by the whole online space. Yeah.
I'm just going to add to that. We do have a poster presentation on COVID and young people, but while we were able to do more classes and get more students in, school settings, what we did notice is that some of the schools that have, they're stratified in Barbados, higher economic usually is, associated with the schools that, you have to get higher grades for. But we do all of the secondary schools. So for the ones that, the schools that have more of a lower socioeconomic demographic, we were not able to reach the majority of those kids. Those kids were not online. There were classes that should have had 20 or 30 kids in them that had 2 or 3. And that was a real problem for us because these are the kids that we want to reach the most. So yeah, it was tough, but they were not in, school setting at all, really online.
Oh, thank you. And just a lightning question to you, Adler. You spoke about knowledge, attitudes, practices, and beliefs regarding contraception. Is there any data about the use of emergency contraception among these adolescent young women and young men?
No, the simple answer is no. This study was focused on the primary healthcare system. So this is the government system. And the government system in Antigua does not permit the release of emergency contraceptive pills. That doesn't happen. If one needs that in Antigua, that requires a prescription via a private doctor or a pharmacy.
This is the morning after pill that we're talking about. Okay. Thank you, everyone here. Well, you and I can discuss more about this. I've actually done a little bit of research about the knowledge, attitudes, practices, and belief regarding emergency contraception among some women in Guyana. And it'll be quite interesting to note the outcomes and some of the beliefs that these women have regarding this. Thank you so much for being such an engaging and interactive audience. I want to say thank you again to our presenters, and again, apologize to Rocio. All right, thank you so much, everyone.
And if I may also add to Stephen's remarks, thank you very much for your attention. I believe that we heard a lot about challenges, but I think we also heard solutions. And I think that together, I think the young people gathered have a lot of answers to give us. I would like to see, as a gender transformation advocate, more nuanced responses. COVID-19 meant tracking of a silent pandemic of gender-based violence that negatively affected young men as well as young women. And so in order to develop more nuanced, differentiated solutions and responses, these are aspects that we'll also have to consider. But I'm sure during the course of the next 2 days, those solutions will emerge. So thank you very much for your attention. It was great being with you. Thank you to the participants. Thank you to my co-moderator. Thank you all.
All right. Cheers.
5:30 on the dot, on time. Who says we're not on time here in the Caribbean? On time.
Get some water, everybody.
The whole thing, I just. No, not that intro, meaning like just the first part of the song. Just the first part of the song? Oh, okay. Okay. Ready again?
Go there.
Good evening, ladies and gentlemen. Thank you so much for joining us. I'm asking kindly that for the persons who are standing, I'm asking you kindly to take your seats. We are awaiting the arrival of the patron for the evening. And as soon as the patron is here, we will get started. All right, so I'm asking the persons who are standing to please be seated. We'll be starting shortly. Good evening again, ladies and gentlemen. I'm asking you to kindly take your seats. We are about to start. Well. Okay, so now that we're settled, I'm going to have you stand again as we're going to sing the national anthem. All right, so please stand. We're going to start with the national anthem. much. You may be seated now. Dr. Karen Webster Carr, Acting Chief Medical Officer representing the Minister of Health.
The Honorable Minister Alando Terralong, State Minister in the Ministry of Culture, Gender, Entertainment, and Sport.
The Most Honorable Parliament and Congress Patron.
Distinguished ladies and gentlemen from the United Nations agencies.
All specially invited guests and those who've joined us online. Good evening.
Good evening. I'm Ariana Siraj, representing beautiful Guyana. Big up all the Guyanese in the crowd. And tonight I'm joined by
J. Mark Johnson, representing your host country, Jamaica. Is there any Jamaicans here? Awesome. And I'm sure we aren't the only Caribbean islands here. So to all the other Caribbean islands, we do not take you for granted. Thank you so much for being here and big up you. All right.
I must say, it is truly an honor and privilege to be able to welcome you all to the Caribbean Conference on Adolescent and Youth Health in person this year. The COVID-19 pandemic sent us on a bit of a hiatus, but boy, does it feel great to be back. As Dr. Lloyd was saying earlier today, it really does make a difference to be in the presence of like-minded persons and feeling the energy and spirit, or as we say here in the Caribbean, the vibes. It's quite exhilarating compared to a Zoom meeting, don't you agree? No offense to Zoom, of course, it's quite a useful tool, but for events like this, I truly believe that we are able to garner the best results from meeting face to face. As humans, we are inherently social beings, of course. Now, when I first attended the inaugural Caribbean Conference on Adolescent, Youth, and Health in 2019, it was a bit daunting for me because I didn't really know anybody. So if you can just take 30 seconds and introduce yourselves to the person sitting next to you, that would be great. I know everyone loves icebreakers, but we are here to build rapport, you know? So just go ahead.
Awesome. All right. So here's how we're going to extend. So I believe we're all now acquainted with our neighbors, correct? Yeah? And Ariana mentioned earlier the vibes that we Caribbean people have and building of rapport and the fact that we have not been in this space for a matter of years. And what better way to commemorate this moment than to take a selfie? All the hands of those who use an Android, please raise your hand. It's okay, no discrimination. We're good, we're good. And if you use an iPhone, please raise your hand. Awesome. Now, this is one of the times that I'm going to allow you to take your phones out. I'm going to have you go on your camera, your phone camera, and you're going to take a selfie with the person that is sitting beside you, all right? And when you take the selfie with the person that is sitting beside you, because we want the world to know that we're here. So let's follow that part of the instruction first. Oh, you haven't taken one of this.
It's only fair that Jamar and I take a photo as well, so.
And everybody will stay. All right. Hopefully, for the ladies, your makeup was intact, and for the gentlemen, you know, your lapel was fixed. I'm hoping that all of that was in place. The second part of the instruction is this. You're going to go on Instagram, you're going to go on Facebook, whatever your preferred social media account is, and the selfie that you just took, you are going to post a story, a post using the hashtag CCAYH 2022. All right? So that's CCAYH 2022. It can be Instagram, it can be Twitter, it can be Facebook. It doesn't matter. All right? Lovely. So now that we have that out of the way and we're well acquainted, let's get to business. So right now we are going to take some brief remarks from the following persons. I'm going to call them and they're going to come in the order that they are called. So after I would have left the stage, you come in the order that you're called and then Ariana will join us, all right? So we're going to take a brief remark from Mr. Vincent. I hope I'm pronouncing that correctly. If I'm not, please forgive me. Tehran, okay, and he is the deputy representative at UNICEF, country officer Jamaica. And then I'm going to take Mrs. Donna da Costa Martinez, the deputy regional director at the International Planned Parenthood Foundation, Latin America and the Caribbean, followed by Mrs. Martinez. I'm going to have Mrs. Joel Paula Roseberry. Please forgive me if I'm butchering your name, right? Roseberg, sorry. And the officer in charge of UNFPA sub-regional office. And then she's going to be followed by Dr. Sheila Campbell Forster, the president of the Caribbean Association on Adolescent Health. All right, so I'm going to ask you to come one at a time to make your brief remarks, and then Ariana will take us, all right?
Thank you so much, distinguished guests. Good evening and special greetings and welcome to all the adolescents and youth from across the beautiful region of Latin America and the Caribbean. On behalf of UNICEF Office for the Latin America and the Caribbean region and the Jamaica Country Office, where I'm actually based, it is an honor and a great pleasure to welcome you all to the second Caribbean Congress on Adolescents and Youth Health. After almost 3 years of the COVID-19 pandemic, we are finally able to gather once again with the region's young people. This will be a great space to listen to your concerns, learn from your ideas, and understand your needs. In fact, this Congress is the perfect scenario to understand how the COVID-19 pandemic changed young people's lives. Additionally, we are interested in knowing the response to questions such as, how has the sexual and reproductive health of young people been affected by the pandemic? What is now urgent for better nutrition and physical activity? Or how can we make the critical link between climate action and health and well-being in this region? This conference is an excellent opportunity to exchange ideas and strategies to ensure that adolescents and young people mental health and psychosocial support is a priority, not only in the region, but globally. Let us all try to answer this question. What does youth and adolescent health and development look like as we recover from the pandemic? The pandemic has taught us that we need to be more dynamic, means of engagement, evidence generation, and information sharing in order to adequately respond to the needs of adolescents and young people to promote their health and well-being. Latin America and the Caribbean is a region that has been greatly affected by the COVID-19. Let's not forget that in this region, there are 8 out of the 10 countries with the highest death rate globally. There is no question that the pandemic has had devastating side effects on the well-being of adolescents. According to UNICEF Global Annual Results, adolescents' health in 2021 show that levels of anxiety and stress increased by 50% among adolescents in 2020. 57% of adolescents perceive an increase in gender-based violence. This perception was common among those who identify as lesbian, gay, bisexual, or queer. 50% of adolescents have difficulties in accessing healthy food, mainly due to the decrease of family income. Exercise and physical activity decrease among 50% of adolescents. The region is diverse, and adolescent and youth health profiles vary across countries. However, there are some key issues that we share. One issue is teen pregnancy. The region has the second highest adolescent birth rates after sub-Saharan Africa. The high proportion of adolescents becoming mothers results in negative consequences for their health and the health of their children. Adolescent mothers are more prone to perinatal depression, suicidal behavior, complications during pregnancy, and maternal mortality. Children born to teen mothers are more likely to die, be premature, and have low birth weight compared to children born to mothers in their 20s. There is much for us to tackle together when it comes to preventing early and unplanned pregnancies and supporting adolescent mothers. Adolescent mental health is an emergency in our region. The data is staggering. Almost 60 million adolescents in the region, about 1 in 7, suffer from a mental disorder. Suicide is a leading cause of death among adolescents, causing 6% and 10% of deaths among boys and girls aged 15 and 29. Students who have been victims of bullying had a higher prevalence of suicidal ideation than those who have not been victims. Interpersonal violence causes 40% of deaths among boys and 11% of deaths among girls. UNICEF conducted recently a survey among EU reporters in 10 countries, which showed that the cost of the pandemic among adolescents and young people has been serious and has affected their education, interpersonal relations, and mental health in general. But all is not lost. Respondents highlighted more than 20 different strategies to cope with stress and challenges imposed by the pandemic, most of them positive coping strategies. Additionally, several UNICEF country offices, including the office in the Caribbean, have established innovative platforms, telephone helplines, and telemental health initiatives to provide critical support. Here in Jamaica, UNICEF works with the Ministry of Health and Wellness and the University of West Indies to establish the You Matter chatline. And so far, I'm happy to report that more than 1,000 young people have received support through the text-based service. This is really a bright spot. Today, UNICEF expresses its commitment to adolescent and young health and well-being, and we are pleased to be partners for this second staging of the Caribbean Congress on Adolescent and Youth Health. Together, we can overcome these challenges and make a difference in the life of young people. We don't have a choice. We all need to do our part for a prosperous future for all. Thank you very much. Thank you.
All right, thank you, Vincent. And now we're gonna have, lovely lady. Going to have this lovely lady here is Mrs. Donna da Costa Martinez, the Deputy Regional Director, International Planned Parenthood Foundation, Latin America and the Caribbean.
The Most Honorable Juliet Holness, MP, Ms. Alison Drayton, CARICOM Assistant Secretary General, Human and Social Development, Ministers of Government, youth and participants of the Caribbean Congress on Adolescent and Youth Health, the International Planned Parenthood Federation, Americas and Caribbean region, is extremely pleased to be supporting with the Second Caribbean Congress on Adolescent and Youth Health. Created in 1952, IPPF is locally owned and globally connected with a network of 131 member associations united by a common goal, that all people, especially women, girls, gender diverse people, and youth, have access to quality and affordable sexual and reproductive health, information, and services without fear, discrimination, violence, or coercion. In 2021, IPPF delivered 231.4 million sexual and reproductive health services and contributed to 121 policy and legal changes towards the advancement of sexual and reproductive health, rights, and justice. We are united by our values of social justice and diversity. We strongly believe in global solidarity, and this Congress provides an excellent opportunity for all stakeholders: youth, civil society organizations, development partners, national governments, and others in the Caribbean to come together to discuss, build solidarity, and strategize for the improvement of the health, rights, and well-being of adolescents and youth. The world is home to the largest generation of young people in history. They are diverse, they have opportunities, but they also face immense obstacles in their lives. Young people and adolescents need to be able to make informed decisions and have access to sexual and reproductive health education, information, and services. By genuinely focusing on young people's health, rights, and well-being, facilitating meaningful youth engagement, and avoiding tokenism, we can deliver sustainable services, programs, and interventions that are truly shaped by them and thus relevant, inclusive, and effective. We are all too familiar with the saying that youth are our future. But tonight, I want to go a step further to say, youth are the present, youth are now. Young people's intra and intergenerational relationships and transitions in their unique cultural and political contexts influence their health-seeking behaviors as they grow up and must be taken into account when developing programs for our youth. The richness of presentations today demonstrates that while there has been significant progress over the years in the Caribbean, alarming unmet needs still exist, from adolescent pregnancy, HIV, COVID-19, mental ill health, and the existential threat of the climate crisis. So here and now, IPPF ACRO, the Americas and the Caribbean Regional Office, pledges its continued support for the promotion and delivery of age-appropriate, gender-sensitive, comprehensive sexuality education for in and out of school youth, support for quality and safe abortion care, and the legalization and criminalization of abortion, and the delivery of HIV and STI testing and contraceptives, all in the time of the COVID-19 pandemic and a global economic crisis. To close, I share a quote by Audre Lorde. "And at last, you'll know with surpassing certainty that only one thing is more frightening than speaking your truth, and that is not speaking." IPPF ACRO will continue to support and voice the choice of youth today, tomorrow, and always. I thank you.
Thank you so much, Mrs. Martinez. Thank you so much for highlighting the need for collaboration and solidarity, especially as it relates to issues among our youth.
Next, we have Mrs. Joelle Paula Roseberg, Officer in Charge, UNFPA, Sub-Regional Office. I'm going to invite you now to make your brief statement.
Good evening, everyone. Protocol has been established. Thanks to Ms. Dana and the previous speaker, Vicente. So I will continue. However, just allow me to especially recognize the young people from across our beautiful, rich, and diverse Caribbean. I am really touched. I feel that this is an important occasion. I have never been at a meeting where I've been encouraged to do a selfie before. That was nice. We, along with others, supported a number of young people to be here today, and I'm very happy that that was possible. Young people from Latin America, the Caribbean, English and Dutch speaking. I feel that we have to give them a big shout out. I mean, it's from Trinidad and Tobago, from Jamaica, Guyana. It's just wonderful that you are able to come and that you're here and you're participating so well in tonight's, not only tonight's gathering, but this entire conference. It is indeed a pleasure for me to be here to join you at this event, which focuses on a key demographic in our population, our youth, particularly adolescent youth, which, as you know, is an important focus of the United Nations Population Fund, UNFPA. I am heartened to note that the theme of the second Caribbean Conference on Adolescent and Youth is building back better, advancing and safeguarding the health and well-being of adolescents and youth in the Caribbean. This is great. This is where it should be. The term building back better is often used in the context of the current economic crisis, particularly since the COVID-19 pandemic. As the UN Sexual and Reproductive Health Agency, I think most people think of us that way, UNFPA sees the vital importance of ensuring adolescents have a safe passage from childhood to adulthood. However, we note the individual and common vulnerabilities posed by COVID-19 and the current economic crisis, which may threaten and even reverse our progress made towards accomplishing the Sustainable Development Goals. UNFPA directly tackles many of these goals, in particular Goal 3 on health, along with PAHO, of course, and others. Goal 4 on education, along with ministries of education throughout the Caribbean and others, and on gender equality. But we also contribute in a variety of ways to many of the others, as we all do. Ladies and gentlemen, UNFPA believes that that building back better is an imperative for the Caribbean if we are to have any hope of achieving the Sustainable Development Goals. The COVID-19 pandemic, together with the persistent threats, Donna referred to this in her presentation in our region, from climate change events such as hurricanes and floods. I think some of you may have seen the horrific pictures coming out of some of our countries. I know I was here in my office when I got pictures from Belize, and I was like, no, this can't be true. It was just a flood. But the damage that was done was just really, you cannot overlook what is going on. I would say the threats to our region from hurricanes and flooding has created a perfect storm. This storm threatens to disrupt our work
and to critically undermine our progress towards achieving our agencies. 3 transformative results regarding addressing maternal mortality, unmet needs for family planning, and gender-based violence, and all the harmful practices. These emergencies further exacerbate the example. For example, the Venezuelan displacement crisis, the largest in Latin America's history, that has resulted in a large influx of people into several Caribbean territories, of migrants, some refugees, escaping humanitarian emergency. Against this backdrop, UNFPA's Sub-Regional Office for the Caribbean recently conducted a study on the comprehensive sexual and reproductive health, human immunodeficiency virus, and gender-based violence, needs of Caribbean youth in all their diversity and vulnerabilities during the COVID-19 pandemic. The findings highlighted the intersections between the multiple forms of vulnerabilities, such as unemployment or economic insecurity, limited survival sources or options, school closures, and online schooling faced by diverse youth population. These vulnerabilities increase the risk of poor sexual and reproductive health outcomes during the pandemic. These include unplanned pregnancies, pregnancy-related health problems, unsafe abortion, and many others. The theme of Building Back is extremely relevant for this Congress. As adolescent health and well-being confers a triple dividend with potential benefits from the adolescent, their future life, and even future generations. The Congress objectives are to share promising practices, opportunities, and initiatives, to identify joint actions, and to strengthen and forge new alliances. In order to advance our shared vision for the Caribbean youth, in other words, during these days coming, we will put adolescent health in the center of sustainable development. We will build on the work of regional networks, governments and civil society institutions. The goal is also to continue the accomplishments from individual interventions to promote prospective areas of support to enhance and reinvigorate interventions as a basis for continued advocacy, resource mobilization, and investments to address the identified gaps and challenges in adolescent health. We also note the huge disparities among socioeconomic and ethnic groups. The factors affecting birth rates vary in countries and between countries. Adolescent birth rate is generally affected by levels of income, levels of education, and ethnicity. We acknowledge that despite the aspirational and progressive 2014 integrated framework, strategic framework for the education of adolescent pregnancy in the Caribbean, agreed on by CARICOM member states, adolescents in the Caribbean still face legal, societal, policy, and health system barriers that limit their access to quality integrated sexual and reproductive health services. Mrs. Martinez also pointed this out, and I definitely endorse what she said. So how can we ensure we continue speaking with one voice to make compelling arguments for policymakers and influential sectors to make necessary decisions to address adolescent health needs? Evidence or economic arguments may not be enough. We will all need to participate, think out of the box. We will have to identify promising practices and share expert knowledge and experiences. We must work together and share the results and decisions of this Congress and inform a wide range of stakeholders to advance the call to action made after the first Congress of 2019 in Trinidad and Tobago. It will take each of us to mobilize the resources needed to implement promising interventions and to turn our vision into reality. Our continued collaboration will also be crucial to the proper follow-up and monitoring of the impacts of the agreed upon interventions. UNFPA will continue to support. We will continue to listen to our young people. We will continue to collaborate with governments, entities, civil society, including youth-led organizations, vulnerable populations, and all those gatekeepers to address the existing barriers which hinder access to sexual and reproductive health services and information. We must also capitalize on the opportunity to learn from our young people on what works, what doesn't work, where we need to optimize, and how we can continue to increase the results that we want. In closing, I believe that together we can deliver on our vision of a better and more equal future for all our Caribbean adolescents and youth, and create a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. Thank you. Thank you.
Thank you. I think if we can take anything from the ceremony so far as the word collaboration, I've lost count of the amount of times I've heard it. Absolutely important. Coming to the podium, Dr. Sheila Campbell Forster, the President, Caribbean Association on Adolescent Health.
Dr. Karen Webster Carr, Acting Chief Medical Officer and representing the Minister of Health, Honorable Orlando Terrelong, and he is the Minister of, long name now, you know, Culture, Gender, Entertainment, and Sport. I got it wrong, right? Right. Distinguished representatives of the United Nations agencies, distinguished ladies and gentlemen, all the young people, give a shout out. Yes. It is indeed a pleasure for me to give a very short address tonight. Maybe the shortest I'll be delivering in my life. But, you know, as I sat there, I reflected on a part of my life, and I thought maybe I should just tell the young people a little bit of what it means to be committed to something, and the importance of being chosen to be a participant at such a conference. In 1970, and you're going to date me now, I was selected to be a participant at the 25th United Nations Youth Assembly in New York. It changed my life. At the end of the conference, which was really an exciting time for young people, we were asked to make a commitment. What were we going to do with the information that we gathered from the conference? How were we going to go home and make a difference? And at that time, I saw a vision of being in public health. So that influenced my life forever. And of course, I ended up doing adolescent public health as well. And so I want to say to you take this conference seriously. It may be the door that is opening for you an opportunity of a lifetime. And I could stop, right? So it is really encouraging you into the future. The Caribbean Association for Adolescent Health is really pleased to be a partner of the second Congress on Adolescent and Youth Health. And we are indeed proud that it is being held in Jamaica this year. The first one was held in Trinidad. And I must say that arising from that Congress, we had the roadmap for Caribbean, for health of adolescents in the Caribbean. So for those who have never seen that document, I would encourage you to go online and find it and read it, because it sets the foundation for all that we're doing at this meeting. Our organization is very new and was formed out of a need for a Caribbean-wide alliance of youth and professionals who work with youth and are interested in the health and well-being of each generation of young people as they evolve into adulthood. And you heard a lot of the challenges, so I'm not going to go over those. But we are meeting, as you heard, under the theme, Building Back Better, Advancing and Safeguarding the Health and Well-being of Adolescents and Youth in the Caribbean. And this is really an important theme. It also reminds us that young people want to feel safe. And they want to also have safe spaces. And we are concerned in our countries about the violence that is taking place, the self-harm, and all of the other things, the injuries, the road traffic injuries. All of those are taking place wherever we are in the Caribbean. And so we need to really look at this theme and see how it applies to each one of us, wherever we are. And I must pause here to welcome some persons in our midst. Are there any Peruvians in the room tonight? Just put up your hand so we can acknowledge you. Wonderful. Hondurans. Yes. And Colombians. We're grateful that you could be with us. So we are really looking forward to even a wider alliance. And some of the ways in which we build that alliance is also through the International Adolescent Association for Health, which has a very vibrant youth network. And we hope in the future to have that as a local organization. Our countries are at a critical juncture of development where increased attention needs to be placed on the health and well-being of our young people. Tangible and intangible investments in education, health, poverty eradication, and parenting support. And I think this is pivotal to what we need to do. These are needed to ensure that successive generations thrive and become the agents of transformation for a peaceful, healthy, safe, economically vibrant region, a place where we all want to live. We know about the triple dividend So we talk about investing now for the present generation and how we can reap the benefits in the future generations and even in the long term. COVID has really magnified many things for us. We see the challenges with different lens, but it has been an opportune time for us where we will now apply some of the lessons we've learned as to how to even increase access for our young people to health and education. So let's not just look at all the negatives, but let us look at what are the opportunities that COVID is providing for us. This Congress is an expression of these efforts, and it provides a forum to network, to share thoughts and ideas for further action. We're not going to leave here with all of the knowledge in our heads. We're going to go and apply them wherever we are. We welcome all participants. I need to point out for our guests mainly that we have 2 satellite sites, one in Belize and one in Trinidad and Tobago. So it is good that we are able to even expand our reach in those areas. And next time, we hope that we'll be able to reach even more countries. I would like to thank everyone for participating and supporting this very important Congress. And I look forward to further implementation of action over the next 2 to 3 years, as this we see as being part of our calendar until we meet again. And so again, thanks for coming. We welcome you all. And please visit the booth of the Caribbean Adolescent Association for Health. And thank you very much for being here.
Thank you for those succinct but significant remarks, Dr. Forrester. And you are indeed right. We do have to put in the work now to ensure that the successive generations thrive. Now, permit me to introduce Dr. Karen Webster Carr, who's representing the Minister of Health. Please join me in welcoming her to the stage to give special remarks.
Thank you. Masters of Ceremony, Mr. Jameer Johnson and Ms. Ariana Sira, the Most Honorable Juliet Holness MP, Ms. Alison Drayton, Assistant Secretary General, Human and Social Development, CARICOM Secretariat, Mr. Vincent Teheran, Deputy Representative UNICEF Jamaica, Mrs. Dana da Costa Martinez, Deputy Regional Director, International Planned Parenthood Foundation, Latin America and the Caribbean, Dr. Sheila Campbell Forrester, President, Caribbean Association of Adolescent Health, Mrs. Joelle Paulo Roseberg, Officer in Charge, UNFPA Sub-Regional Office, other distinguished guests, members of the media, ladies and gentlemen all. Good evening. Good evening. Maybe because it was so long, you did not hear me. Good evening. Thank you. Thank you for inviting me to share in the second staging of the Caribbean Congress on Adolescent and Youth Health. It gives me great pleasure to be among our national and regional partners and leaders as we align efforts towards advancing and safeguarding adolescent and youth health in the region. There's no doubt that investment in adolescent and youth health paves the way for great gains in national development. Among Jamaica's suite of public health intervention through the Ministry of Health and Wellness are national strategies in the areas of sexual and reproductive health, mental health, and substance use. The need for keen attention to our youth and adolescent population has been amplified given the far-reaching effects of the COVID-19 pandemic, which the World Health Organization predicted would trigger tremendous psychological difficulties even among young people. Here in Jamaica, recent data from the National Council on Drug Abuse reveals troubling issues that have emerged among secondary school students since the return to face-to-face instruction. Among the matters of concern are substance use, difficulties with mental health, and excessive sexualized behavior. Even before the COVID-19 pandemic, data points to a pressing need for intervention among this age cohort. For example, figures from the UNICEF shows that 20% of all child visits to public hospital between 2014 and 2017 were due to sexual assault. At the same time, youth aged 15 to 24 years continue to record high rates of unplanned, ill-timed, or unwanted pregnancies. The 2021 annual HIV review notes that persons 15 to 24 report that their first sexual experience is around 11 to 13 for males and 15 to 17 for females. This review also noted that of the 618 new cases of HIV reported in 2020, 16% were adolescents, 15 to 19 years. Also, an increase in the number of sexually active adolescents across the island was also observed. Overall, a situation analysis of the state of adolescent and youth health exposes the need for aggressive work in executing health promotion programs to empower engagement in healthy lifestyle choices. In response to the prevailing difficulties facing adolescent and youth, multi-sectoral partnerships have been forged to promote positive development. These initiatives include the establishment of adolescent-friendly clinics. These sites are staffed with professionals who offer services specifically to adolescents to include mental health screening and counseling, sexual and reproductive education. 44 such clinics are in operation across the island. Further, in the collaboration with key youth and adolescent stakeholders, a non-traditional access point, the Teen Hub, was developed. This innovative and practical approach provides adolescents and youth with age-appropriate services in a supportive setting to minimize and mitigate risky behavioral and lifestyle practices. Additionally, a sexual and reproductive health policy is to be put through the legislative process as part of efforts to mitigate barriers that prevent youth and adolescents from accessing health services. Another partnership among government ministries is the School Mental Health Literacy Program, a collaboration between the Ministry of Health and Wellness and the Ministry of Education and Youth. The School Mental Health Literacy Program will see the training of more than 500 school professionals over the next 3 months. They will in turn train others who will impart the learning to more than 21,000 grade 9 students across 177 schools island-wide. Among the program objectives are for young people to understand how to improve and sustain good mental health. Also in the works is the updating of the National School Policy on Substance Use. The National Council on Drug Abuse will direct this in conjunction with the Ministry of Education and Youth. In closing, there are but a part of the intervention that will strengthen adolescent and youth health in Jamaica. The Ministry of Health and Wellness will continue to drive targeted and sustained action around these priority areas as we look towards scaling up resources and facilitating environments that foster the best health outcomes, which allows our young people to realize their full potential. With that said, I wish to congratulate the team that spearheads this Congress. This convening, I anticipate, will result in meaningful engagement to identify areas for reinforcement and strategizing towards improving the health and well-being of this important cohort. I wish you all the best in this undertaking. Thank you.
Thank you so much for that presentation. So we're going to unwind a bit and we are going to have the City Music Band take us away with some good music. So I'm going to implore you to sit, enjoy, and then we will be joined back with Ariana, who will guide us further. All right, thank you.
right, let's see now.
Wow, wow, wow. What a splendid performance, guys. I think they deserve another round of applause. That was great. And looking at them, I can say that this band truly reflects the talent that young people possess. You guys are like all teenagers, so well done. So next we'll have a video presentation that was put together by the Voices of Caribbean Youth. So if the technical staff, thank you.
Join us as we take a look back at the first Caribbean Congress, which was held in Trinidad and Tobago in 2019.
They are present, they are ready, they are ignited by passion and ignited by purpose. We are ready to contribute to the conversation that impacts us.
output of our 2019 Congress was the Adolescent and Youth Health Roadmap, which was developed in part by youth themselves. Next up, we have some young participants from 2019 telling us what the roadmap signifies to them.
This roadmap was an excellent way to educate and to help others understand the complexity of mental health, particularly.
We appreciate the idea of creating a conference that included youth in the decision-making of the roadmap as it relates to their own health.
We need to pursue models of development that are not just conducive to short-term economic prosperity, but we also have to think holistically and in terms of the sustainability of our region. But from an even more personal perspective, I believe that the roadmap signifies that in the Caribbean, young people are no longer just being considered as tokens in these processes of development. We are now being recognized as the active agents that we are in these processes of development. And one of the biggest phrases that would have come out from the Congress summarizes that for me: nothing for us without us as young people.
As a Caribbean young person, the Caribbean Adolescent and Youth Health Roadmap is a very important document.
All right, so we're having some technical difficulties with the sound. Go again now, you ready? Oh, okay, all right. So I suppose we can move forward and then we can get back to the video presentation, right?
Okay, so the youth in any society are the engine of growth and development. So it's only fitting to have the young and vibrant Christina Williams, a youth health advocate, deliver the youth address. Please welcome her to the podium, Christina Williams. Thank you. I'm a little nervous, so forgive me. Every day, more than 10 young people lose their life to suicide in Latin America and the Caribbean. And because of this fact, it makes suicide the third highest cause of death of young people in the region. This region also accounts for the second highest rate of adolescent pregnancy in the world. When we consider NCDs, we may say, well, that's an older person issue. But when we consider the WHO says that 70% of persons who have NCDs now is actually because of issues that they had when they're adolescents and young people. And that 1 in every 4 persons in the region is a young person. We're seeing that young people are very much at risk. With all protocols observed, good evening. It's very important for me to highlight these realities. And yes, I'm a little sober and I know. I'll come with a little vibes later, but for now, it's important for us to be sobering. Why it's important for us to have this particular inaugural event, why we have to continue researching, advocating, lobbying, demanding for more and not accepting less because of these realities. It's also why I am asking for my governments, whether those present here or those that will be joining us virtually or will get the reports later, why you need to be ambitious. There's a song that I love. It's called I Am a Promise, I Am a Possibility. Anyone know that song? I am a promise,
I am a possibility. And I think that this region has very much been that song. When we consider the Women's Center of Jamaica Foundation, the Teen Hub, adolescent-friendly clinics, the reintegration of teenage mother policy, landmark policies and programs. So we've always been a promising region when it comes on to health. But for this year and onwards, I'm asking for us as a young person to move beyond just being a possibility, but to actually be, to actually move to true transformation. Because if we want a world that is healthier, safer for our young people, then we need transformative policies. Earlier, I mentioned that 10 young people, at least 10 young people die by suicide each day. But I learned today on a panel that only 11 countries in this region actually allow for their young people to access mental health services without parental consent, despite the high rates of suicide. We consider the fact that we have high rates of teenage pregnancy, early year sexual initiation, and that we have issues surrounding our young people not practicing safe sex, etc. But we continue to have inadequate sexuality education programs in our schools. Comprehensive sexuality education does not mean encouragement. Comprehensive sexuality education does not mean encouragement. If it's delivered in an age-appropriate and relevant manner, it can be effective and it can combat many of the issues that we're seeing affecting our young people now. But I'm always the type of person to applaud initiatives as well. And so I must note the fact that we are doing good work in our region. I want to applaud I heard about it just today, that we're launching a mental health literacy program in our schools. That should be applauded. The school nutrition policies that we have, yes, applaud. The school nutrition policies that we have in Jamaica and around the region, that should be applauded. You Matter should applaud, which is a co-created effort between young people and UNICEF, and all the other initiatives that are happening across the region. But I want to big up my young people. I want to big up groups like Jan. Where are my Jan people? Who is practically leading the cause right now in terms of school nutrition policies. Also want to big up HCY. Anybody here from HCY? Right? Persons like Ashley Lashley, who I met recently at UNGA. Ashley, I think I saw you just now, right? Who was fighting the good cause, representing young people there. Also Kobe Smith, my favorite SRH activist, and all the young people here and everywhere who continue to fight for young people and ensure that we have a healthy, safer world. And it's because of all this good work why I'm asking you to continue to co-create with us. A lot of times in spaces that I occupy, whether internationally, locally, etc., I find that sometimes groups, without realizing, I don't think it's intentional, can be very much, I know this is the word I should use, but extractionist. They consult, but then they don't report. They have you help build out these great policies and programs, but you don't help in implementation. You don't help in evaluation. They never really come back to you afterwards, but then they tick a box to say, we consulted 10 youth, 100 youth. We worked with this amount of young people, but was it truly meaningful? So I go back to the question, or rather the statement earlier, of governments being ambitious. Are you going to be ambitious for us? Do you remember when you were a younger person and you wanted your government to do something for you? I find it funny, how when we get older, we forget how we used to fight in the trenches as younger people and wanted things to be done. And I understand there's a lot of red tape in certain instances, and you have different policies and priorities and politics to navigate. But I'm asking you to be ambitious and to work with us to create a healthier, safer world. My final statement this evening is that young people are not the future. I hear that a lot of times coming out in statements that are meant well. Young people are the now, and the issues affect us now. But at the same time, young people are not only being affected by health concerns, we are also powerful enough to effect change. So support us, work with us, and you'll see the incredible things that we'll be able to achieve together. A transformed region, a transformed world, a transformed future. Thank you.
Thank you, Christina, for not only shedding light on the areas that need help, but also for highlighting the progress that has been made. So now I'll call on Ms. Allison Drayton, Assistant Secretary General, Human and Social Development of the CARICOM Secretariat, to deliver her remarks. Ms. Allison Drayton.
Good evening, everyone. Distinguished guests, ladies and gentlemen, I hope that you are all having a wonderful and stimulating time at this second Congress. I wish to extend a special welcome to the adolescent and youth representatives, both those assembled physically and virtually, to this Congress. Today, as we focus on advancing and safeguarding the health and well-being of our adolescents and youth in the region, I am forced to reflect on the significant changes in adolescent health in the Caribbean region. There has been a shift from infectious to social morbidities caused or contributed by social and physical ecological factors in our environment, parallel to an increase in unemployment, underemployment, a marked increase in poverty and economic disparity across this region, reduced health services and violence, including sexual violence, often in our schools. These and other factors have heightened the threat to adolescents' well-being, while some have affected your psychosocial health. And we've just heard very eloquently on this from the previous speaker. An estimated 16% of the total population in the Americas is aged 10 to 19 years. In Latin America and the Caribbean, that cohort is 18%. Reproductive health problems, such as early unwanted pregnancies, HIV infections, sexually transmitted infections, and pregnancy-related illnesses and death, account for a significant part of the burden of disease amongst adolescents and adults. WHO estimates that poor reproductive health accounts for up to 18% of the global burden of disease and 32% for the total burden of disease for women of reproductive age. Those are not good statistics. We've heard during today's discussions of the various statistics indicative to the many studies and assessments being done to add to the body of knowledge and to ascertain the causes and the severity of the health and well-being issues encountered by all of you. But more importantly, to provide the evidence to inform the development of effective programs and interventions, while concurrently determining the possible needed services, health opportunities, and resources warranted to reduce these health issues amongst you or young people. Considerable gains from investments in maternal and child health programs are at risk of being lost unless we make urgent corresponding investments in adolescent health. Data shows that adolescents die every day from largely preventable causes. The data also shows us that many key risk factors for future adult diseases start or are incubated in adolescence. Adolescent mental health and well-being are often overlooked, as several of the previous speakers have noted. Based on the foregoing, a systematic approach for understanding adolescent health needs, prioritizing them in the country context, and planning, monitoring, and evaluating adolescent health programs is needed. This Caribbean Congress on Adolescent Health, Adolescent and Youth Health is an important mechanism that seeks to support the full operationalization of such a desired systemic approach for addressing adolescent and youth health. 6 major areas for attention are mental health, communicable and non-communicable diseases, sexual and reproductive health and HIV, and intentional and unintentional injuries. These are all issues which this Congress is seeking to address. If I am to single out one of these 6 areas, it is important to note that improved quality of care for adolescent and youth sexual and reproductive health, including HIV, is urgently needed. There are, of course, several approaches to addressing this, inclusive of legislative changes, policy changes, and changes to sexual and reproductive health services delivery modalities in keeping with the needs of adolescents and youth. Another important matter, and one very dear to my heart, is the strengthening of health and family life education in the Caribbean to ensure an age-appropriate, culturally relevant approach to teaching about sex and relationships by providing scientifically accurate, realistic, and non-judgmental information. The characteristics of an effective, comprehensive sexuality education curriculum relates to the appropriate development of content as well as its adequate implementation. The most recent scientific evidence demonstrates that such education can help to delay the initiation and frequency of sexual activity, reduce the number of sexual partners, increase the use of condoms, and reduce sexual risk-taking. Peer-to-peer education has an important role to play in advancing the understanding of adolescents and youths. I don't need to tell you that the youth cohort frequently feels more comfortable asking questions of each other, and I fear to say often getting much more informed information. You all have a critical role to play in this regard. This is especially important in terms of combating the misinformation spread on social media, which sadly is often the primary source of information, even more so in our region where parents don't want to discuss sex with their children and teachers balk at teaching it. Back in 1994, the CARICOM Standing Committee of Ministers of Education passed a resolution supporting the development of the Health and Family Life Education Program, noting the escalating vulnerabilities and health and development challenges faced by young people in the region, and the role the school could play in addressing these and in meeting the needs of young people. I am pleased to advise you that just a few days ago, the CARICOM Committee of Ministers of Education agreed to strengthen the delivery of HFLE as part of our collective contribution in addressing adolescent and youth health in the Caribbean. Preserving, protecting, and facilitating your development is important to our region's wealth. Only by investing in your health and well-being can this region reap success, but most of all, sustain our development. As such, the CARICOM Commission on Youth Development acknowledges the value of you, our young people, given your unique perspective, creativity, and energy, and recognizes your value as partners in development. I really want to echo what the previous speaker said. It is not about the future, it is about the now in terms of the involvement of young people. The CARICOM Secretariat heralds youth empowerment and participation. Through the CARICOM Youth Development Action Plan, we seek to improve regional youth development policy infrastructure and landscape by supporting member states in providing access to quality education, economic empowerment, environmental sustainability, health and well-being, and the creation of platforms to foster greater appreciation and awareness of our Caribbean identity, culture, and citizenship, and thereby endorsing the protection of your rights, your safety, and your security. The Secretariat looks forward to continued collaborations across the Caribbean to support the health and well-being of adolescents and youth, as well as the sustainable development of the Caribbean. Investing in adolescents is central to our development. Thank you.
Thank you so much, Mrs. Drayton. All right, so just a brief announcement before I move forward with the program. If you've left your cell phone in the ladies' washroom, please see Dennis. Oh, got it? Awesome, awesome sauce. Very good, awesome. Are we ready with the presentation? We are? All right, so at this time, we're going to take the video presentation. Ready? Okay.
Join us as we take a look back at the first Caribbean Congress, which was held in Trinidad and Tobago in 2019.